I am State Representative Jonathan Steinberg from the 136th District of Westport, co-chair of the Public Health Committee, and welcome to a meeting of the Public Health Committee to move bills out of this committee. I am joined today by my esteemed co-chair, Senator Mary Doherty Abrams. Good morning. Do you have any comments this morning?
Good morning. I just want to say welcome to everyone. I'm anxious to get started, and it's a pleasure to co-chair this committee with you. Thank you.
Thank you. Before I go to our ranking members, I just want to say that we do have, I think, 10 items on today's agenda. There are other committee meetings taking place at the same time. And for that reason, as we traditionally do, we will leave the votes open for roughly 1 hour beyond the conclusion of our deliberations today, for those who may not have had an opportunity to vote at the time in which the bills are brought up for that purpose. Let's go next to Senator Wong. Good morning.
Thank you, Mr. Chair. And I'm indeed honored to be on this committee as well. And I'm eager to get to work. And I appreciate you acknowledging that there are many other committee meetings that people may be in and out. That doesn't mean we don't care deeply about these issues we're voting on. So thank you very much. Eager to get to work.
Thank you, Senator. Good morning, Senator Summers.
Yes, good morning, everyone. Welcome to the Public Health Committee meeting today. We have quite a few things on the agenda, so I'm looking forward to the healthy debate that we will have and getting started. Thank you.
Thank you, Senator. And last but certainly not least, Representative Pettit. Good morning.
Good morning, Representative Steinberg. Thank you. My only comment would be if I disappear, it's because my computer is being uncooperative. So I'm on my phone at the moment trying to get my computer booted up again. Thank you, sir.
Thank you. Bad timing, I suppose, but we will bend over backwards to make sure that that's not an impediment to your contributions today. We will start right in then with the first of two bills, which relate to the religious exemption in vaccines. I should add that the one is a JF and one is a JFS. The bills are identical. One has a Senate orientation and one has a House orientation, but the actual contents, the languages are identical. We will begin with Senate Bill 568, an act eliminating the non-medical exemption to the immunization requirement. This is a JF to the floor. Do I have a motion?
So moved.
Second.
Moved and seconded. I would submit that you probably had been living in a cave in the state of Connecticut for the past 2 years to not be aware that this bill has attracted a lot of attention. The reason for the existence of this bill, which eliminates the long-standing religious exemption while adding a number of other changes, such as a more robust medical exemption and other things to promote greater dialogue and rapport between families and practitioners, is because of the incontrovertible and concerning trend we have seen in our communities, whereby the percentage of religious exemptions has risen over the past decade. This poses a threat to the public health. We as the Public Health Committee are here today to address that problem by acting proactively and promoting vaccinations, which have served this state and this country for decades as both safe and effective. We are heading off any prospect of a problem because of the increase in religious exemptions. If this was not front and center for many people a year ago, I would submit it certainly is now. If people have not personally experienced what a pandemic is like, the impact on families and friends, they now know. If people don't realize that pandemics are real, they're not a hoax, they have a huge impact, not simply on our health, but our entire society, they know that now. I would have hoped that because of this tragic experience for so many of us, there would be a renewed faith and support for vaccines in our community. Unfortunately, I could argue that's not the case, which has only, in my mind, reinforced the importance of this piece of legislation. Bear with me while I go through some of the sections of this bill for the benefit of committee members who may not be aware of some of the changes that have come about since the original House version, and for members of the public. This bill eliminates the religious exemption from immunization requirements for individuals attending public and private schools, including higher education institutions, as well as child care centers and group and family daycare homes. It grandfathers individuals enrolled currently in the 7th grade or higher who submitted a religious exemption prior to the bill's passage, and we'll talk about that later. Individuals with prior religious exemptions who were enrolled in the 6th grade or below generally must comply with immunization requirements by September 1st of 2022, roughly, or 14 days after transferring to a different school or child care facility. However, importantly, we do allow children to extend the time frame within which they must comply with the immunization requirements if they present a written declaration from the child's physician, PA or APRN that an alternative immunization schedule is recommended. So we keep that window open. It requires the DPH develops and posts on its website a medical exemption certificate for use by physicians, PAs, and APRNs as standard form. It requires DPH to release an annual immunization rates for each public and private K through 12 school in the state, provided such data does not include individually identifiable information. Again, it will be aggregated. Establishes an 11-member DPH supervised advisory committee on medically contraindicated vaccinations to advise the commissioner on issues concerning medical exemptions from state or federal immunization requirements. To be very clear, this is a broad issues-related advisory committee. It is not an appeals court for a decision on any medical exemption for or against. It will not scrutinize the medical exemption history of any individual. This also requires the advisory committee to meet at least biannually and report to the Public Health Committee by January of 2022. And DPH, in collaboration with the State Department of Education and the OEC, to evaluate data they collect on exemptions from immunization requirements. And those agencies jointly report to the Public Health and the Education Committees on this evaluation annually, starting by January of 2020. And lastly, requires certain health insurance policies that cover prescription drugs to cover at least a 20-minute immunization consultation between a patient and provider for CDC recommended vaccinations. Let me stop on that one for a moment. This actually is intended to extend and enhance the dialogue between families and practitioners to have the very conversations we know are so important to families, to discuss their reservations and concerns, for doctors to share information about the science and the medicine, the effectiveness and the safety of vaccines, to discuss potential concerns with regard to previous reactions by that individual, family history, or genetic predisposition as indicated by actual genetic testing. I should add, these words are new to both versions of this bill. We have a more explicit and clear path to a medical exemption. It is really left up to the families and the practitioner, ultimately the practitioner, to determine whether a medical exemption is warranted. But our goal is to enhance that conversation, that rapport, to avoid tense moments in practices between families and practitioners, and to lead ideally to more families finding a path to vaccinate their children, even if that may involve agreeing with the practitioner to an extended vaccination schedule to meet that individual child's needs. There are a number of other elements in this bill. It is 25 pages in length, but I think you will find that most of the bill is actually existing statute, which is because of legal language repeated over and over again. I hope everyone has had an opportunity to review not only the bill, but also the changes that have come about most recently. These revised language, this is a JF, the House version is a JFS, reflects input from many people. And whereas it may not be perfect, we believe this is the legislation that needs to become law here in the state of Connecticut. I'll ask my co-chair if she has anything she'd like to add.
Thank you, Representative Steinberg. No, I think you did an excellent job reviewing this piece of legislation. So thank you so much.
Perhaps there are some questions or comments.
Mr. Chairman?
Representative Jenga has his hand up.
Okay, I have no screen for putting my hand up.
Okay.
We will know, Representative Betts, that you wish to be in the queue. I will have you following Representative Carpino. You can make a note of that. First, we have Representative Jenga, followed by Representative Scanlon.
Representative, you're on mute.
You can do it, Representative.
Okay. Thank you. Am I okay now?
You are more than okay. Though you seem to be echoing a little bit.
Thanks for the opportunity to address this issue, which is a concern to all of us. The Center for Disease Control in Atlanta has stated that the immunization levels in primary and secondary schools must rise above 95% to keep our children safe. Recently, this level has drastically fallen and more people are in danger. These bills preemptively address this looming public health crisis. The science is clear and not misused in these proposals. It is not a matter of risk, but of known danger, that if immunization continues to fall, people with pre-existing medical conditions will be exposed to life-threatening illnesses. Colleagues have expressed the need for religious exemptions for vaccine, but I believe this is a misunderstanding between process and results. You have a right to a religious expression and affiliation as an American. Carrying out this sacred right by enjoying worship and spiritual community is a process we all protect and share. Exposing those with pre-existing conditions to life-threatening illnesses is not a result which we have a right to. There are those who are not capable for medical reasons to receive various vaccines. In an ideal world, we could all be vaccinated and protected from illness, but we must reduce the danger to individuals who are not protected. Seeing there is no scientific evidence for any significant risk to those receiving vaccines, the choice is clear for us to make. We must protect each other and our children. We should also consider those who have received vaccines, but are also vulnerable to illness. People with diabetes and other autoimmune diseases make up many households in our neighborhoods. While they may be vaccinated, they are also vulnerable to the spread of illness, and some are not able to receive vaccines for separate medical reasons. These children have a right to their education, and they shouldn't have to sacrifice their health to do that. Because we're in the middle of a public health crisis, it's even more important that we take a firm stand on the efficacy of vaccines. We need to keep our most vulnerable residents in consideration whenever we pass legislation. These bills are safeguards that will help prevent the spread of damaging disease in our schools and in our communities. Thank you for this opportunity.
You're on mute, Representative Steinberg.
I made the mistake early today. Representative Scanlon, followed by Representative Carpino.
Good morning. Thank you, Mr. Chairman, and good morning, everybody. As people who were on this committee last year will recall, I and Representative Cook and a few other folks put forward an amendment last year to do a couple things, some of which are reflected in the bill currently before us and some of which are not last year. But one of them was to grandfather all children who are currently enrolled in a K through 12 school in Connecticut. Let me just say that I 100% support the science of vaccines. I cannot wait to get my appointment tomorrow at 6 a.m. for my own vaccine for COVID. And I am in the process of vaccinating my young son as we speak. We just went to the pediatrician last week. So in no way what I'm about to say can be construed in any way that I don't support the science of vaccines. But what I do have a little bit of a problem with is the notion that children who cannot make a decision for themselves will be the ones who are hurt by this decision, and if we don't grandfather all of them in together. And I do believe that we must do that going forward, and I will continue to work towards doing that going forward. So I will support the bill today, even though I am disappointed that it is only 7th grade and above, but I will continue, along with Representative Cook and others on this committee, once this bill gets to the floor, to put forward a suggested change, an alternative to this bill, to ensure that all of those children would be grandfathered. Going forward, I believe that the choice is clear. Any parent who has a child that's my son's age or has not had a child yet would know full well what they are facing, and they can make life decisions accordingly. But parents who already made the decision based on what was in current law at the time, I just am finding it hard to accept that they should have to have this changed on them in the time being. I believe that this is going to be a problem. I believe that the hesitancy movement is creating problems down the road. But in this moment in time, I do believe that we have got to make sure that we both change this so that going forward, we can protect the public health of our schools. But I also want to make sure that we're doing that in a way that is compassionate towards the children who are the ones who will have to deal with this based on a decision that they themselves did not make. It's their parents made it for them. I believe that that was the wrong decision that they made, but they made it nonetheless. And the children are the ones that I'm thinking about today and was thinking about when I put forward that amendment last year, and will obviously continue to think about them when we work forward on this bill when it comes to the floor of the House. So I will be supporting this bill today, but I do look forward to working with colleagues to try to make sure that we are keeping all of those children who are currently enrolled in school today grandfathered going forward. Thank you, Mr. Chair.
Thank you, Representative. Yes, indeed, we thank you for these comments and for your consistency in advocating on behalf of this legislation, and also ideally trying to be fair to all children in the state of Connecticut. We appreciate your support of the bill getting out of committee. As with so many bills we've talked about this session and in prior sessions, this is not necessarily the final language, and we welcome the opportunity for further dialogue to discuss any changes, including perhaps some changes to the grandfathering requirement. And again, urge all members to support the bill as is, even if we were to contemplate some changes after movement from this committee, assuming that it does move forward. Next up, we have Representative Carpino, followed by Representative Betts.
Thank you, Mr. Chairman. I too am disappointed, but perhaps for different reasons. I'm disappointed that this has become a bit of a game, that based on my rough count, 2,600 bills were introduced in the House and the Senate in 2021. And perhaps we were less judicious about the topics in 2019. My count shows more than 3,500 bills. The fact that there are two separate bills, one for each chamber, is disingenuous at best. And in my personal opinion, it's a game. And frankly, it's a game I am not playing. So I will not vote for the Senate bill based on the fact that we should not be playing games with the public who need to understand what is happening. And my disappointment also continues for members of this committee who have suggested that those who may vote against this bill do so because they are afraid. Sir, I have been called many things in my tenure here, but being afraid to vote for something is not one. So I have comments on the underlying bill, and I will share them on the House bill. But since disappointment had come up, I thought it was only fair that I shared mine as well. Thank you, sir.
Thank you, Representative, for your candor. I assure you that this is not gamesmanship. If anything, it preserves simple flexibility for scheduling such a bill in whichever chamber is able to deal with it. I'm sure many of you are aware that there's a desire to move this bill through both chambers as expeditiously as possible. And this particular process was intended to facilitate that. With regard to your other comment, it's indeed unfortunate that I think probably every member of this committee, if not every member of the legislature, has received not only heartfelt, earnest emails and letters with regard to people's feelings about this bill, but a lot of unfortunate, perhaps even nasty comments. And that really has fallen on both sides of the equation. Frankly, I was unaware and am disappointed by anybody asserting anybody's motivations for or against this bill. I think every member of this committee has entered into this process with absolute sincerity and desire to do the best by the people of the state of Connecticut on a very difficult, complex issue. And for anyone to assert that someone is acting out of something other than the desire to do best by the people of the state of Connecticut, I find disappointing, and I stand against it. And I am eager to restore the dialogue to a level in which we're talking about the merits of the bill and not about personalities, not about motivations, not about even politics, though obviously that enters into it. So all I can say, Representative Carpino, on behalf of all the members, not just of this committee and the legislature, we're sorry that such language has been used. Frankly, I'm sorry about a lot of the language that has been used and may still be used between now and the time this bill comes to the floor, assuming it does. We do not condone it. We find it contrary to the spirit of this legislature and the interests of the people of the state of Connecticut. And I cannot say it in more emphatic terms that that should not happen. And we will make every effort to clarify exactly what we're doing here. So thank you for that testimony. Representative Betts, followed by Representative Kavros DeGraw.
Good morning. Thank you, Mr. Chairman. I have a number of questions, but the first one is if you could explain to the committee and to the viewing public the need for having two bills with the exact same language. That is not the common practice, as we all know, in committee procedures, and it conveys the impression that there's a concern that the bill is going to have trouble getting through a chamber. If we were to use this as a common practice, then why are we not doing it with all the other bills that are controversial? Can you explain to, certainly to me, but to the public, the necessity for having two identical bills being voted on at the same point?
Thank you, Representative. I believe I just did, but if I lack clarity, let me try again. The reason why we have two versions of this bill, and by the way, this is not standard practice, we'll fully admit this, is to facilitate it being called before one or other of the chambers at earliest opportunity. Understand that we are in a somewhat different constrained environment for moving of bills this year because of the pandemic. It's conceivable we will be able to move forward fewer bills than in the past because of those constraints. It was decided that it would facilitate scheduling of this particular language for passage in one or the other chamber if it was available to be called in one or the other chamber. That's it. No other motivation, no gamesmanship. It was an extraordinary, unusual, perhaps one-off instance whereby we have facilitated this option because of the exigencies of the schedule that we're now dealing with. I hope that adequately answers your question, Representative.
Yeah, thank you for your response, sir. But I've been here for 12 years now, and I'm well aware of the advantages of being in the majority in both the House and the Senate, as well as the power of the Speaker and the President of the Senate. I am very hard pressed. In fact, I know that if something of great urgency needed to be done, that you and the leadership have the ability and have done so in the past on very short, limited notice, been able to insert important bills that you consider to be a top priority. And there's nothing that I'm aware of that prevents you from doing that again this year, COVID or no COVID. And we've already done that, as a matter of fact. So with all due respect, I know that your leadership clearly has the votes to do it anytime they want, at any point. And that is the reason why I really believe it. I don't care if it's the House or the Senate. I think it should be one bill and debate one bill.
If I
But
might
that's your
respond
choice.
just briefly, Representative. First of all, this is my first pandemic, so I can't really speak to the experience of having to adjust to the pandemic's limitations. And I do think that's extraordinary. Secondly, I'd be willing to venture that many would complain if we attempted to insert a bill of this magnitude into the process. And rather than pull, as you might describe it, a last minute, power play, we're being very upfront and transparent about the fact that we are prepared to call the bill in either chamber. One could argue this is preferable to an insert, as to which you allude. Thank you, Representative. Please continue.
Okay, thank you. And certainly I respect that decision, even though I don't agree with it. A couple of questions I'd like to ask. One is, this bill has been up for 3 years. It's been an ongoing issue and debate. Sir, could you tell me what other options have been exercised to try and meet a higher compliance rate? And am I not correct that the latest numbers are that the compliance is 95%?
Well, I think you make an important point, Representative, and I appreciate your asking it. It's generally agreed among professionals that a 95% herd immunity rate, I prefer to call it community immunity. I don't like being treated like cattle. Community immunity rate is necessary to afford real protection for the community from the ravages of a potential epidemic. However, even though the state may be approaching or at the 95% level on an aggregate basis, analysis of the data shows quite clearly that many school districts, and most importantly, individual schools, fall significantly below that 95%. We cannot afford to simply look at the broad strokes of the overall state. We have to look at the risk in individual communities. And at various points, there have been in excess of 100 schools that have fallen below that 95% level, where we see real risk.
So what, sir, along that line, what has been done to address that problem with those 100 schools? It seems to me that law should be a last resort. So surely something's been done and has failed. And I would just ask that you share that with the committee and the public. What steps specifically were done with those 100 schools, and why did it not succeed?
Well, I can't speak for chapter and verse. Both the Department of Public Health and the School Department of Education are the most directly involved with those efforts. Suffice it to say, efforts to educate, and also I should probably throw in pediatricians and those in pediatric practices, efforts to educate, to explain to people the importance of vaccines, have in many instances lost out to the onslaught of the internet, where all sorts of misinformation, I would call them disinformation, exists, which have naturally alarmed people as to the safety and effectiveness of vaccines, to a level that the dialogue, which we think is so critical to allow people the opportunity to come to some sort of understanding about the importance of vaccines, has broken down. You've heard, as I have, pediatric practices where matters have gotten so tense that families have been kicked out, because we've gotten to the point now where there's no longer effective dialogue. This bill, in some ways, is intended to try to redress some of that, to restore rapport, to restore dialogue. But efforts that we would have thought would have been sufficient to convince a number of people of the importance of vaccines and the safety of vaccines have really failed to connect. And I think, just in my personal opinion, this is directly the manifestation of the disinformation efforts that take place on the web that seem very compelling, very slick, cherry-pick data, make people very concerned, make them very scared. And fear is a highly motivating emotion for so many of us, particularly as it relates to our children, who we want to protect to the utmost. And because of what's going on the internet, because of these very dangerous sources of misinformation, the entire ability of our community to have an effective dialogue and to protect the public health, to honor the social compact, have broken down. So our honest, best efforts to promote vaccines in the traditional manner that has worked for us for 50, 60 years no longer seem effective.
Well, Mr. Chairman, thank you for that, but I was looking to see what specific schools or what specific efforts had been undertaken and had they failed. I know, for example, in my area, whenever we wanted to talk about DUI or the DARE program, we would go into the schools and we'd be in an auditorium and we'd explain the situation. We'd have slide presentations and people had the opportunity to learn about that. Has that taken place in these 100 schools that you cited in terms of trying to educate people about the pros and cons of vaccines? And if so, where?
Thank you for the question, Representative. I am not aware of specific efforts in individual schools, so I really couldn't answer that.
Okay, well, I'm just trying to understand, you said efforts have been made, and I'm trying to understand what those efforts were, and do we need to do something to make them better or more effective? But I'm not personally aware, and this is the reason why I asked the question, I'm not personally aware of what those efforts are, where they've taken place, or have they succeeded? And if they've not succeeded, what's been done to modify it? Because that seems to me, as you said before, education is a very important, valuable tool. And if we're not using that and we're replacing it with a mandate or a law, I totally disagree with that approach. And
Representative, I'm sorry, I didn't mean to interrupt. If I could answer your question a different way, because obviously my first effort did not suffice.
okay,
Allow me to try to clarify. In my opinion, it is not the responsibility of the school district or the school principal or teacher to take on that role of educating the individual. Their contact is with the child. The dialogue needs to take place between the family adult and the appropriate professional. And that takes place in the medical context, not in the school context. The appropriate dialogue needs to take place between practitioners and families. Ideally, that would be the authority that is trusted and has the information at hand to share with the family to help them understand why it's so important to get their child vaccinated. So to be absolutely clear, that's what our emphasis on is this bill, is that interaction between the medical professional and the family. To put the onus on the school to do that kind of education, I don't think is the direction we want to go. If that answers the question.
I've served on a board for education and I respectfully disagree, but I won't go into that because I know we've done things specifically that impact both the child and the parent because we're one whole community. And we've had very positive dialogue, even though there may be disagreement. But along that line, has there been any meetings, forums, or anything with the medical community and the parents, as you suggest, to discuss this problem? And if so, where?
Obviously, we have had a lot of conversations with the medical community, with the Connecticut Association of Pediatricians, as well as other practitioners. We have spoken individually, we've spoken collectively with the medical societies. We've really put it on them. You know, we've heard a lot of things out there about how they are just unilaterally kicking people out of practices, not having the conversation, have no patience for any of this. And some of the aspects of the bill reflect that interaction. The emphasis on reimbursement for an extended consultation is a direct result of that, because we recognize that thanks to managed care these days, the opportunity for a real discussion between families and practitioners is grossly limited. very different from a generation ago. An 8 to 15-minute appointment is simply insufficient to have these kind of conversations, which is why we've added this aspect to the bill. We are putting tremendous focus on building rapport and trust, which to some degree has been damaged by a lot of the misinformation that have reached families. So I can't tell you specifically what each practice may or may not have done. I will tell you that based upon what we've heard from a consultation with practitioners, they're at their wits' end. They have tried to, with their limited means, have these conversations, though I will admit there are probably some practitioners out there who are not having these conversations. And we're hoping that by some of the stipulations in this legislation, we will encourage them to once again have these conversations, because not only will they be reimbursed for their time, we will give them guidelines for how best to have these interactions without escalating tensions or misunderstandings. So I can't tell you specifically that there's been some sort of broad scale organized effort on behalf of every practitioner, because it's simply not something we can do. But the medical societies are very aware of it. The Association of Pediatricians are very aware of it. APRNs and PAs live with us on a regular basis. This is a problem which is growing, and we're trying to contain and actually ameliorate through some of the language in this bill.
Well, thank you, Mr. Chairman, for that. And speaking of which, of it being a problem, if we have 95% rate now and perhaps 100 schools that are not in full compliance, is this law going to achieve what I assume is the goal, is 100% compliance? Will this law meet that goal?
I live for the day, Representative, where any piece of legislation that we pass achieves 100% compliance. It is an aspiration. It is certainly our objective. I would venture that we will probably fall short of 100%. But if we are not absolutely vigilant in trying to get every child who can be vaccinated, then we have fallen short. Suffice it to say, our objective is to push the vaccination rates well above 95%, so that on an individual school basis, no family, no child will have to worry about going to a school where they're at risk. That is the goal here.
Okay, well, I think I agree with you. I think 100% would be almost impossible to attain, much less sustain. But previously, Representative Ganga, if I understood him correctly, said that these are life-threatening diseases. Has anybody died during this period from any disease over the last 4 or 5 years that you're aware of?
Representative, I'm really glad you brought up this issue, because we've heard it over and over and over again from those who are concerned about this legislation. I think it stems from a basic difference of understanding about what vaccines do and what epidemics are like. The mere fact that we have not had an outbreak, that we have not had a serious problem, that entire generations now have grown up not experiencing the fear of an epidemic, are a testament to the success of the vaccine program. We can't really prove the negative or suggest that there was something totally different and other than the program that we've endorsed for close to 60 years as being the cause for having no epidemics in the past 4 or 5 or longer periods of years. However, if you read the news, you've seen evidence in other states and certainly in other countries where vigilance has waned and people have gotten lax, that there have been vectors of disease that have approached or achieved epidemic proportions. In many third world countries, this still remains a significant issue. And I can go no further than to look at the most recent statistics in the state of Connecticut. When people are not vigilant, when they don't adhere to good science, we start to backslide. The state of Connecticut is now 3rd highest in its rate of infection for COVID. Now, this bill has nothing directly to do with COVID, but it is indicative of how important it is never to relax our vigilance when it comes to highly communicable diseases. And in this instance, the mere absence of the fact that there hasn't been an epidemic should be considered a positive for this legislation, because in my mind, it's clear evidence that vaccines have been effective in keeping epidemics from occurring.
Well, I share that to a point, Mr. Chairman. Thank you for your answer, but not everybody agrees with this, and I respect that, and I accept it because I know they're very sincere. But I will also share with you the reason why I emphasize the need for education and facilitating communication is I'm a member of the Rotary Club. And the Rotary Club internationally has for decades tried to eliminate polio, and we're down to 2 countries now. And one of them that recently got everybody taking polio was in India. And the reason they were able to do it, because people over there would not do it, they were scared to death of doing it, was through education, through one-on-one meetings, answering people's questions, showing them the pros and cons of doing that. I do not believe that that effort has been undertaken in the state, nor have we seen an epidemic, nor is this necessarily the appropriate time to do it. And I question if I'm qualified or it's my role to go and take the rights of other people who disagree with me to do this. And I am really, really disappointed that we are really overriding what is a very large group of people who don't agree with us and making this a law rather than trying to find an alternative, which to my mind has not really been done yet. And I certainly don't agree with the notion that the Board of Education and the school system cannot play a very important, valuable role in this. And we can also do things at hospitals as well. So, Mr. Chairman, I feel very strongly that this is not the last step. It's not the point where we should be doing this. We do not have any deaths that I'm aware of. We don't have a pandemic, and we have a lot of people who object to what's in this bill and the penalty for doing it. And frankly, just because somebody may disagree with me, I don't think I have the right as a government official to take away their ability or for the kid to be able to have an education. So I'll talk about this more on the floor, but I certainly appreciate you taking the time to answer these questions, and I'll just listen to the rest of the debate. Thank you very much, Mr. Chairman.
Thank you, Representative, for your thoughtfulness on this legislation. I think we all agree that education remains a component that we want to emphasize, and in fact, that is in this bill. Representative Kavros DeGraw, followed by Senator Anwar.
Thank you very much, Mr. Chair. I would like to align myself with the comments of Representative Scanlon. While I was not here previously, I do think that it's important. I am myself a mother, as are many on this committee are parents. I think about the ages of my children, and if I had rewound the clock, and if I was someone who was using a religious exemption, what that would mean in terms of the spacing, the ages of my children, and who might be left out and who might be included. So I do hope that we strive to improve this bill. Having said that, though, there is no doubt about the science. And in fact, I do think that now is the time, and I say now is the time because we've recently heard from the CDC that the volume of regular vaccines that you would get at a pediatric well visit is significantly down, and 20% of the vaccines, and this is in the millions, are the MMR vaccine. I am glad to see that the medical exemption has been strengthened in the way that it has, because I have sat with these parents who have not been able to get medical exemptions. I have sat with parents who, instead of using the medical exemption that they feel that they absolutely need and are entitled to, have had to use the religious exemption. And it is important that doctors have that precious time to engage with their patients. And I think that that is the education point which Representative Betts has so clearly defined. Perhaps we are in a situation where, yes, we do need more education. I do think we heard during the 24-hour hearing that there are some folks who said no matter what, they're not vaccinating. They don't want to be educated further. And I can understand that. They have their views on this. But certainly we know that there is a lot of misinformation out there. We know that even the Russians have gotten involved in discrediting the Pfizer vaccine for COVID. As you said, that's not what this bill is about, the COVID vaccine. But I do bring it up because I think that in the age of the internet, when everything can go viral so quickly, it's really important that we are spreading and sharing accurate information and scientific information and the data that supports all of that information. I was a child of the 80s. I remember the DARE program really well, and honestly, it didn't work very well. So I think that we have to be careful about just thinking about education programs. And I do appreciate that the one-on-one with the doctor is probably the best way to do that. So I look forward to seeing how this bill might change when it does get to the floor. I really appreciate all of my colleagues. I think that this has been a fascinating process. I certainly have been very engaged in the process, whether it be through the public hearing, the voluminous emails we receive. And I will say that there is a significant portion of the population that was not present at the public hearing that does feel that we are in a situation where we need to have the religious exemption removed. And I think that their voice has not been heard as loudly, but it is certainly an important voice in the discussion as well. Because I have children in my district, as I'm sure you do in your districts, who have either received organ transplant. I have one young lady who was able to get one MMR, but after her transplant was not able to get others. The booster doses. I have another one multiple actually, that have brain tumors that are concerned. I have teachers that have reached out to me concerned about their own immune systems and that they are immunocompromised and need that herd, or I think you called it community immunity. And so I think that, we have had a lot to weigh. And I think that we have all been thoughtful about this process. And I certainly hope that we continue to be, because we do know that this affects people's lives. And I think that we are all striving to lead with as much empathy as we can. So I thank you so much for the time today. And I look forward to hearing from my colleagues.
Thank you, Representative, for those comments and for highlighting some of the important aspects of this bill. Senator Anwar, followed by Senator Wong.
Thank you so much, Mr. Chair. I just wanted to make a comment. It's pretty clear that we as a committee are conflicted. We are divided, but I want us to look at it from the perspective of the fact that the proponents of the bill and the opponents of the bill and the people who are not only in the community, the parents that we had heard from, they're all coming from a place of love for the children and protection of the children. And I think we have to keep that very much front and center in our deliberations because when somebody comes from a place of love, we have to respect that. And I think how we communicate with each other today and how we communicate within the meeting and outside of the meeting as legislators will have an impact on how the community will interact on these differences of opinion and passionate differences of opinion. But again, when we realize that we're all coming from a place of love and protection for our most loved relation that we have as humans, that would allow us to do this with humility and with respect. Thank you so much, Mr. Chair.
Thank you for those comments, Senator. Yes, I would agree with you that I would venture that virtually all of us are conflicted for those very reasons. That there's nothing more important than the family bond and protecting one's kids and doing all we can for them. That's part of the American dream, and that does make any legislation that imposes limitations a challenge for us. And we've arrived at this moment with sober intent because of the concerns we have about the future of children in the state of Connecticut if we choose not to act. Next up is Senator Wong, followed by Senator Summers.
Thank you, Mr. Chair. And as a new ranking member in the Public Health Committee this session, I have learned so much and really appreciated the experience, insight, and the leaderships of Chairman Abrams and you, Representative Steinberg, and my fellow ranking members, Dr. Pettit and Senator Summers. And the work that we do in this committee is extremely important to Connecticut residents, especially during these insidious and challenging COVID pandemic times. And I do agree with you, Mr. Chair, that the emotions and the personal attacks has no place in the legislative process for the work that we are all striving to do. And I came into this vaccine on religious and personal exemption debate with a real fresh perspective. As a new member, I was kind of hopefully unvarnished by the tumultuous passionate, heated debates. And hopefully with an open mind and cognizant of the important duty that we have as legislative leaders in this committee. So let me be emphatically clear. My children, now 26 and 22, received all the required vaccines during their school experience. I believe and support vaccines. I have received my COVID-19 vaccine and encourage everybody else to do so. I genuinely believe in the science of vaccines. As the co-chair, along with Representative Steinberg of the Connecticut General Assembly Bipartisan Bioscience Caucus, we understand the contributions and the improvement to public health and a better living occurs through our bioscience initiative. So I support our bioscience companies and their scientific innovations. And a great example of that is the COVID-19 vaccine by Pfizer that's created right here in Connecticut. And again, and taking the vaccine, I'm grateful and relieved, okay? COVID-19 has impacted my perspective and so many others on public health and has done so many different things from a standpoint of changing our perspective, as Mr. Chair allayed to. But this bill is not related to the COVID vaccine or the COVID pandemic. It is critically important for people to know that House Bill 6423 and Senate Bill 568 are identical bills, and they're strategically designed to go to both chambers of the General Assembly. And it has nothing to do with the COVID-19 vaccine. It's important for people to know that, because unfortunately, sometimes in the broader dissemination of this information, we're tying it to people who may or may not object to this, to the COVID pandemic concerns. The focus of these bills are on the elimination of religious exemptions from nearly 70 plus immunization requirements for children that are going to be attending public and private schools, including our higher education institutions, which we not heard a lot in our testimonies, and also childcare centers and groups, including family daycare homes. You're going into people's family daycare dynamics where state government is having an impact on those type of gatherings. And as I said earlier, I came into this issue with an open mind. And I just simply want to offer my observations leading to today's vote. And let me be clear, these are my thoughts. First and foremost, the process. Our chairs, who I've grown to genuinely enjoy working together with, control the agenda. And these bills became an overriding goal of this committee to do, regardless of the opposition, the views, and perhaps some merits of the arguments. It seemed the fate of these bills were predetermined, leading to some who would even say that it was a rigged process all along, and the opposition never had a chance. I genuinely hope that was not the case. But unfortunately, the legislative process, despite the challenging COVID and Zoom meetings, did raise some flags to me. I want to talk about some of them. One, the limitation of public hearing to 24 hours, leaving nearly 1,800 people's voices unheard. Although I know the insistence that we could read the testimony, and I did indeed read the nearly 3,500 submitted testimonies, it just was not a transparent process of having people's voices be heard. It is controversial, but again, process. The second, the coincidence of expert representatives from our state's public health and education departments, whom both were not available during the public hearing to address relevant questions from committee members. In fact, we have yet to receive answers from either department on nearly 4 pages of public policy implication questions. This kind of delay, this kind of coincidence is raising questions to me of what are people not willing to answer? The belief of so many disenfranchised residents who felt their voice and deeply held personal body decisions were not respected or heard is quite evident in this process that I noticed and experienced. Now, I understand that there's a greater public health consideration to these bills, and I'm fully conscious of them, from the fear and the contagious spread of infectious diseases, especially during this COVID pandemic. And despite the chair's citation of incontrovertible facts toward the greater public health, I wanted to cite one public testimony that had an impact on me. I was very impressed by the testimony of a strong advocate of these mandates, Dr. Ross, who responded when asked during the public hearing we had do the current immunization rates pose an imminent public health risk? His answer was an impactful no, despite his reinforced support that these mandates and a greater awareness and education toward vaccination is essential. It's important to note that because what is being cited has an urgent, immediate public health risk was not truly evident, and we don't have the data to support it. The other fact is, if we're looking to grandfather particular children, does it not counter to the argument of the sense of urgency and the greater public health risk? So for those of us that are looking to grandfather it as a compromise, it defeats the argument of the urgency and the risk that is being purported. Ultimately, I can't support either of these vaccine mandate bills because for me, despite my own personal belief in vaccines and the constant theme of greater public health, as I said in the earlier part, I believe in vaccines. I believe in vaccinating my children, but these are my decisions. We must balance those kind of greater public health concerns that's cited by the chair and advocates of these bill with personal body choices, that the decision as to what to inject into themselves and that of a parental right to do what is in the best interest in their mind for their children should never be overreached by state government. For those of us that believe in personal body rights, such as a woman's body choice on abortion rights, 2, an individual's right to dignity and death decisions, we have said that personal body right decisions needs to be balanced with the state control and mandated for the greater public good. So for that reason, I'm guided by these principles of individual personal body rights and encourage that we should educate and raise awareness toward the greater public health benefits and concerns in alleviating the risks. But to deny a child and their family the opportunity to receive an education, which is a Connecticut constitutional right, is an overreach of state control, believing and citing that state bureaucracy and political leaders know better on how to protect and parent childs. So enough said on that. As you will see in this debate, there are not a lot of questions being asked. The debate has been full-blown and visible, and feelings are pretty well entrenched. But I want to thank Mr. Chair and my committee colleagues for the opportunity to share my thoughts. And as we're about to definitely end March with a lot to think about into the rest of this legislative session, I ask that this is not a Democrat or Republican issue. It really is a balance between whether the state ultimately in their belief in what they're doing is in the best interest of the greater public good overrides the personal and body choices of parents and individuals. So I will not be supporting these 2 mandates, but I felt it was important to share that it should not be construed as being an anti-vaxxer, in being a lack of concern and awareness for the greater public health risks that we're currently in right now and any future health pandemics that we may have. But we have an important balancing act to maintain here. And I hope that we will pause and deliberate and create better solutions that incorporate everybody's perspective into this. Thank you, Mr. Chair.
Thank you, Senator. Let me respond to a number of your comments. I had promised myself I would try not to get emotional today, but I can't help but react to the use of the word rigged. Whether you espoused it or somebody else did, introducing that word into this conversation offends me, and I'm sure it offends others. We are in a different year than we typically have in the legislature. This session has not been like other sessions, not perhaps as different as the non-session last year, but it has been different. And to suggest that anyone on this committee, anybody in this legislature, has attempted to rig the process, I find offensive. The process is different because of the situation. Ideally, we would have had a chance to hear everybody's testimony. But let's be honest about this. Had this taken place in the usual way up at Hartford, I would submit we would have a fraction of the in-person testimony that we actually got in Zoom because of the circumstances, because of the technology. I would suggest that it is always the responsibility of every member of this committee to read all the written testimony, which is always the alternative to in-person testimony. It may not be as good. We may not be able to feel viscerally the actual emotional experience of people who want to testify, but that's always been our process in this legislature. Many legislatures in other states, I'm not really making comparisons, don't even afford that opportunity in this fashion. So I happen to think highly of our process, and the fact that it had to be adapted and constrained for this particular circumstance is unfortunate, but some would argue it has actually afforded more access in some cases. And I can certainly assure you and anyone else who wishes to assert some sort of nefarious ulterior motive to the way we have behaved in this session, that is not the case. You heard me say initially I wanted to hear from everybody, and I'm disappointed that that particular desire proved impractical. But it is not because we had some sort of ulterior agenda or we're trying to subvert the public testimony process. Nothing could be further from the truth, and I do resent such implications. Let me move on to a few other things. You made comment about the fact that we are not in an emergency. And I say, thank God for that we do not want to wait for an emergency to address problems like this. We've heard talk about, well, maybe we're better off waiting for the emergency and then just counting on an effective quarantine structure to keep things from getting worse. Well, anybody who's lived in the past year really want to rely on a quarantine process at this time? We don't want to wait till we're in trouble, that a vector is manifest. We want to be proactive. And if you look at the data over the past decade, the trend is clear. There's an emerging trend that we're going in the wrong direction in an alarming way. So rather than wait for it to be manifest, to have a real outbreak, I think it is our responsibility as members of the Public Health Committee of the Connecticut State Legislature to address it proactively and in a fashion that will be effective. So it may not be urgent as of this moment, but we must prepare ourselves for that prospect before it's too late. Lastly, I want to address one of your comments. I'm really glad you brought it up, which is the issue of choice. I'm an advocate, a fierce advocate on behalf of personal choice, whether it comes to the matter of control over one's body or over how one chooses to end one's life. But I reject the comparison between that and the circumstance here. I find it as an unfortunate conflation of two fundamentally different things. And the key difference is this, and I want to be very clear on this. The difference is, in this case, you are putting somebody else at risk. Somebody you don't know, but you are making a decision that doesn't just affect you. This is not personal choice. This is choice that affects your community. And I would hope that all of us take very seriously our collective responsibility to the social compact. It's what holds our society together. We're a nation of laws. If we do not adhere to that, if we do not all participate in that responsibility, the whole edifice falls down. And so the key difference here is this is just not affecting you. This is affecting other people, many of whom have no control over their ability to protect themselves. And I think that distinction is critically important and cannot be emphasized enough. Senator?
If I may, Mr. Chair, to follow up, and I appreciate your thoughts. I have always, you know that, we may not always agree, but I always appreciate the dialogue and the exchange of ideas. And I think this is the positive way to go about it. But I want to address your rebuttal and share with you these perspectives. As the ranking member, I have been privy and afforded the great opportunity, as I said, in working with our great colleagues as a leadership of this committee. So as I said, perhaps on the outside, and I said clearly, leading some to would even say that it might have been a process predetermined. It's important to know that not many people have the access that we have. And I pointed out the examples that I shared that would give some credence to some aspects. Perhaps it is the COVID, perhaps it is the Zoom challenge that we have, perhaps it was simply logistical. But I thought it was important to clarify that other people may feel that way in the process. Number two, I agree with you from a standpoint of the risk and health, but we're not doctors. And I was impressed by the testimony of Dr. Ross and disappointed by the coincidence of not having the Department of Public Health and their expertise to answer the questions as to relating to the eminent public health considerations that you feel is so critical. They were not available to us as Republicans, as individuals that had queries. So not appearing in the public hearing, not being able to meet with people that had concerns about the same health questions is a process that, again, reflects some coincidence of inability, leaving a lot of questions unanswered. And number three, in regards to personal choice, look, I agree. But when are we as a state to tell a parent how to best manage their child? When are we as a state to say the overall concept overrides an individual's personal right? We may have a disagreement on that, Mr. Chair, but obviously it is a point of contention and discussion. We may feel differently, but for me, understandably, if I believe in a personal body choice, I believe in an individuals to believe what's right. We have to carry, that's some of the inherent risks of democracy. And I would hope for myself as an advocate of the vaccine, having taken the COVID myself, and a believer in my children in receiving these vaccines. I believe in it. And I have done so to think that is in the best interest of my child. But for others that may feel differently, passionately, religiously, or health-wise, who are we in the state to say we know better than you? So we may disagree on those components, Mr. Chair, but I feel it is important to share that unfortunately we may feel some ways in the afforded privilege that we have as elected representatives, but we also need to be conscious that the policies that we make will impact many people that feel otherwise. And unfortunately, during this entire legislative process, however challenging as it is, many people feel as though they're not being heard. So I appreciate the opportunity to be able to follow up with your thoughts. And again, I'm going to end by how I started, that I have such great, genuine respect and admiration for the work that we do in public health. And I genuinely appreciate the work that we have done in the public, many other areas. This is one where we strongly and passionately disagree. So I look forward to moving forward. And again, I am eager to hear the viewpoints of other of my colleagues on this debate and many other important bills that we have in this committee. Thank you, Mr. Chair.
Thank you, Senator. And one other point of clarification. I've been reminded that although the Department of Public Health did not choose to testify when we had our initial hearing many weeks ago, apparently the Republicans on this committee chose to submit a number of questions to the administration, to both the Department of Public Health and the State Department of Education. I say apparently because the Republicans of this committee chose not to involve the chairs of this committee in that request, and we found out about them third hand, and have indeed received answers to, I think, apparently 30 different questions that were addressed, which I certainly would have hoped would have sufficed to cover all the questions that were perhaps not covered in the context of a public hearing. That the Republicans have chosen not maybe to share this broadly with the public is really of their concern, because again, I understand this all third hand because the chairs were not in any way involved in this interaction with the administration. I just want to make sure that's clear.
I appreciate that. It's a terrible feeling, isn't it, Mr. Chair?
Yes, obviously, we strive to involve everybody, and every time that breaks down, it's not serving in the interests of the people of Connecticut. I do agree. Senator Summers, followed by Representative McCarty.
Yes, good morning. And thank you for trying to sort of, I don't know what I should call it, moderate this debate. So I have quite a bit to say, but I will try to keep it as concise as I possibly can. I'm going to save some of my arguments for the floor when this hits the floor. But first and foremost, I would like to say that I believe in vaccines. I am a person of science. I had a biotech company for 25 years. I actually worked with viruses and bacteria that are very harmful in a level 4 hot zone out at the University of California, Irvine. So I'm very, very well educated in vaccines and viruses and the transmission of viruses and the risks and the rewards of vaccines. I want people that are listening today to this Public Health Committee meeting to understand that if people choose to not support this bill going out of committee, they do have an opportunity to change their mind when this comes to the floor, should there be some amendments to it. And also a yes vote or a no vote today does not mean that you are against vaccines in any way, shape, or form. It may just mean that you're against the way this bill is actually written and the unintended consequences, although well-intended, what could happen should this bill actually pass. So first, I would just like to take a little walk down memory lane, if we could, concerning this bill. This bill came to the Public Health Committee with concepts. There was also concepts for a bill for vaccine hesitancy, which was not raised by the chairs, which is a bill that talked about how to educate individuals, how to talk about vaccines in an effort to help reduce the hesitancy of vaccines. That bill was not heard, and we did not have a public hearing on that particular bill. So now we have two bills. One of them had very little language, and the other one was very similar to the bill that we had in the previous session. From the get-go, I had always taken exception to the title of the bill because one of them was listed as an act concerning, I think it was non-medical exemptions. And non-medical exemptions do not exist in our state statute. That is something that is been a description of what this bill is. And I thank the chair for really recognizing that what we're talking about today is eliminating a religious right or a religious exemption to the vaccination process. So that's what this bill is actually about. And these bills were raised, a public hearing was afforded on these bills, which we had over 2,000 people sign up for. Now, we had a choice to not raise this bill during this session because of the fact that we are in a virtual world where we have to do this virtually, but the choice was made to hear this bill. And therefore, it did provide extra access for people that wouldn't have to travel to come in to testify. But we had over 2,000 people sign up to testify because of the importance of this bill. In addition to that, we had received a petition of Connecticut residents, over 10,000 of them, that had asked us to not hear this bill in this session because they wanted to come in person and be able to look us in the eye and have a conversation with us about this vaccine. That was just to not hear it in this session in this virtual world. And I don't think we can have it both ways, complaining that we're doing it virtually and then also saying that virtually allows us to have more public input. And then we have another petition of 14,000 Connecticut residents. These are not people living outside of Connecticut. These are Connecticut residents who said, we are against this bill. So just putting in context, we had 2,000 people, we had 10,000 petition and another 14,000 petition on this particular bill. So the hearing comes and the chairs have decided on their own, which they have, I guess, cognizance of this committee to be able to do, that this hearing was going to end at 24 hours. That was their decision, and that's the decision that they made without any input from the ranking members, without any communication. We found out third hand, we asked, and it was confirmed. So at that meeting, or the hearing, we decided that we were going to try to make a motion because my caucus was willing to sit here for 7 days if we had to. There is no reason why we couldn't have heard testimony for 12 hours, taken a break, come back, heard it again. Although not practical, as some would say, absolutely the right thing to do. If it's that unpractical, we should not have heard this bill during this session. We made a motion, it failed on party lines because one party decided 24 hours was enough. The other party said, you know what, we'll be here. I want to hear everybody that wants to speak. So the hearing was ended. Out of that close to 2,000 individuals, only 226 were able to testify. 98% of them were opposed to this bill. The other 3,500 pieces of written testimony that were submitted, I've just actually gotten through them all just this past week. Look at the numbers, 97% of them are against this bill. So we've had petitions, we've had people feeling whether real or not real, they do feel that they were not heard. I do agree with the chair that we should not be name calling. We should not be labeling people or belittling them for their viewpoints or their opinions, even though they may differ from our own. But during that hearing, we had a high-ranking official in the Democrat Party making disparaging tweets about people that were testifying. He name-called and labeled them as right-wing extremists, I believe that was. When in fact, the people testifying time after time said, I'm a Democrat, I'm this, I'm that. That was not what was at that hearing. What was at that hearing were mothers that were concerned for their children, mothers that had children with special needs and IEPs that were very concerned. We had people that were in a position where they felt they could not get a medical exemption and they would have to leave the state. So that is highly offensive to many of us and to all those individuals that came and spent the time to testify. So as we move further, during that hearing, if this is such a critical issue, when Connecticut remains the third highest state for vaccination rates, and that we heard from experts, Dr. Ross, this is not a crisis now, that the DPH commissioner, nor whoever was acting as the commissioner of education could not be bothered to come and testify in person, to be able to be asked questions that needed to be answered. If this is such a critical issue, which I believe it is, because this policy could potentially displace 10,000 children from an education in this state, I am shocked and disappointed that they could not be bothered to show up. So because we did not get our answers, we didn't have an opportunity to ask questions, my caucus got together and we formulated a list of, I think it was 4 pages of questions. And I know the chair has a copy of them because he was given a copy by the administration. It took 7 weeks to get the answers to those questions. We just received them last week. And I know the chair has a copy of them also because it was, of course, assumed that that would be shared with everyone. Our caucus had made an appointment with a DPH commissioner to be able to go over those questions for 1 hour of her time, because there are additional questions from the responses that we have received. Literally 2 hours before the meeting, it was canceled because she was not comfortable meeting with us to answer the questions unless the chairs were present. We have 11 members and we had 1 hour of the commissioner's time. We did not want to add 2 more people to that 60 minutes of precious time that we had with the commissioner. So the meeting was canceled. That is not transparency. That is not good leadership. And that begs the question of what are you afraid of? Why are you afraid to answer questions? So now here we are looking at two bills with the exact same language. And I haven't been here that long. I've only been here, this is my third term. From people that have been here much longer than I have, they have never seen this. I believe the chair probably has never seen it. It's been unprecedented as far as having two identical bills. And the only reason you do that, regardless, I don't buy into it's because of COVID and it's because of our virtual world. That's just something that is not really believable. Anything that the majority party wants to bring up to here, they can get it heard. That's an absolute, in my opinion, a manipulation of the process to try to figure out what house, whether the House can get it out quicker than the Senate, etc. So I don't think we should be hearing two bills with the exact same language, or else we could potentially be looking at duplication of bills in the House and Senate with the same language going forward from here on in. And I think that is, really disingenuous to say that it's because of our virtual world and because of the scheduling, because the majority party can do whatever they want and they have the ability to make things happen. So I just think that is an unacceptable answer. And as we go through now, what nobody really has talked about is, I believe that vaccines are very important. My children are vaccinated. My husband is a clinician. I've worked with viruses and bacteria. I understand that. But what we're missing here is that there has not been, and we have asked, what has been the educational push to encourage people to take vaccines? There hasn't been one. There hasn't been evidence of that. I myself sit on the governor's committee that for the advisory committee for the COVID vaccine. I spend my evenings at forums with clinicians talking about the vaccine, talking about the pros and cons, giving the factual information. And I want to share with you one success. We had met with a bunch of clinicians who refused to take the vaccine in the first round. They were afraid. Mostly of them were women. They were hesitant because they wanted to have somebody else take it to see what kind of response they would get. We went back to them. We had an educational push in a safe environment where they could ask any question that they wanted with the experts that were there. Why should I get this? What are the adverse reactions? What if this happens? And after we had those forums, we had more and more individuals willing to take the COVID vaccine, which is exactly what we want here. But instead of an educational push where we do the same type of push for whatever the vaccine is that's the problem, whether it's the mumps or hepatitis B, we are now saying to children that have a religious exemption, we're not going to bother trying to educate your parent or trying to have a conversation with them. What we're going to do is displace you or unenroll you from school. So we have potentially 10,000 plus students that will be displaced and are, as according to our other chair, are no longer eligible for education in the state of Connecticut. I just want to say I have a really hard time with that. The fact that we have right now in school, if you are a child who has been expelled, you have a right to an education. We have to educate you. If you are a child that has acted in a criminal manner that is behind some kind of bars, you are afforded an education. The due process for their education is absolutely stripped in this bill. And that's one thing I don't think that we have really thought about, the unintended consequences. Even the clinicians that are experts in vaccinations had said, policing, this kind of mandating is the absolute last resort. We much rather see you educate people, try to work with them, than this type of, heavy-handed measure. When we look at the bill, it talks about the religious exemptions. When you take a religious exemption, you sign an affidavit talking about the quarantine process. That has served us well since, I believe, 1938. We have not had an issue. We've heard about outbreaks. The outbreaks that we have had are in adults. They have not started with children. They have started with adults. This bill requires every child get a flu vaccine every year. What about the teachers? It doesn't speak to that. One of the questions that we had asked the DPH commissioner is, if the COVID vaccine is available and it gets an EUA by the FDA, are you going to mandate that for children? We did not get an answer on that. We got a runaround answer. I find that highly alarming on some respect, because regardless of how you feel about vaccines, they've all been studied that are required. There are 24 vaccines that are required. It's 70 doses. It's not 70 vaccines, it's 70 doses. But those all have long-term studies where this particular COVID vaccine would not. I would like to get an answer from the DPH commissioner on what the plans are going forward as far as that's concerned. There also has been, from the start, it was very clear from the chairs and others that this bill was not about COVID. This is not about COVID. This bill has been around for years. The timing is such that when we now have a pandemic with a virus that just until recently we have not had a vaccine, and we do not have a fully approved vaccine for. But yet I hear people convoluting COVID in with this particular vaccine bill. And I'd like to make sure that these are two separate things. The vaccines that we're talking about are vaccines that have been studied, have long-term studies, and have full approvals. So I find it sort of disingenuous to talk about this outbreak that we have, and we should look at COVID, but yet we're not talking about COVID in this particular bill. So I think we're mixing it to our advantage or our disadvantage on some level. I think that it is important to note that only 5 states in the nation do not allow for a religious exemption. And 2 of those states are actually looking right now at adding, on bills that have put in by Democrats, a personal exemption, which would cover both religious or just for any reason you don't want to get the vaccine. So they're looking at adding that right now. If you look at the data, you will see that the religious exemption in the state of Connecticut, and I am not somebody who has those religious beliefs, but I do think that we do have a duty to uphold those religious beliefs if they are deeply held. And if you look at the number of children taking a religious exemption compared to those who are just not complying, they don't have any exemptions. Look at the schools in Hartford. There's no religious exemption. There's no medical exemption, except their vaccination rates fall way below which we would like to see. So if you get rid of those children that have a religious exemption, this bill is silent on those that just are not complying. What happens to those kids? Are those children also unenrolled? And those are communities of color. So now you're displacing children from the schools that we've just missed an entire year of school. And when you talk to superintendents, number one, they don't know this is coming down the pike. They're the ones that are going to have to enforce it. No one has bothered to bring them into the loop. And they have said to me, this is the worst time to be doing a bill like this. These children are just getting back to school. And now they've almost missed a year. And now you're going to put this on us when we're just trying to get everybody back and get everybody up and running. And now you're putting this on top of us where we might displace children. I think it is absolutely abhorrent that this committee would look at displacing children and not providing some kind of education for them in the future. Just because a child is missing a tetanus shot, you are going to kick them out of school and not afford them an education? I think that is the wrong policy, and that absolutely has to be reviewed here. So as far as in closing, I don't want to take up too much time, but I don't think that we made the effort to educate those who are hesitant. I think we could. I think we could use the model that we're using for COVID, and we could have great success. I also think that classifying children from 7th grade and above as okay for a religious exemption, and those below 7th grade and to kindergarten is not okay, sets aside 2 classifications of individuals And the only way you can strip away a religious right is to show a compelling public health interest. And if you have two classifications of people, you lose that argument. If you're going to classify, as Representative Scanlon, and I applaud him for thinking about this, because this bill will tear families apart if we don't at least do what Representative Scanlon wants, which is to grandfather those from kindergarten above who have a religious exemption. But I would go further. If you're going to do that, you have to look at families that have a religious exemption, a strong religious exemption. If they have children that are in preschool now or going to daycare, and then a kindergartner and somebody in sixth grade, if you only allow the exemption or the grandfathering from kindergarten and above, you're going to leave out their toddler. Or, you know, if we don't fix it from kindergarten and above, if you have a child in first grade, they can't go to school or they'll be displaced, but your seventh grader can. And I think tearing apart families is a terrible thing to do. So I do believe that there is an opportunity to fix the vaccination rate, especially in those areas where there are no exemptions being taken. So you can take away this religious exemption, you can displace students, but you are doing nothing to increase the vaccination rate, because those kids are just not in school anymore, but they're still at the playground, they're still in the grocery store, they're still playing team sports with your kids. If you really wanted to increase the vaccination rate, you would do a push for education, just like we're doing for COVID, and see the effects of that before you implement a policy such as this. The other thing I think that absolutely has to be addressed, which should be part of this bill going forward, is the fact that we now have doctors' offices, pediatric offices, saying they will not take patients if they are not fully vaccinated. That may sound great to some of you, but there is no doctor that I talk to in any other specialty, and I happen to be married to one, that would say, if you don't do what I say you need to do, I am not going to see you. If you don't take a COVID vaccine, if you don't take your heart medication. So now we have a whole classification of children that have no access to pediatric care. So where do they go? Do they go to the emergency room? Do they go to the school-based health clinic? I don't know. Or it's a school-based health clinic that can kick them out too? So if this public health committee is concerned about public health, that's something that absolutely has to be addressed at some point in time. Look at the data. I didn't believe it at first, but I went and looked, and you can see there is absolutely a financial incentive from insurance companies to have your office be at a certain percentage of vaccinations. So if you have a 100% vaccination rate, you get a certain bonus. As it declines, your bonus declines. That also needs to stop, I think, because again, I don't think that is a good way to practice medicine. You are throwing those out of your office that won't comply, your outliers, we used to call them. So you have this artificial inflation of vaccination rate in your school or in your office, which has done nothing to really increase vaccinations. So I believe this bill needs a lot of work. I feel that it is not a, I know that the outcome of this vote is already predetermined. I know it's going to pass out of committee, but I do think that there are different viewpoints that have not been addressed. And I don't think that the people that are pushing this bill are listening. With all the testimony that we've heard, with all the input we've had, I believe that there are people that had their minds made up before we heard that hearing, and they are not listening. Never have we had a bill with that kind of a petition, participation, yet we are still just pushing through the same bill that we had, and we're not listening to the citizens. So I would like to work on something that really does help increase the vaccination rates, that does not hurt those students that have had no choice in this and displace them and strip them of their due process to have an education. I'm not sure that's going to be something that will be possible because of the tone of this actual legislation, but I certainly hope it is. And I want to thank the chairs for letting me go through what I had to say, because I think it's important for the public to know some of the background on what we have gone through, and that those that vote no today are not voting no because they're against vaccines. They're voting no because of the unintended consequences of what this bill will do. And that there's some of us that do believe that if you really did a full educational press, which has not been done, that we would have a different outcome and you would see the percentage of unvaccinated students really decline. I mean, just the simple manner in which the data is presented. If your child is missing one vaccine, they're classified as unvaccinated. And I don't think that that is an accurate reflection of the tone and of the drastic overreach of this particular bill. I think we can all say that nobody wants to have a public health crisis. Nobody wants to have an outbreak. Nobody is looking to put anybody at risk. But there is absolutely no data that anyone can find or provide that shows that an unvaccinated child is a nidus for infection. It's just not there. So I'll leave you with that. I hope that I can provide some positive recommendations for this bill as it moves through the process. And I want to thank you for your indulgence this morning. Thank you.
Thank you, Representative. Appreciate your extensive comments. Clearly, you have some objections as to the process, to which I could not more fundamentally disagree. And I will just close by saying, if you have specific evidence of a specific insurance company that is offering bonuses to pediatricians, it's something I think we should all see and perhaps we can address. Representative McCarty, followed by Representative Foster.
Yes, good morning, Mr. Chairman, and thank you for the opportunity to make a few comments this morning. Much of what I would have liked to have said has been stated, so I'll try not to be too repetitive. But I would just like to comment that as the ranking member of education, this proposal is very difficult for me to accept as written. And I want to point out that the number one mission for the schools is to protect the health and safety of our students. So I want to be on the record to saying that I certainly support that. However, I do not believe at this stage we are in truly a state of emergency. And for all of the reasons that were stated previously, I think an education campaign to get those schools that are not in compliance with the 95% herd immunity, that would be the goal, to try to get the vaccination rate up. I don't think the approach we're using here is the ideal approach because we're not in an emergency. And I understand the trend, and we've talked about the trend, and we're trying to be proactive so that we do not have an emergency. But I think we can accomplish all the goals that we all want if we can delay this for the time period necessary for DPH and the Department of Education to come together, to collaborate, and to find a solution to finding those schools that were not in compliance. And I believe that that can be done. And if you go through the data carefully, you will determine that many of the schools that are already at the 95% rate, they have religious exemptions, but they're still above the 95% herd immunity. So I'm not too clear on just exactly what percentage of the religious exemption is causing the issue. And I think we need time to really delve into that more. If you look at the trend last year, it actually went down by 0.2%. So I think that's an indicator that with more education, we could actually raise the vaccination rate in all of our school districts. I think that should be the first approach. I believe that this pandemic that we have just experienced has created so many health issues in our schools. We are concentrating, and the number one priority is to really look at social emotional learning to help with those children that have suffered trauma, food insecurity. All those issues have created such tremendous health issues in our schools that I think this particular proposal right now, it's going to take us time to get out of all that. This proposal, in my opinion, is going to exacerbate our problems in education. We talked about it may be a semantic at this level right now, whether you consider those children unenrolled or expelled. I believe because the state is not in a clear emergency, that could become an issue, because those children, in my opinion, could be expelled children, not unenrolled children. So that's going to be an issue going forward to look what we can do. I agree with Representative Scanlon, and I think I was the first to ask the commissioner in the very first time this came forward, can't we grandfather, can't we do something for the children that are already in our schools? I think it's going to create many, many issues. I'm worried about our special ed children. We need to be considerate of how those children will be receiving their education. But basically, my issue is that I believe we have flawed data and that we're not in a state of emergency. I agree with the testimony given by Dr. Ross that we have that we're not clearly there, and I do believe we have to work so that we don't ever get there. But I don't think this proposal is the right approach. I think a little more time where we could have good collaboration with the Department of Education and the Department of Public Health together. It was very disappointing that that had not taken place in the prior years. I think we can get those rates up and we could preserve the exemption. So I think it would be a win-win for everyone. But I don't think this proposal aims at that. And if that's the central mission, to raise the vaccination rate, I think that should be the goal, and that we should be able to look at that data and come to an agreement that that's where we should be heading, because the trend is actually, as I just mentioned, went down. But my primary goal, and I'm worried about all those children that could be displaced, and we have to really be cognizant of what we are doing with this proposal. So I won't repeat everything that was already said, but I thank you for the opportunity. I was encouraged, Mr. Chairman, by hearing you say today that, and I believe that you're sincere when you say it, and that you want to look to get the best proposal and to try to do some of the suggestions that have been made to make this better. But at this time, I cannot support this proposal. Thank you.
Thank you, Representative, for your sensitive comments. Really do appreciate them. Indeed, it is our objective to make this bill as appropriate as it can be, given the challenging circumstances, and the chairs remain open to further conversation on this should it pass out of committee today. I wish I could agree with the argument that we're not in an emergency and that's okay. It's going to take us a while to implement this bill. The effective date wouldn't be until September of 2022. And we're talking about grandfathering. My biggest fear is that in the interim, things will get worse and we'll have more schools out of compliance. That's why I think we need to act now and not wait to some future time. Representative Foster, followed by Representative Berger-Giavalo.
Hi, everybody. Thank you so much for the opportunity to speak. I appreciate the opportunity to have a healthy debate. I know, like many of you, after that 24-hour public hearing, there were constituents in my district that I was able to have the opportunity to talk to. I clocked nearly 15 hours of one-on-one conversations with constituents in my district who had who are vaccine hesitant. And I believe fundamentally that very many of their concerns are addressed in some of the amendments that have been made, or some of the changes that have been made in this bill as it's been proposed today, though there's still work to come. That being said, as I ran for elected office and as I make decisions on any bill that I will vote for, and I think as many of you do, you always weigh representing the majority of folks in your district, the majority opinion in your district, and scientific evidence, data, and experts on that specific topic that you're weighing in consideration and decision making. And so I just want to, I know we've been talking a lot about the numbers of people who testified in support or against a specific bill. But I think it's important as we're talking about data concerns, as they might exist, to also talk about some flaws that might exist in the data as it's presented in the numbers that we have. We had multiple families where multiple people testified, and that skews the data. And a survey that's been shared with us that, again, there's no restriction on who is signing on, or it's not empirically collected data that way. Whereas the state vaccination portal that shows district by school vaccination rates is empirically collected data with their methodology published and shared and accessible for folks to review. So I'd like to sort of highlight two opinions that have been shared, or facts or ideas that have been shared here. One, the idea of local school control to promote vaccine compliance and participation, and leaving that control to local districts to educate and promote vaccine uptake. I think that sounds like a really good idea, and I don't think that this bill excludes efforts from doing that. That being said, the Connecticut Association of Boards of Education submitted testimony in support of this bill as it stands. So I think to say, oh, the local boards of ed should just do more is unfair when they testified saying that this bill is the action that they would like to see happen to promote vaccine compliance and to ensure that children are safe as they attend our public school system. So that I just think that that's important. As someone who did read through all the testimony, paying particular attention to experts and people that I represent, as I've read through the testimony, as I'm sure you all do as well. When I looked at the opinions submitted by emails and contacts that I had, folks in my district, by and large, overwhelmingly support ensuring that their children attending public school have a safe learning environment, which for them means knowing that vaccine preventable conditions are not spreading through the school district. And I think that's particularly true in the situation where there are folks who cannot have a vaccine, even though they would like and would choose it. And I think we can't forget about those children in these discussions and conversations. I do want to highlight too, I don't think that as we listen through and talk about folks' testimony, it's appropriate to cherry pick quotes to support specific agendas, particularly when it's taken out of the context of a testimony. And so I'd like to just remind folks that Dr. Ross's testimony was in support of this bill. And so he did testify that similar to the COVID pandemic, we do not see a pandemic spread of vaccine preventable illnesses. And he said, although we are not facing a pandemic emergency in this point in time of a vaccine preventable condition, the idea of public health is to prevent an outbreak. And so if we wait for an outbreak, the risk to the community and the risk of loss of life is significantly higher than if we enact public health policy to prevent illness or spread. And so he was very clear in the whole of his testimony that he supports this legislation as it stands, as it was drafted, and that he supported the idea of preventing an outbreak, not waiting for an outbreak to enact this policy. I also would like to draw attention to, some folks have said a couple of times that there's no way to attribute outbreaks to religious exemptions. And I don't know where that information is coming from. We don't know what data is supporting that in people's opinions, but that is certainly not true. In the retrospective analysis of several outbreaks that have occurred in the US in recent years, in the post-elimination era, which is what we call this time where vaccines are not broadly spreading, in this day and age, when there are vaccine outbreaks, it is associated with under-vaccination in the community. And so there is a series of studies that have been published about this, and they have been shared. In fact, the Connecticut Academy of Pediatrics summarized all of the scientific data that was in support of a policy like this. They shared an amalgamation of the data with us to make it easier for folks to sort of see the synthesis of data and support. And in light of data like that, that supports that a religious exemption promotes an environment where vaccine preventable illnesses can spread, organizations like the Pediatricians Association, the Connecticut Medical Society, the Connecticut Infectious Disease Society, and a preponderance of pediatricians and medical doctors, the Connecticut Association of School Nurses, the Connecticut Association of APRNs, and the Connecticut Association of Registered Nurses all submitted testimony in support of this bill. And I do think that people's expertise matters. And so I think that it's important for us to take time and stock and understand that legislation like this is drafted in a way that is based on science, data, and our best understanding of public health and disease prevention. That being said, I in no way, shape, or form would malign a parent's ability to look at their child, to have a conversation with their pediatrician and try and make the best choice. That is what I won't say all of us, but that is what most parents are doing, right? That is the vast majority of parents are taking every single day, and they're just doing the very best they can to make sure that their child is healthy and happy and grow up to be productive members of society. We are all trying to do that. And so I empathetically listened to a lot of families in my district. I think there were 7 of them who I spoke to who had concerns about this bill. But I also empathetically listened to 30 or 40 families who had concerns that if this bill was not taken into a place, that their children would be in danger. And so I do think that it's important for us to look at our districts and look at the science and data when we're making decisions. Now, I know that there are a lot of folks who are, instead of not weighing the science of vaccines, for that's not something we're weighing, right? We're not saying whether or not we believe vaccines are efficacious or not. We know and understand that they are. I know that there are some people who are trying to weigh in their internal philosophy and their political philosophy, whether or not they believe that an individual's right to choose what happens in their household or with their children is outweighed by public health and public good. And I think that there has been multiple situations where this has come to decision-making in the process. When a decision is made what to do with your own body, that does not have any negative impact on the people around you, that is significantly different than making a choice that puts others at risk. And so I think that I urge my colleagues, as we have these conversations, to focus on what we are actually debating, the merits of this bill and policy. I've said this every time I've had the opportunity to speak to you all. In light of a global pandemic, we should be very judicious not to promote false misinformation about vaccines efficacy. I'd like to thank my colleagues from across the aisle who sound like they are not supportive of this legislation, who are not using their political office to elevate anti-vaccination sentiments that are shared and propagated by I think oftentimes external forces. I think that we should have conversations about individuals' right to choose and about vaccines. I ultimately will support this bill because I think that every scientific expert with related expertise to vaccinations does support this. I believe the data is clear that the best way we can protect the majority of students in our body of school is for this law to be codified. However, I do think that it's important that we remind one another that in our conversations about vaccination, that there is a lot of really horrifying misinformation out there about vaccines, and we should not use our positions as elected officials to elevate misinformation and fearmonger, because I think there is a lot of real fear that's not rooted in science about vaccines. And so as we have this debate, I just caution my colleagues to be careful that we root in the merits of the bill as it sits before us, not in anything that's out there about speculation about vaccine hesitancy that's intended to promote and breed vaccine hesitancy. So sorry for the long testament, but I do want to just circle back and end with, I do want to urge my colleagues to not misrepresent the testimony of Dr. Ross. Dr. Ross did share that he supports this legislation. His testimony was in support of this bill. And he said that we have a COVID epidemic that's an emergency at this moment. But if another vaccine preventable illness were to spread in our community, that then would be an emergency, but then would be late for us to work on addressing through a policy intervention. So I urge my colleagues, the Connecticut Association of Pediatrics did share their summary just yesterday, I think, or 2 days ago, and they did, there's a lot of really good and interesting information. And there is information that associates under vaccination and religious exemption with community spread. So that is a misrepresentation and mischaracterization of the data to say that that's not the case. So I thank my colleagues for listening and weighing in on this debate. I know it's a really challenging conversation for a lot of us, but I think in the end, when we're making data-driven decisions that represent the majority of folks who live in our districts, the decision is pretty clear. So thank you very much for the time. You're muted, Representative Steinberg.
I'm going for the record today. Thank you for your comments. I concur with your hope that we can all return to believing in science and the facts of the matter, and hopefully not be distracted by the intentional misinformation out there that cherry picks data in a fashion that leads people to be fearful. Next up is Representative Berger Gervalo, followed by Representative Zupkis.
Thank you so much, Mr. Chair. I've also spoken to any vaccination hesitant constituents I have in district, and I empathize completely. I do agree that what the choices that they're making and want to continue to make are with the best interest of their families in mind. For the record, I am also aligned with Representative Scanlon and others who want to expand the grandfathering to kindergarten, but I'm not going to waste time repeating any of the points that they made. I'm actually going to speak to you first as a parent. I have also experienced the harsh and disparaging language that we all have, or most of us have, and some of it has actually related to my own kids. For some reason, that was a conversation that some folks felt was appropriate to have with me and about me. My own child has an autoimmune disease, one of them, and it forced me to pay very special attention to the medical exemption portion of this bill. Her own pediatrician actually recommended, after her diagnosis, that we separate vaccines for her by 2 to 3 weeks. So I've been accused of using an amended schedule. The amended schedule is really just prolonged for both of my children, a 2 to 3 week, just to limit chance of any adverse reactions. They didn't have any, but I appreciated that the pediatrician allowed and suggested this, and I am satisfied that the medical exemption portion of this bill will allow for and encourage that in medical practices. Shifting gears and speaking to you now as an educator who works with children, generally, mostly on the autism spectrum, but children who have needs that are not necessarily always met in public schools. Many of them are medically exempt. And I'm very concerned about this group. As I read through thousands of pieces of testimony, as I'm sure everybody else did, or most of us did, one theme that kept emerging is the families who are moving to Connecticut from other states who have legislated vaccines. We can't, for the sake of the truly vulnerable kids, become the place where all unvaccinated families come when they leave after states legislate. The argument that our own numbers are high enough that it does not warrant making any change, that there's no imminent risk, that there's no emergency, it becomes completely untrue as we begin to examine how many families are coming here, that flood that you can read about right there in the testimony. So, and also I think we kind of gloss over, but the alarming trend of preschool kids who are not being vaccinated. So While those numbers aren't reflected yet, they are certainly going to be if you look at the trends, if you look at the data. This is public health. It's our job to protect as many of us as we possibly can, but I think it is really critical. That's my dog, I apologize. She only does this when I'm off of mute. It's our job to protect the most vulnerable here as well. She agrees. So thank you guys very much for giving me the opportunity to share my experience and my point of view. And I'm very, very encouraged by how many people in my own district actually support this legislation far more than oppose. So thank you.
Thank you, Representative, and for ceding some of your time to your dog to share as well. Appreciate the comments. Representative Zupkis, followed by Representative Linehan.
Thank you, Mr. Chair. And I am certainly not going to go through the list and reiterate what my colleagues have said, although I agree with them 1,000%. I will say that I'm a mother of 2 girls. They are fully vaccinated, and that's my choice to have them vaccinated. And I believe it's every parent's right to have their children vaccinated or not. I will definitely talk more about this on the floor, but I do not believe it is the government's right to force vaccines on people. And this is what this bill does. If you do not take it, you are not in school, period, end of story. And that is the force of government. And I do not agree with that. I agree that it's a parental right to do it. I believe that, as my colleague stated, there are schools that are not up to the 95%, and we need to get them there. And this is not the way to do it. I believe it's going to be a big infringement on our city schools. Hartford to be one, which we've all said their numbers are not up there. What is going to happen to those schools? And we've all talked about the social emotional of what's going on during COVID right now. This is going to expound on that. And I have very big concerns about this and the kids. They're our leaders of tomorrow, and we need to do everything we can to make sure that they stay in school without government overreach and forced to do that. And the only other thing I'll say is I heard a representative 2 speakers ago mention about, people, and if I heard this wrong, I apologize, but people on this committee fostering kind of an anti-vax position. And I don't believe that is the case whatsoever. I've heard from most of my constituents are not for this bill because it is an overreach of government. They truly believe, whether they have special needs, I work with a community of special needs children, or not, that it is their right as a parent to choose what goes into their kids' bodies. And so I would hope that what was said is not meant in that regard, because none of us are fostering an anti-vaccine position. And I listened the 24 hours of hearing, and there were people from a woman said, and I don't even know, it could have been 2 o'clock in the afternoon, how she was the biggest feminist, progressive, liberal going, and she is totally against it. Till 2, we heard people reciting Bible verses. So this is not one group of people. We heard from people that in those 24 hours that are have their kids vaccinated. I was talking to a constituent the other day, and he says, my kids are vaccinated, we're vaccinated, I believe in it, but it's not the government's role to tell me what to do with my body and my kids. So with that, there will be much more discussion on this on the floor. I do hope that this bill, when it gets out of this committee, will be worked on to focus on getting the schools that are not up to 95% to 95% before some of these overreaching positions and before this overreaching bill goes into effect. Thank you.
Thank you, Representative, for those comments. I look forward to your further discussion should this bill reach the floor. Representative Linehan, followed by Representative Cook.
Thank you, Mr. Chairman. And I'd like to begin my remarks by thanking both you and Senator Daughtry Abrams for the incredible work that you've put in on this bill, not just this year, but for the past few years. Your leadership is greatly appreciated, and I look forward to continue to working on this. I do also want to align myself with the thoughts of Representative Scanlon. I look forward to working with everyone to look to see if we can get to a point where we can have everybody committing to grandfathering kids in from K through 12. I think that that's been important. I was looking at, and I think it's important for me to statement publicly, because it's no surprise that I've been at the forefront of this since 2017. And I, in many ways, whether I like it or not, I've been the face of this bill. And I want to make sure that people understand that I do think of the kids. And as we are moving towards having all children back in school, I would like to see that K through 12 grandfathering. I think that this pandemic has alerted us to the fact that school and social emotional needs, as Rep. McCarty had mentioned, and really talking about the kind of that level where the teachers are the first people to see whether or not there are issues of mental health. And that is a big issue for me. And so having them in school and having eyes on them is really, really important, especially now after the pandemic. And for that reason, and that reason alone is the reason why I agree with the K through 12. So I look forward to working on possible grandfathering of that. However, I do need to address some things that have been said regarding my stance on the K through 12 grandfathering. We have received, as a committee, we have received many emails that have said that this will add to the suicide rate. I want to be very, very clear. A child not being able to enroll in school due to not meeting the vaccination requirements does not cause a child to die by suicide. There are mental health concerns that have to be in place prior to that. This is not a bill that's going to simply create kids looking to die by suicide. So I very much disagree with that information that's been put out there, whether it be on the internet directed specifically at me, or whether it be in the emails sent to the entire committee. And with that, talking about the emails that we've all been receiving, I actually have a few questions for the bill, Chairman Steinberg, if you don't mind. In your summary, which was fantastic, by the way, in your summary, you specifically mentioned genetic testing. So is there explanation in the bill which specifies exactly what you mean by genetic testing and what factors may qualify someone for the enhanced medical exemption that you're looking to achieve with this legislation?
Thank you for the question, Representative. This indeed was something that was very important to me to insert into the bill. But I have to say that it is not as extensively explained as perhaps any of us would like to be, and that's for a good reason. There may come a time, 10 years, 20 years or more from now, where vaccines are not necessarily the best path, though every individual will have their genetic code fully mapped, and we will have an understanding of every mutation in their genetic code and what the ramifications are. We're not at that point today. I hope Connecticut remains at the forefront of precision medicine research, and we reach that point where we can really identify in advance whether somebody has a predisposition to react to a particular vaccine. We're not there yet. However, there has been sufficient research in certain very limited ways that indicate certain gene mutations do increase the likelihood of an adverse reaction. Some families have availed themselves of the opportunity to get that kind of genetic testing and may have information that will be of interest in a dialogue with the practitioner as to perhaps an additional risk factor. So you will see the language, while not particularly extensive, does talk about as indicated by a genetic test. We're at a very early stage in this. I wish that we had fully, explored understanding of every genetic mutation. My guess is the application of this will be very limited, but we wanted to afford families the opportunity to have that conversation with a physician, particularly the physician or practitioner was unaware of that particular genetic mutation in that individual, which might lead to some sort of amended vaccination schedule, or perhaps even skipping a specific vaccine, at the very least, perhaps delaying one of the vaccines. So that was a change to this bill that was intended to reflect some advances in science at a very preliminary nascent stage, whereby that would inform the dialogue between practitioner and families. If that answers your question.
Thank you very much, Mr. Chairman. That does answer my question, but it also brings up concerns that I would like to share with both you and the rest of the members of the committee. We have received numerous emails regarding a very specific gene mutation known as the MTHFR mutation. And these emails coming to all members of the committee have specifically said that these are reasons why people believe that they should not be receiving the vaccine. And I think it's very important to note that when we talk about genetic testing, we're not only talking about seeing a geneticist for reasons that there are medical reasons. We're also talking about gene tests that you can get like GeneSight or 21andMe, and all of these things, Everlywell, that you can buy on Amazon for $50, send in a sample of your saliva and your blood, and you get back this genetic profile. The problem with that is that the genetic profile comes back and it is not discussed with a doctor, and it is not really given any scientific background. If I'm going to talk specifically about the MTHFR gene mutation, what people don't understand is that up to 40% of the population has this gene mutation, and I'm included. My children actually have the gene mutation as well. All my children are vaccinated. The reason I bring this up is because the authors of the original study, now this information was sent to all members of the committee, I believe yesterday or the day before. The original authors of this study had specifically indicated that they had not found any causation between the MTHFR gene mutation and specific vaccination needs to stretch out a schedule or any kind of reaction, negative reaction. In fact, they had to issue a statement saying that unfortunately their study had been hijacked by people using it as a reason to try to not just stretch out their children's vaccinations, but in their words, not mine, they called them anti-vaxxers looking to obtain a religious exemption. Or rather an exemption. Here in Connecticut, we only have the religious. So even the authors of that study recognized that their data has been misused for the purpose of obtaining an exemption. This is where it concerns me, that if we are putting this language in the bill, we are giving them the right to take this non-information, because it's really, that's exactly what it is. There's really no scientific background, there's no proof, and using this as a reason to get a medical exemption. My concern is, and I see where you wanted to put that in, and I completely understand it. I just don't think, when you said we're not there yet, I agree with you, we're not there yet. I do have concerns about this being put in the bill. I think when the science is there, that's when we can amend the statute to include that. But I would hate to put anything in the statute that would, in fact, make it easier for someone to obtain a medical exemption when there is no scientific background or examples that say that that would be warranted. That's the first thing. And secondly, just to go back to more emails that came from the general public. I read every single email that I receive regarding these vaccinations, this bill and every other bill. But many of the emails, not only do they mention the religious exemption, they also talk about the fact that they don't want us to mandate the COVID vaccine and that they are not supportive of forced vaccinations. I would like to submit to this committee and to everyone watching that this is absolutely not a forced vaccination. bill, no one is holding anyone down and sticking a needle in their arm and forcing a vaccination. There is absolutely the right to say no. There just are consequences to that. And secondly, as a question to you, Mr. Chairman, can you please talk about how this bill does not mandate the COVID vaccine and how there are no plans at this point in the legislature to mandate the COVID vaccine for children, even for children under the age of 16.
Well, I missed the very end of that, but I think I got the gist of it, Representative. And I'm glad you raised the point. There is no mention of COVID in this bill. COVID is not approved for such use by the CDC or recommended by DPH at this juncture. You didn't use the phrase, but I've heard it often in the context of this bill and other bills, which is the concept of the slippery slope. It's been used over and over and over again to suggest that there is an inevitable further second shoe to drop when we pass legislation. I find that particularly problematic as a legislator, because not only can none of us predict the future, not only can none of us tie the hands of a future legislature, to be fearful of some potential down the road, totally hypothetical outcome would be to paralyze this legislature. We'd be afraid to pass any legislation because somebody else might choose to pervert its intent. I submit that the people who are elected to this legislature are better than that. That we only pass laws that actually, represent our intention. Sometimes the actual outcomes are different and we have to correct those. But for us to be debating a hypothetical outcome down the road that may or may not happen is not doing service to the people of the state of Connecticut. Some future legislature may contemplate that or other legislation based upon new facts, new science, and the like. I cannot speculate as to that future, and I don't think it's necessarily the best use of our time. So to answer your question, COVID is not in this bill. It will not, as far as I'm concerned, be added to this bill, even after assuming this passes out of committee. That's not what this bill is about.
Thank you. And just one last question, Mr. Chairman. Can you please address the idea of forced vaccination and let the committee and the public know the difference between this bill and what forced mandatory vaccination would be?
This bill establishes a minimum standard of eligibility to attend school, or in some cases, higher education and childcare as well. It establishes criteria for being eligible for school in the interest of public safety and the safety of the students and the staff who attend who participate in the education experience. It does not require anybody to be vaccinated against their will. It simply states that if you choose not to get your child vaccinated, you are by definition ineligible, unless of course there is a valid medical reason why that cannot occur. And I also want to get back to your previous point with regard to the genetic testing. Reading the language quite explicitly, it indicates that a practitioner may consider aspects such as genetic testing. And actually your concern, which I share, is countermanded by my interest to actually still have that conversation. Right now, people are accessing that information on the web. They believe this mutation affects their child's risk factors, but they're not having that conversation with the practitioner. To my mind, it's better to have that conversation. Better for them to air it and for the physician or a parent or PA to explain why it doesn't apply, why it doesn't correlate, why they should not be concerned about that added risk factor, than to leave it out there where you have two oppositional camps that aren't talking to each other. So the application of the genetic testing criterion may be limited or almost non-existent. There may be some instances where there is enough information based upon that genetic test. It's better to have the conversation than not have the conversation. Again, it's up to the practitioner in consultation with the family to make that final determination whether a medical exemption is warranted. And it should be based on the science and not based upon supposition or something they picked up on the web. I hope that answers your question.
It does. Thank you very much. And I appreciate your time and letting me speak today. Thank you, Mr. Chair.
Thank you, Representative. Representative Cook, followed by Representative Pettit.
Thank you, Mr. Chairman. And I appreciate all of everybody's work and comments on this topic. It truly bothers me that we have continued to make public health issues a partisan issue, and which way that we go and who supports what, all for the greater good. And I don't believe that there is any one of us that were elected to make ill decisions to harm the public. With that being said, I also recognize that this has become one of those issues that if you're a Democrat, you support removing a religious exemption, and if you're a Republican, you don't. And for me, I think that this is just really a horrible path for us to go down, especially on this committee. We were elected to make good public health policy decisions, and at the same time, trying to do our very best to support as many of those folks as we can, recognizing that there is absolutely no way that we are going to make everybody happy. I sit in front of this committee today having children with underlying health conditions. I had a daughter that spent 60 days out of her kindergarten year in the hospital and was not able to go to school because of the different variances that were in her classroom. And she would go to school, and 15 days later, she would be back in the hospital. That is a rough path for anybody to start their schooling with. And then you are traumatized what's going to happen every year thereafter that you are going to go back to school. I hear both sides of this conversation. I have met with folks, I have Zoomed with folks, I've spoken with folks for the last several years on this topic, given being one of those people that have asked to come back to the Public Health Committee to do the good work that we do. I understand both sides, but I also think that it's vitally important that we take a step back and we really focus on what we're trying to do, and that is to protect all parties. It bothers me also that we have pediatricians' offices that have not continued to see patients because they are not vaccinating their children for whatever the reason. And Mr. Chairman, you and I have had this conversation in length, and it is a huge concern of mine. I've had conversations with pediatric associations to try to find out who in the state of Connecticut sees folks that are not vaccinated. My understanding is our FQHCs, federally qualified health centers, do see folks that are unvaccinated, but I don't know how long that relationship lasts. So I would really like us, as we're moving forward in these conversations, to look at that relationship. I've heard from pediatricians that say, how can I have a relationship with a family if they don't trust what my advisement is for their children? That is unsettling, and I believe that that is something that we really need to look on mending that relationship, and I want to applaud you all for trying to figure out how to do some of that. I do align myself with my colleagues, Representative Scanlon, who spoke very early on this. He and I and a few others had worked diligently last year to ensure that children K through 12 were able to remain in school. I can support this bill moving out of committee, but I cannot support this bill if it is not changed to grandfather children K through 12 on the floor. And we heard Representative Linehan talk about the impacts on what we've had. And in my notes, it is really, the pandemic has really enlightened a lot of things about how we handle our children and the folks that are displaced from school for whatever the reason that they are displaced. Social emotional crisis that our children are in is not something I think that we have seen we've only seen the beginnings of it. We've seen intact families, not intact families. We've seen children of all sorts of socioeconomical race and the like really struggle through a pandemic. And because their parents have not chosen to vaccinate them does not mean that they should suffer the consequences of being removed from the school of which they are in. And in some cases, those children, that is the only home and security that they know. I also understand that we have to figure out a way to stop this in its tracks. And by finding a position and a cutoff position, and if you're enrolled in school, that might be it for me. So if you're in kindergarten, you should be able to stay in school. And if you're not, then we need to figure out a path to go there. But I am not inclined at all to start removing children from the exact place that they may find themselves the safest out of the 8 hours of a day that they are, or the place where they get a meal, without a path or a mechanism to educate them. So for me, Mr. Chairman, I want to applaud you all for trying to make this bill better. I do think that we have more work to do. I'm not inclined to stop it here. I'm inclined to continue that conversation, and I look forward to working with Representative Scanlon and the others to bringing back our grandfather language from last year. But I really hope that we can encompass this conversation about not being about party lines and about being for the better good of all parties and the better goods of our children. Thank you, Mr. Chairman.
Thank you, Representative. And I know my co-chair and I look forward to the opportunity, should this bill pass out of committee, to continue that conversation with regard to the status of grandfathering. We hear many members of this committee are very interested in that outcome. So we will definitely have that conversation. Representative Pettit, followed by Representative Parker.
Thank you, Mr. Chairman. For a little change of pace, I'd like to start with a couple quick questions for you and then make a statement. The first question concerns the grandfathering, regardless of where it starts. A number of people in the public and in the caucus have asked if someone is grandfathered in 7th, 8th, 9th grade, does it continue through college, and what is the mechanism, what is the form that allows them to continue to be grandfathered should they graduate and start at one community college and move to another university?
Well, I think you're asking two different questions there, if I understand, Representative. One is the concept of transferring from one institution to the other. That already exists, as an issue. With regard to somebody attending higher education, it's our intent to grandfather them as well. If the language is not clear on that point, we need to look at it to make sure that it is. I don't know if I can really answer your question with regard to transferring, other than to say that they would be required to adhere to the same aspects of the law as if they were enrolling for the first time.
Thank you. Secondly, boy, a number of speakers ago, there's some issues about when things start. And as I understand it, the removal of the religious exemption begins right at passage, even though we've pushed off, even though in other parts it's pushed off implementation to 22. Does it start right at passage, or is it next year? I'm a little confused on that issue.
I understand your consternation on that point. Yes, that it would be effective upon passage, but the reference to September of 2022 refers to the enforcement of compliance, affording the families an extended opportunity to come into compliance, or potentially to come to an agreement with their practitioner as to a schedule which may not precisely conform with compliance as of that date, because of the need to do a lot of catch up and not wanting to have too many shots in too narrow a time frame, but at least maps out a pathway where the practitioner feels comfortable to achieve compliance. So there are two different dates, and there are two different dates for a reason. Obviously, grandfathering would complicate that somewhat, but I hope that answers your question.
No, it does. That's how I would have read it. So thank you for that. And as far as the statement, I'd say, we've been at this a long time, starting in the late summer of 2019. And I think our goal and the goal of everybody involved has been to increase overall vaccination rates. As a number of people have alluded to, our latest 2019-2020 data that we received a couple weeks ago shows that we're at about 96% in kindergarten and 98% for the 7th grade, specifically for MMR, above the stated goal of 95%, which is usually invoked for the highly contagious measles. A number of people have referred to Dr. Ross's testimony, and I think we did all hear that he was in support of this initiative. He did state in response to a question that he didn't feel we were in an emergency situation in terms of these vaccinations. And if I could paraphrase, I would think he would said he would prefer to use the carrot method first before going to punitive measures. And obviously those efforts could include things that many people have alluded to: improved education, better communication with parents where needed, increasing vaccine availability and access, if that's an area that is a concern. So I think our concern continues need to be twofold: the public health, the name of our committee, and our goal, and the well-being of our children and families, especially given the stressors of the past year. And like many before me, you know, I'm an MD, believe in the power and efficacy of vaccination. Just got my second COVID shot without incident. Have a 7-year-old son who's in full compliance, following the schedules of the CDC and the AAP. So making that a statement, I also don't believe we should wait until we have an emergency to do this. At the moment, I'm going to flag this bill with a no vote at the committee level, because I think there's still many areas we need to work on, not limited to, but the grandfathering issue. Some people think there needs to be more. Some people think that totally undercuts the issue of whether this is urgent. Education, access to vaccine, catch-up schedules, the medical exemptions. And I think I feel like it's been really a struggle for me, you know, because the simple medical point of view is sort of, vaccines are good, you should take them. If you don't, too bad. But I think our due diligence, I just hate the concept of leaving children without education, especially at a time when many have been out of school for a year already, and the physical and mental stressors they've been under, the significant economic instability families have faced in terms of jobs and their homes. And that this public policy, which I think is far more difficult, this public and social policy is far more difficult than the science of the issue, though some would argue that, will force some people to homeschool. I guess uneasy is the best word in the questions that were referred to on several occasions today. When we asked the State Department of Education on several occasions about plans for education, no offense to the attorneys on the committee or LCO or otherwise, it felt like they're very lawyerly leathers, and the response was to such as the statutory language in CGS section 10204 and proposed language prohibits enrollments of unvaccinated students, not just in-person attendance. Therefore, students who are not vaccinated have no plans to come in compliance would not be eligible. Without any other comment, and I would like to see him, but we really don't want to leave those children without any educational options. Many of the things that Representative Cook just talked to, the socialization, the meals, the other things that the school environment provides for them. And I think that's an important issue in terms of the social and public policy ramifications of this. I say, I think from my point of view, the science issues are pretty straightforward, but I think these ramifications in terms of the educational impact upon kids is really confusing. And I think we have to have a better handle on it before we move forward. I think some of the people that use the religious exemption are just not going to, I agree, we've had this discussion, are not going to agree to be vaccinated regardless of education, access, and other things. But I think for the people who are willing to listen, I think we need to try to vaccinate as many as possible to keep our numbers as high as possible. So my biggest concerns at the moment are really for the kids and what the impact will be if we just go forward without a clear-cut plan as to what we're going to do for those kids, especially coming off the pandemic, our budget issues, where the federal money is going to come from, where it's going to go to. And I guess we've been fortunate. We had, I think, I looked it up so I could tell you, but it was nationally last year, I think 20 measles cases, 13 in 2020 report to DC, but we had 1,282 the year before, which is where a lot of the excitement came from. We had many more, so the 1,282 in 2019 was the most over the past decade. So it could pop up again at any point, but we've been sort of blessed and been lucky, whether it's due to the pandemic and isolation, that we had very few last year, and I think none reported when I looked last night to the CDC, January 1st through March 5th. So I think there's a number of issues, and I really, Fred, I'll continue to work with you and co-chairman Abrams to try to come
to agreement on things to help the kids, so we don't leave kids out there in our zeal to create the best public health policy, but leave some of the kids behind. So I thank you for this opportunity, Mr. Chairman.
Thank you, Representative. I would suggest that we're all uneasy to a greater or lesser degree with this bill, and I welcome your contributions to the further conversation to see if we can ameliorate some of your concerns. Representative Parker, followed by Representative Dauphiné.
Thank you, Mr. Chair. Thank you to our leaders and all of our colleagues here for the really thoughtful conversation today. I'm actually really happy to be going after Dr. Pettit. Dr. Pettit, I appreciate your comments and how you talked through all the challenges that you're wrestling with on this. And I agree with Chair Steinberg that many of us are uneasy in a lot of ways. I just want to speak briefly to say that, I've had a lot of conversations with folks in my district, families continuing beyond the public hearing, folks that didn't get called and wanted to share their testimony. In many ways, I'm speaking directly to them to say that I really appreciate the deep challenges this is causing. I want to take this opportunity to share that given what we've heard about the state of sort of urgency in our schools, sort of balanced with the long-term need to make this what I think is the best public health policy. I sort of come at this from similar to many colleagues here today, hoping that we can extend the grandfathering to all students that are in schools. I'm the son of a physician and a school nurse, and so I appreciate a lot of the medical side of this. I also have a background in education, and so I think a lot about the school side of this too, and I think those are the two big things we're balancing here. It seems to me that finding a way to ensure we're having the least impact on families that I think, as Representative Scanlon said 2.5 hours ago, made decisions knowing what they were getting into to sort of best protect that. That seems right to me, but also to think about our vulnerable students and also wanting to set up the best and strongest situation, most helpful situation for the future. This is something we have to act on. So I'll be voting yes today on these bills to move them forward and continue this process. I look forward to input from Dr. Pettit and obviously everyone else on this committee as we try to improve some of the pieces here. We'll look forward to seeing what we can get to the floor before a final decision. So thank you for letting me share those comments.
Thank you, Representative Parker. And I think you make a good point. I would bet virtually everybody on this committee has had a number of conversations with constituents and other interested parties. I've been talking to a select group of people who oppose this bill going back more than 2 years now, because I think it's important to maintain that dialogue. And even though it's often difficult to have the conversation and we ultimately disagree, I very much appreciate their perspective and their desire to not to have unanticipated consequences from this bill. We are striving to do our best. Representative Dauphiné, followed by Senator Summers for the second time.
Thank you, Mr. Chair. Thank you for the opportunity to share a few comments. Much of what has been said, I will try not to reiterate. I too am a mother of 4 children, all of which were vaccinated, and I am a nurse of over 35 years, so I also come with some medical expertise. I also, part of my career was actually vaccinating children. So when I speak, I do think I come with some expertise on the matter. And I would just speak out with some of the comments that Representative Foster said with regard to the science and the studies that are out there. And there are no outbreaks that have been caused by children who were unvaccinated. There have been no reports and no studies of that. And if there are, I would really appreciate being able to see those. And furthermore, there's no studies that have demonstrated that unvaccinated children are a risk to anyone. And that's been mentioned several times, the risk to the children that are vulnerable and immunocompromised. We have a protocol in Connecticut. If there's an outbreak, the children that are not vaccinated are to stay home until told that they could return to school. That has never been implemented in Connecticut. So I would argue that there is no an emergency. And if there is an emergency, we would implement that protocol, which has never been done. I would add that, we've in this season, we have put forth just hundreds, if not thousands, of bills that are in the vein of trying not to discriminate against people for race, religion, and the like. And here we are in the midst of discriminating against people's religion, because that is what this is about. The lion's share of the children that are under vaccinated or not vaccinated are not those that have claimed religious exemption. So I think I speak to and agree with all of my colleagues who have said, why are we not looking at the data, analyzing that data, and coming up with solutions to fix that problem? We had several nurses that came out and spoke and said that the data was not consistent. The reporting system with reporting the data wasn't consistent. Many of those children that were looked at and observed were children that weren't even eligible to get the MMR yet, and yet put in the under-vaccinated pool. And if you really dig in and look at the data, much of that is reflected in that manner. I would just say that, back to the point of, I think Representative Linehan talked about, this isn't a forced mandate. I think that's a very strange comment to make when we're talking about a quid pro quo for children to go to school. You must vaccinate in order to get an education. So you can call it what you like, and you can say that that's not forced, but the parents that have children that are not vaccinated or under vaccinated for religious reasons don't look at it that way. They look at it as a situation in which they are being forced to vaccinate their children in order to educate their children. And I think it's a very sad day in Connecticut when here we are forcing children and forcing parents to make decisions that go against everything that they believe in order to get an education. Thank you, Mr. Chair.
Thank you, Representative, for your comments. I think it's interesting that we can both look at the same fact, that there's an absence of outbreaks in the state of Connecticut, and draw entirely opposite conclusions. My conclusion is, hallelujah, vaccines work. They've been protecting us all along, and we need to continue to use them to do so. Senator Summers for the second time.
Yes, thank you, Mr. Chair. First, I would just like to thank everybody for their thoughtful comments. I think that there's been a lot of very good and valid points. I particularly want to call out Representative Cook and in her testimony talking about, the children, and I feel very strongly and the same as she does, especially when she mentioned that the school for many of these children that could be displaced is their only sense of security and, where they get their meals, et cetera. And I think that's something that we have to absolutely keep in mind. With that said, it is my understanding that CABE, which is the organization of school boards of education, is truly unaware that these children are going to be unenrolled for not having a vaccine unless there is a state of emergency. So I'm not sure that they're 100% clear that this is going to happen regardless of whether we're in a state of emergency. I think that's something that we need to make sure that they are aware of, because that really is very different than what I'm being told their understanding of this bill is. And I would like to touch on two other points. First, we heard some arguments today about the idea that any of us would use our positions to perpetuate misinformation concerning vaccines. And I find that highly offensive. Nobody on this committee would do that. We have not seen that in the past. And I don't think any one of us would ever, regardless of what your viewpoint is on this particular bit of legislation, would ever entertain that or behave in that way. And it's offensive for somebody even to imply that. And lastly, I just wanted to touch base on the question concerning the COVID vaccine. That is something that We specifically asked the DPH commissioner in our letter, and the response we received 7 weeks later, which is unfortunate. Again, I wish she had been present or someone had been present to be able to answer that. The question was, should the FDA provide a clearance or EUA for the COVID vaccine for children? Is that something that will be added to the list for the state of Connecticut? And the response did not answer that question. That question was never answered. The response was, we do not anticipate mandating the COVID vaccine for this September. So it was really a non-answer. And I think that this committee should push forward and ask for an answer on that. Again, the COVID vaccine is very different because it's not fully approved versus other vaccines that have been fully approved and have the long-term studies. So I think that is something that's on many people's minds. And the fact that we did not get an answer also is something on my mind. So I would ask that we push that and continue to ask for a clear response on that particular question. I know we heard about the COVID vaccine by Representative Lenahan, so I wanted to make sure that that was clear. And other than that, I just wanted to thank everybody for their thoughtful debate on this bill. There is obviously a lot of issues within it, and I'm hoping that we can work together as this bill moves through the process. I hope we can choose one bill, not have to have the same debate when we bring up the House bill, which will be next. So I think that education is the best way to solve this under vaccination, rather not religious exemption, but the under vaccination of some at schools. And I think that's very important because the majority of the people that seem to be missing vaccines are not taking the religious exemption. They are just not complying. And this bill is silent on that, which kind of misses the whole point of the bill to increase the vaccination rates. So I hope that's something that we can explore moving forward. Thank you for the indulgence for the second time.
Thank you, Senator. Let me try to address your two comments. First of all, I must not have been listening carefully enough. I don't recall any member of this committee casting aspersions about somebody disseminating disinformation. I didn't hear that. If somebody did, that's disappointing. Secondly, with regard to your comments with the DPH commissioner, I think you put her in a very difficult position, which is you are asking her to speculate about a vaccine that is not approved by CDC, and whereas there may be prospects for its approval. If I were in her shoes, I might have answered in a very similar fashion. And I'm not sure you could ask her again and again whether she would give you an answer that would satisfy you categorically, because that is not approved. There are other vaccines in the pipeline. People complain about there are other vaccines in the pipeline that are also not approved. And if you were to ask the commissioner whether she was planning to add those to the list, I would agree with her in not giving you a categorical answer because it's not approved. It's not required by the CDC. It's not recommended by the CDC. At some future point, we can all speculate what the world might look like. But today, she's in no position to answer the question any more clearly than I think she already did. So I would have agreed with her in the way she answered.
Well, I would have to say, if I could respond to that, I would disagree. I think that it's an absolutely necessary question. And the response simply could have been, which why I was hoping the response was going to be, I'm not going to mandate a vaccine that is not fully approved by the CDC and or has not gone through the full approval process. I would not mandate a vaccine that only has an emergency use authorization. That was the response I was looking for. And I think that's fair and valid. And that's the response I was hoping to get. But I got a non-response. So, and that would be true for any other vaccines that are coming down the pikes that don't have full approval on children. So that's what I was looking for, and that's what I didn't get. So I think my question was valid, and I think her response should have been exactly what you just said, but that's not the response that I got. Thank you.
Well, thank you. Well, I guess we'll disagree on that. Representative Foster for the second time.
Apologize. I'll just be quick. I'd just like to reflect on the record that I did send, because they're behind paywall. So if you don't have access to academic journals, you won't be able to see it. I did share the 2 citations that I referenced about community spread and non-medical exemptions with the committee at large. And I think that it is perhaps my statement, so I'm not really sure. I actually thanked and complimented my colleagues for not sharing this information. And I have the utmost respect for us staying on topic for what this bill actually is discussing. And in no way, shape, or form am I implying that my colleagues have misrepresented what this bill is. I think that that's happening on social media. And so I want to be explicitly clear that I thanked my colleagues for their dedication to sticking to the facts on what this bill is actually about as it stands currently before us. So in case it was me and my comments that were misconstrued, I would like to make that clear. And in your inboxes are waiting the citations that you've asked for, Senator Summers and Representative Daphne. Thank you.
Thank you, Representative. We'll read that with great interest. And thank you for the clarification. That was the way I interpreted your comments, and I hope everybody understands them. I do not see any further hands raised. So, Madam Administrator, I believe we're ready for the vote, if you wouldn't mind doing so.
Senator Darty Abrams.
Senator Darty Abrams votes yes.
Representative Steinberg.
Representative Steinberg votes yes.
Senator Anwar.
Senator Anwar votes yes.
Senator Anwar, I did not see you on screen for some reason, please. Could you
Sure.
repeat your
Senator
vote?
Anwar votes yes.
Thank you. Senator Kushner. Representative Gilchrist.
Representative Gilchrist votes yes.
Senator Wong. Senator Summers.
Senator Summers votes no.
Representative Pettit.
This is longer than the dialogue, this whole roll call thing.
Representative Cook, if you could mute yourself.
Sorry, Madam Administrator. Representative Pettit votes no.
Representative Arnone.
Representative Arnone votes yes.
Representative Berger Givallo.
Representative Berger Givallo votes yes.
Representative Betts.
Representative Betts votes no.
Representative Carpino.
Representative Carpino votes no.
Representative Cook.
Representative Cook votes yes.
Representative Cook, I did not see you on screen, please. Representative Cook.
Representative Cook votes yes.
Thank you. Representative Dauphiné.
Representative Dauphiné votes no.
Representative D'Amico.
Representative D'Amico votes yes.
Representative Elliott.
Representative Elliott votes yes.
Representative Foster.
Representative Foster votes yes.
Representative Django.
Representative Jenga votes yes.
Representative Green.
Representative Green votes no.
Senator Haskell.
Senator Haskell votes yes.
Senator Kasser. Representative Cabras de Graw.
Representative Cabras de Graw votes yes.
Representative Kennedy.
Representative Kennedy votes no.
Representative Paradis Detria. Representative Lenahan.
Representative Linehan votes yes.
Representative McCarty.
Representative McCarty votes no.
Senator Moore.
Senator Moore votes yes.
Representative Parker.
Representative Parker votes yes.
Representative Ryan.
Representative Ryan votes yes.
Representative Scanlon.
Representative Scanlon votes yes.
Representative Terziak,
Representative Terziak votes yes.
Representative Young,
Representative Young votes yes.
Representative Young, for some reason I did not see you on screen, please.
Representative Young votes yes.
Thank you. Representative Zopkis,
Representative Zupkis votes no.
Senator Kushner,
Senator Kushner votes yes.
Senator Wong,
Senator Tony Vaughn votes no.
thank you, Mr. Chair.
Thank you, Madam Administrator. Again, for everyone's,
I think just a moment, please. I think there might be some other people who missed the vote that are on now. I see Senator Casser there. I don't know if I don't know if anybody else came back.
I'm here.
Senator Casser,
Yes. Yes, Senator Castor votes yes.
Representative Caridas, D Chair. Thank you.
Thank you, Madam Administrator. As we said earlier, the votes will be held open for roughly an hour post conclusion of our deliberations today. We will now move to item 2 of the agenda, House Bill 6423, an act concerning immunizations. This is a JFS. To the floor, do I have a motion?
So moved.
So moved.
Do I have a second?
Second.
Moved and seconded. As I've said before, second verse, same as the first. This is the precise same language as in Senate Bill 568, other than the difference in title and bill number. It is identical. I will not belabor the point and go through all the aspects of the bill again. Hopefully, members are well aware of the language of this bill and our intent. So I will immediately move to entertaining questions and comments. Senator Summers.
Yes, I'm not going to go through my whole debate that I did last time to save all of you from listening to it again. However, I do have a question that came up during the conversation. We heard a lot about wanting to have a conversation. It's just something to think about. Conversation with the clinician to develop a schedule that both maybe the parent who is hesitant and or for whatever reason, will do a catch-up schedule. So it's my understanding that this bill is effective upon passage, but you get till 2022 to catch up. So if you're missing vaccines, you have a year to try to cram in all those vaccines within a year, unless you establish some kind of schedule with your clinician. So my question is, how do we even ensure that can be possible when we have clinicians that will not see patients that are not vaccinated, when they've kicked them out of their practice? Who are they supposed to establish a contract and a schedule with when they no longer have a pediatrician to do that? Do they do that with the school-based health clinic? Where are these people supposed to access that care? I think that's something that needs to be addressed within this bill. If the chairs have an answer, I would love to hear it.
Thank you for that question, Senator. It's indeed a good question. Obviously, those who have separated from their practices for a variety of reasons have, I imagine, sought to get care for their children through other practices or other means. I would suggest that would be the starting point for that dialogue. But you bring up what I hope to be the bigger issue, which is we want to reestablish the rapport between practitioners and families to the point where it's not as tense, it's not as confrontational. Yes, difficult. We're talking about behavioral change, not just on behalf of families, but on behalf of some practitioners who may have become a bit rigid, a bit settled in the way that they choose to interact with families once the subject comes up. That's why there's so much emphasis on the dialogue, on reimbursement for the consultation, on requiring the practitioner to at least consider some factors that might lead to a medical exemption, to the prospect of a modified vaccination schedule in light of some of those concerns. We want the conversation. We want the education to take place. Can I promise that that's going to happen overnight, that we're immediately going to see this light switch turn on and the entire nature of that conversation change? No. But this is what we really want to accomplish here. And we're hopeful that perhaps even some of those practices that had taken a very firm position with regard to those who are unvaccinated may, because of this bill, reconsider and again consider that there's the possibility of getting children at least partially vaccinated or maybe fully vaccinated. That is our intent. That is our hope. It may be challenging at first, and to your point, there may be some who currently do not have that kind of relationship. My hope is that we reach a point where that is not the issue in the order of magnitude in which you described, Senator. I don't know if that's a sufficient answer, but that's what we're trying to accomplish.
Representative Steinberg, can I just, excuse me 1 minute, Senator Summers, I just want to add to that to hopefully answer your question. There is in current statute, and it remains the same in these bills, that school nurses would help. There shouldn't be a reason of access or a financial reason why someone couldn't get vaccinated. So that does currently exist and would continue to exist, that they would be helped to find those resources. And also if there was any financial reason why it wasn't happening. So that doesn't change.
So what you're saying, I just want to be clear, is you're saying that for families that have been, and there's many of them, kicked out of practices, many of the large practices will not accept patients if they are not vaccinated or adhere to a schedule. They don't have access to healthcare. That's what we're being told time and time again. And so you're saying that an unvaccinated child that has been kicked out of a practice, if they decide to have an educational, they can't really even have an educational consult because they don't have a clinician to be able to do that. So they're going to be able to establish a schedule with the school nurse instead of a pediatrician. Is that what you're saying? You know, I realize that vaccines are free. So is that what you're saying?
No, that's not what I'm saying. And I will find it as we keep going. I won't hold people up, but it was also, I believe, addressed in the questions that you proposed to the governor. I think it's in those answers as well. But there already exists in statute that the school nurse would help facilitate a connection to getting it. It's not that the school nurse would be responsible for that.
So the school nurse would call a pediatrician that has kicked somebody out of a practice and established a schedule. My point here is that the bill should have some kind of place for those families to land. It should require that pediatricians accept the patients back if they're interested in developing a schedule. We should designate some place that families that are unvaccinated or have a religious exemption on 1 or 2 vaccines have a place where they can go to see a clinician to be able to get on a schedule should they choose to do that going forward. And right now, if you're not vaccinated in many of the large pediatric offices, you can't even be seen. So I just think that's an important item to be aware of. And I think that we need to make sure that this bill, as it moves through the system, addresses that particular issue. Thank you.
Thank you, Representative. We agree that it is a serious issue, and we're really hoping that that conversation starts happening and it's a productive, constructive one. Representative Carpino.
Thank you, sir. I want to make sure that regardless of what you call it, we all understand what we're talking about, whether it's called expulsion, whether we're preventing students from attending, or whether we're prohibiting them from being eligible for enrollment. It doesn't matter. the bill has, as it stands before us, has the potential of taking half of our student body and prohibiting them from obtaining an education if they do not become vaccinated. And I applaud the conversations of my colleagues who went hours ago, who want to continue working on that issue. I want to stress that point. I supported that amendment when we saw this bill in the past. And I just want to ask my colleagues, as this bill moves forward, to really consider the potential of having our K-6 students prohibited from obtaining an education, and that regardless of where you fall on this bill eventually, that if this amendment comes to fruition on the floor, that they seriously consider this, because we are truly talking about the opportunity for students to obtain an education. And a challenge to my colleagues, if the grandfather provision does not appear, then perhaps we have to look at all of the remote learning options for those students who are still in school. We have come a long way. We talked about remote learning options early in this committee, but if the bill moves off the floor of the House with a grandfather provision for all of our students not being in there, I truly believe we need to afford our current students an opportunity to learn, and we need to be creative in doing so. So it is just an ask of my colleagues to really consider what we're talking about, to not get stuck on semantics or language, and to really think about the students more than anything else. Thank you, sir.
Thank you, Representative, for those clearly heartfelt remarks. Judging by the comments of you and your colleagues, my co-chair and I will look forward to that conversation about adjustments to grandfathering. It is indeed something that has been a conversation, at least since last year. And I know my co-chair and I would be open to that conversation.
Representative Steinberg, can I interrupt for a moment? I found the answer to Senator Summers' question. It's number 29 in the questions that the ranking members presented and in the response. So the response is, the Connecticut vaccine program already provides all recommended vaccines for children at no cost to parents. School-based health centers, which are available on numerous schools throughout the state, provide these vaccinations right on school grounds. Additionally, some local health departments provide clinics to catch up school children that may have fallen behind on vaccines. So there is a mechanism in place. It's in the current law that would allow for those people who are looking to have their children vaccinated to support them in those efforts.
Well, if I can just respond to that, it may allow them to get vaccinated, but the law says if you're not vaccinated, you can develop a schedule that may not be 1, 2, 3, but it is a long-term schedule to get up to speed for vaccination. And unless you do that with a clinician, how are you going to have the schedule to provide to the school that you're on this schedule plan if you can't see a physician? And I'm telling you, even like some of our representatives here, not necessarily on this committee, have told me that their pediatricians have said, I'm sorry, if you're not on my schedule for vaccines, you're out of the practice, and they don't give any reason why. So I think there's a difference between access to the vaccine, whether it be at cost or for free, they are free, and access to a schedule that's developed that you can provide to a board of education so that your child's not kicked out of school or unenrolled or not eligible for an education, or however you want to phrase it, which is basically taking away a due process for kids to be able to be educated. So if you can't see a pediatrician to develop this schedule to hand in, you're going to be disenrolled, and your child is not going to be able to have an education. So I think that's something that has to be addressed in this legislation as it moves forward. Thank you.
Thank you, Senator. We can have that conversation. I will also add that the intent of the section on the advisory committee would be to consider matters just like this. If we discover upon implementation that there are dislocations where families are unable to locate a practitioner who can help them out, that would be something that we would hope that would be brought to our attention and ideally addressed. But to your point, it's something we can talk about further. Representative McCarty.
Yes, thank you very much, Mr. Chairman, for recognizing me again. And I understand that this bill has exactly the same language as the bill we just previously discussed, but I feel compelled that I have to say again, as the ranking member of education, that I have tremendous anxiety, actually, but concern about our children on this proposal that would not be allowed to attend school going forward, the K through 6. So I just want to emphasize again my appreciation for the comments of Representative Carpino, Scanlon, and Cook, and that we really need to look at what we're doing to our K through 6 graders. And I would hope that the language can be adjusted in this proposal going forward, because I'm not so sure that everyone understands the ramifications of that sizable group of students without any education. The bill is silent as to where those children would receive their education. And it's disheartening for me, as working in education all these years, to think that we would just allow so many children not to have access to a quality education, and particularly given what we've experienced in this pandemic. So for me, that's actually a very crucial component of going forward. Also, I just truly, again, wish that we had had more time for the collaboration. There was virtually very little collaboration between the Department of Public Health and the Department of Education on this proposal. And although it's in this bill and asked for that collaboration, it would have been much better had we had that collaboration prior to getting to this point. So I just wanted to make those comments, and I appreciate you giving me a second time to state it. Thank you.
Thank you, Representative. And we take your point, and we're hopeful now that that dialogue has been initiated and will continue in a productive manner. I see no further questions or comments. I believe we're ready for the vote, Madam Administrator.
Senator Darcy Abrams,
Senator Darty Abrams votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers,
Senator Summers votes no.
Representative Pettit,
Representative Pettit votes no.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts,
Representative Betts votes no.
Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes no.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Representative Foster votes yes.
Representative Django,
A little more about that a little later.
Representative Django,
Representative Jenga votes yes.
Representative Green,
Representative Green votes no.
Senator Haskell,
Senator Haskell votes yes.
Senator Kasser,
Senator Kasser votes yes.
Representative Cavros DeGraw,
Representative Cavros DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes no.
Representative Clarice Detrier, Representative Lenahan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes no.
Senator Moore,
Senator Moore votes yes.
Senator Moore, could you repeat your vote for me, please?
Senator Moore votes yes.
Thank you. Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon,
Representative Scanlon votes yes.
Representative Terciak,
Representative Terciak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Representative Zupkis, I did not see you on screen, please.
Representative Zupkis votes no.
Thank you.
You're welcome.
Senator Wong,
Senator Tony Wong votes no.
Representative Clarice Detrier. Thank you, Mr. Chair.
Mr. Chair,
That's great.
if I might, just for the record, I think Representative Clarice Detrier will be voting, but just for the record, she's attending a funeral and that's why she's missing these votes.
Thank you for that information, Representative. Hopefully, well, she'll have plenty of opportunity post that event to register her vote. Thank you for that. Again, we will be holding votes open for roughly an hour after conclusion of our deliberations today. We will now move to item 3 of the agenda, which is Senate Bill 238, an act increasing oversight of mergers and acquisitions of group practices. This is a JFS to the floor. Do we have a motion?
So moved.
Do I have a second?
Second.
Moved and seconded. Thank you. This bill reflects on an emerging trend towards corporate ownership of group practices that may actually change the priorities of those practices in favor of profitability as opposed to focusing on quality and access. Current law requires a CON, a certificate of need, for certain ownership transfers of group practices of 8 or more physicians. This bill would lower the threshold to group practices of any size, excuse me. As under current law, CON approval is not required of both parties or physician groups not affiliated with a hospital, insurer, or similar entity. And this bill, by definition, eliminates the current presumption in favor of approval for certain CON applications for group practice transfers. This also requires group practices of any size, rather than just those with 30 or more physicians, to annually report certain information to the AG and to the Office of Health Strategy. As under current law, this requirement applies to group practices that are not affiliated with a hospital. I will add that whereas I totally concur with the intent of this bill, I am troubled by the virtual unanimity of testimony suggesting that our proposed solution is not the appropriate one. And the reason why we are continuing to ask for the committee's indulgence and pass this bill out of committee is so that we have the opportunity to engage further with those who have testified in trying to discover a solution that more appropriately meets what we believe to be the concern, the problem that is continuing to grow in our state and indeed in other states, which is the focus of group practices away from their core principles. But by no means are we interested in creating new problems for group practices or discouraging the growth of practices in our state or in attracting practitioners to our state. Indeed, we have another bill, which you will recall, which we'll talk about recruitment and retention, which intends to do just the opposite, which is to attract more physicians, particularly those in areas of shortage, to our state. So although this bill has not accomplished its end in its current form, the chairs ask for your indulgence to pass this out of committee so we can continue that conversation. The chair recognizes Senator Anwar, followed by Representative Pettit.
Thank you, Mr. Chair. I think you touched on some of the things I was going to mention. It was quite clear that the Office of Health Strategies does not have the bandwidth, or it appears the interest to address this issue from the way the bill is written. And it was also clear from literally every single testimony that the physicians and the practice owners were not interested in that either. Having said that, there is a challenge that's there, and this bill is trying to address that challenge. But it's in its current form, it does not address the challenge. It actually makes the challenge worse. So with the commitment and understanding that we will be addressing this issue, which so badly needs to be addressed, and change the language and the strategy around it, and in trusting both my chairs, I'm going to vote in favor of it. But in its current form, it is not a complete solution to what we need to address. And I know that we will be working on a collective solution going forward, and that's why I would support it right now. But again, in its current form, it's not a solution. I want to urge and maybe make a statement that if it goes for vote in General Assembly in its current form, I would be opposed to it. Thank you so much, Mr. Chair.
Thank you, Senator, for your understanding on this point. And I will add that if the chairs are not satisfied that upon further effort that we have actually solved the problem, we will not recommend it for a vote on the floor. Representative Pettit, followed by Representative Terziak.
Thank you, Mr. Chairman. Yeah, I think there's too many problems with this bill. It purports to perhaps help the playing field in terms of small practices, but really doesn't address any of the underlying causes that are impacting small practices. And I think, in fact, if passed in current form, will make it less attractive to practice in the state of Connecticut. I think improvement would mean basically a strike all bill. I think there's almost nothing here that small practices would be helpful to them. It's somewhat punitive in nature, increased administrative burden. So unless you're really anticipating a complete rewrite and involving other committees, because many of the barriers in place involve regulations, malpractice, high deductible healthcare plans, issues that involve other committees. I don't know how we can improve this. So at the moment, I have to oppose this bill. Thank you, sir.
Thank you, Representative, and I certainly understand your points. And normally I am not a big fan of strike alls, but in this case, I would make an exception. And again, if it turns out that we cannot, in a reasonable period of time, resolve the issues that you alluded to, not only would we not bring this bill forward, we would certainly try to engage those parties again, as I said, and perhaps, as you say, this might fall more neatly into an insurance committee bailiwick. But unless we're satisfied we've actually addressed the problem as intended in this bill, we would not move it forward. Representative Terziak, followed by Senator Summers.
Thank you very much, Mr. Chair. I'm heartened by your comments about how much this would have to change in order to move forward. But still, I would like to vote, I'm planning on voting no to flag my concerns about the bill. I'm not planning on voting no to kill the bill. I'm going to pay careful attention to the vote. And this vote will not die because this bill will not die because I voted no. We're allowed to change our votes. So I want to make it clear what I mean by flagging it, not participating in killing it. I like your comments about strike all amendments, because I think this committee has had wonderful ideas that haven't moved forward, like more transparency for for-profit hospitals to match the nonprofits, and many other good ideas that just couldn't be taken up this year. could be put into this bill instead of what's there now? Should you and the interested parties be unable to come together for total agreement? So to flag the bill, not to kill it, I will vote no and pay attention to the vote count. Thank you very much, Mr. Chair.
Thank you, Representative, for those comments. Very interesting. I'm always intrigued by the legislature's affinity for flags. Senator Summers.
Yes, my comment on this bill is, though, I think well-intended. It has, if it were to not significantly change, like be a completely different bill, it has unintended consequences. We are in the midst of trying to attract physicians and other healthcare clinicians to come here to hopefully set up an independent practice. And this idea that if you have your own established practice, that you have to get permission now from the state of Connecticut to sell your practice if you're forced in a position where you have to, or you just choose to, really is a disincentive for people to want to come to Connecticut to set up a business here, especially as a clinician. We already have other reasons why it's difficult to attract healthcare providers here in the state of Connecticut. So this will just add to it and have another negative, I guess, strike in the column to why Connecticut is someplace that you may choose to look over as a clinician moving forward. I think the intention is, a positive one, looking at, very large for-profit Wall Street hedge funds purchasing a bunch of different practices and gobbling them all up. But I think that is something that should be handled when we tackle CON. And I think that this bill just needs so much work, and we're late in the process, that I think that I have to be a no on this particular bill at this point in time. Thank you.
Thank you, Senator. I concur that sooner or later, this committee is going to have to address CON, no matter how reluctantly. So,
Representative Steinberg, unfortunately, sorry to interrupt, I'm not able to raise my hand.
we'll note that. We'll have you after Representative Linehan, if that's all right, Representative.
Absolutely. Thank you.
Representative Linehan.
Thank you very much, Mr. Chair. I just have a question. As you move forward with this, I will vote yes on this today. I do trust that the chairs are going to work diligently to actually work to solve problems before it's called for a final vote on the floor. But I do wonder, when I talk to private practices, their concern is that there is no parity in payments regarding going into private practice as you get if you are gobbled up by a conglomerate like Hartford Healthcare and so on and so forth. And as we've been discussing, I don't think that's the purview of this committee. So does that mean that anything regarding that cannot be addressed in this bill as we move forward? Or does it mean that if we, or if you as the chairs or even the committee collectively decide to look at that moving forward, that it will ultimately involve the insurance committee?
I think it's a great question, Representative. I think almost inevitably the insurance committee would have some role on this. You know, when we're talking about the marketplace, commerce, if you will, it's never quite as clear cut what the Public Health Committee's role is. Certainly the CON process is intended as one pathway to assure that the health interests of the people of Connecticut are addressed. And that may be the only aspect of which we can control this. But I do have to say, I agree that we have a problem here, which is not serving the interests of the people of Connecticut. It is not isolated just to corporate takeovers. There are other aspects of concentration of resources with some very large entities that also create potential inequities. It is indeed an interesting question. What is the appropriate role of the Public Health Committee in participating in those changes in the marketplace? We would all acknowledge that healthcare remains a fast evolving landscape, which creates inequities, even if not intentionally, I think it is indeed our responsibility to at least pay attention to those changes and to make sure that we focus on those aspects that are pertinent to our committee, particularly as they relate to quality and to access and even to price and cost. And that's what we'll try to do. If it doesn't seem we can get to that point, the bill will not move any further than this committee's approval. Hope
Thank
that-
you very much, Mr. Chair. And I just want to, I'm glad to hear you say that, because as we often hear that, oh, this bill shouldn't be in front of this committee and so on and so forth. But you are absolutely correct that when smaller practices are taken over by larger conglomerates, that can affect the patient and that can affect healthcare, especially personalized healthcare. So I do agree with you that the Public Health Committee does deserve to have this conversation, at least have a stake in the argument. So I appreciate your time. Thank you.
Thank you, Representative. Representative Betts.
Thank you, Mr. Chairman. I'd like to offer a suggestion for the co-chairs to think about regarding this bill. It's obvious that many of us have major questions, and it could very well lead to a strike wall if the bill moves forward. But rather than necessarily take a negative vote against a proposal made by Senator Looney, I wonder if we could put it on hold to allow you to speak to him and the proponents about what could be in there, rather than try and do a strike wall, which would include language more than likely that has not had a public hearing, in which this is an enormously complex issue that would require probably more than one committee to review. Would it not be more diplomatic to just simply hold it, have some discussions, and see if there's some merit or benefit to moving forward?
Thank you for the question, Representative. And of course, we'd like to resolve it. And of course, we've also had some conversation with Senator Looney's office. It is our intent to conclude this committee's activities today. So I would not be in favor of that. Given the complexity of what is still before us, I'm not sure we could resolve it in a period of a couple, 3 days. Senator Abrams, would you choose to comment?
Yes, thank you, Representative Steinberg. I would just say that, exactly what you said. I think that this would be a more long-term conversation than in the next few days. However, I have been in touch with Senator Looney's office, and they're very open to changing and to looking at this bill more closely. And if it can't be resolved, then it won't be brought forward. It would be that simple.
So thank you for the comments, Representative. I think they are constructive. But the path we're choosing to take is we're asking you to help us get it out of committee, and it will not go forward unless we can fix it.
Okay, thank you.
Seeing no other comments or questions, I believe we're ready. Oh, I'm sorry. Last minute, McCarty, right under the wire here, please.
Right, and I apologize, Mr. Chairman, for that. I don't have an affinity for voting no, but I felt it, I'm compelled to just say that I have a lot of reservations about this bill, and because I know over the years we're trying our hardest to attract more physicians to the state of Connecticut, and I feel that this bill puts too much pressure on the smaller group practices, and that I really hope that you'll be able to work on it and to improve the language. But I'm going to have to be a no today, because I do think it does too much damage and it's too overreaching for me. So I felt compelled to just make a statement. Thank you, Mr. Chairman.
Thank you, Representative. I think virtually all of us have significant concerns about the bill as written and its impact on small practices. So it does not surprise me if one or more of us choose to have a little fun with flags with regard to this bill. I see no further comments or questions. Madam Administrator.
Senator Darcy Abrams,
Senator Darty Abrams votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
Senator Tony Huang votes no.
Senator Summers,
Senator Summers votes no.
Representative Pettit,
Representative Pettit votes no.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts,
Representative Betts votes no.
Representative Carpino,
Representative Carpino is a no.
Representative Cook,
Representative Cook votes yes.
Representative Cook, I did not see you on screen, please.
Right here.
Thank you. Representative Dauphiné,
Representative Dauphiné votes no.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster,
Representative Foster votes yes.
Representative Jenga,
Representative Jenga votes yes.
Representative Green,
Representative Green votes no.
Senator Haskell, Senator Kasser,
Senator Kasser votes yes.
Representative Cabras DeGraw,
Representative Cabras DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes no.
Representative Clarice Dietrich, Representative Lenahan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes no.
Senator Moore,
Senator Moore votes yes. Senator Moore votes yes.
thank you. Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon,
Representative Scanlon votes yes.
Representative Terziak,
Representative Terziak votes no. Thank you.
Representative Young,
Senator Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Senator Haskell, Representative Clarice Dietrich. Thank you, Mr. Chair.
Thank you, Madam Administrator. Again, we'll be holding the votes open for about an hour after we conclude. Next up is item 4 on the agenda, Senate Bill 328, an act concerning the provision of developmental and social services in the state. This is a JF to the floor. Do we have a motion?
So moved.
Second.
Moved and seconded. Thank you. This bill actually is an amalgamation of 3 bills that were brought forward to the committee. It still is a work in process in some ways. There are some issues with it, as we've heard from testimony. But just to review, the elements that are currently in this bill require the DDS commissioner to develop a strategic plan to reduce the wait time for DDS services, something we all think is very important, and report this plan to the Public Health Committee by January of 2022. It requires the OPM secretary, starting in October 2021, to consult with relevant stakeholders before implementing any plan to close a DDS facility. It requires the DDS commissioner to provide notice to each person with intellectual disability or his or her legal representative before the person's eligibility for state services ends. Authorizes the DDS commissioner to contract with hospitals and nonprofit organizations to provide social services and referrals for these services to frequent users of hospital services. Ideally, they would not necessarily need to take place in the hospital setting or emergency departments, and establishes a 9-member task force to study DDS's level of need assessment system and require that task force to report its findings to the Public Health Committee by January of 2022. So it's indeed a sincere attempt to begin to address some of the longstanding problems we've had with those with disabilities. Clearly, funding is also at issue, and that is not necessarily in the purview of this committee, but it is our sincere effort to try to address some of these concerns. Are there any comments or questions? If not, Madam Administrator, we are ready for the vote.
Senator Darcy Abrams,
Senator Darty Abrams votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong,
Senator Tony Vaughn votes yes.
Senator Wong, I did not see you on screen, please.
Senator Tony Vaughn votes yes.
Thank you. Senator Summers,
Senator Summers votes yes.
Representative Pettit,
Senator Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts,
Representative Betts votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes yes.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster,
Representative Foster votes yes.
Representative Jengo,
Representative Jenga votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell, Senator Kasser,
Senator Kasser votes yes.
Representative Cabros DeGraw,
Representative Cabros DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes yes.
Representative Tiredis Dietrich, Representative Lenahan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes. Senator Moore votes yes.
thank you. Representative Parker,
Representative Parker votes yes.
Representative Ryan, Representative Scanlon,
Representative Scanlon votes yes.
Representative Terziak,
Representative Terziak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Representative Elliott, Senator Haskell,
Representative Elliott votes yes.
thank you. Representative Tiredis Dietrich, Representative Ryan. Thank you, Mr. Chair.
Thank you, Madam Administrator. Again, we'll be holding the votes open. We now move to the next item on our agenda. Item 5, Senate Bill 1070, enacted allowing advanced practice registered nurses and physician assistants to issue home health orders. This is a JF to the floor. Do we have a motion?
So moved.
So moved. Seconded then.
Moved and seconded. This bill is something that was clearly highlighted as an issue during the pandemic when we found that there was a bottleneck in getting home health people into the appropriate settings to help people because they did not have the sign-offs to do so. This recognizes the existing executive order and codifies into statute the ability for registered nurses and physician assistants to issue those home health orders. We think that this is something we should have fixed even before the pandemic. It recognizes the appropriate scope of these practitioners in this extremely limited context, simply to issue orders for home health care, hospice, and home health aid services. Currently, only a physician can do so. That's it. Pretty straightforward. Any questions or comments? Seeing none, we're ready for the vote, Madam.
Representative Steinberg, I'm wondering if we could start a consent calendar, if that would be possible.
Are you suggesting that, Madam?
I am suggesting that. I'm hoping that we can do that.
Does anybody object to the establishment of a consent calendar? Seeing none, we will establish a consent calendar. Is there anything that anybody would like to add to such a consent calendar?
I would like to add this bill, Senate Bill 1070.
Are there any objections to adding this to the consent calendar? Seeing none, Madam Administrator, please create such a calendar and add it to this list. Thank you, Senator. Moving right along. Let's see what we have next for everyone. Item 6, Senate Bill 1083, an act concerning various revisions to the public health statutes. This is a JFS to the floor. Do we have a motion? Come on, everyone.
So moved.
Move.
Second.
Do we have a second?
Second.
Moved and seconded. This is our committee's revisions bill. It contains many sections. I will choose not to go into detail of each one because it actually numbers up to 87, though I would suggest that most of it is really caught up in the latter sections. I'm glad to answer questions with regard to it. And I don't see any, so everybody's very up to date with everything that's in this bill. It pleases me very much.
Representative Steinberg, I'd like to make a motion to move this to the consent calendar.
We recognize that. Does anyone object to including this in our newly formed consent calendar?
Yes, Ann Dauphiné would be a no on this bill.
Thank you, Representative Dauphiné. This will not qualify then for the consent calendar, but seeing no further comments or questions, I guess we're ready for a vote, Madam Administrator. Representative McCarty, once again, the last minute wonder. Here we go, Representative McCarty.
Yes, and I do apologize greatly, but I had to be at education during some of the testimony, and I just curious, and I'm not objecting to it. I think it's a good thing, but I know we put a lot of extra work on our Connecticut medical examiner in the past, and will there be flexibility in that one contact hour of training for the medical examiner? Do you know if there's some flexibility there in how the training will take place?
Thank you for the question, Representative. I'm not an expert on either the requirements for CME or the particular imposition on medical examiners in this context. My understanding is at least we've had some initial conversation with the medical examiner with regard to this, and hopefully they will not be too onerous. We will assure ourselves that is the case before we bring the bill to the floor.
Okay, thank you very much. Thank you.
Representative Pettit.
Thank you, Mr. Chairman. Hopefully I'm not confused. This is raise bill 1083. In section 2, is the issue, the external defibrillators. There's some concern that this, with the start date effective 10/1/21, concerns that we should make it 10/1/22 to allow people to review the market, see what the training issues will be, and see what the issues will be in terms of their liability insurance. And I don't know if that's something you consider here you'd want to do on the floor if it moves through, Mr. Chairman.
Thank you, Representative, for bringing that up. Indeed, we'd be willing to have a further conversation if that date seems a little bit too precipitous to bring all the parties in line. It's certainly something that could be easily remedied if that's the problem.
So if it moves out, prefer to do it in the House as opposed to in committee now?
I'm not sure I'm really prepared to entertain an amendment other than to give you our assurance that we will have that conversation and that is easily changed if that proves to be a problem.
Thank you, Mr. Chairman.
Thank you, Representative. Representative Kennedy.
Thank you, Mr. Chairman. With the same concerns with the AEDs for the local gyms, my other concern besides the date and pushing that out is as they suffered for a long time during the shutdowns, my concern is that they would also have an added insurance burden with the installation of an AED in their gymnasium. So I just wanted to bring that to the forefront for possible discussion down the road. Thank you, Mr. Chairman. I will vote yes to bring this out because there are some other good parts of this bill, but there are also some concerning ones, this being a part of it. So thank you, Mr. Chairman.
Thank you, Representative, for that. Again, we're glad to look at it. Certainly, I share your concerns about the impacts that the pandemic has had on gyms, but I could also argue that it's almost surprising that they didn't have this requirement before, looking out for everybody's health care. And I am not familiar with the insurance implications. Seeing no further questions or comments, we're ready for the vote, Madam Administrator.
Senator Darty Abrams,
Senator Darty Abrams votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers, Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts,
Representative Betts votes, Representative Betts votes no.
Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes no.
Representative D'Amico, Representative Elliott,
Rep. Elliott votes yes.
Representative Foster,
Representative
Jengo, Representative Foster,
Rep. Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Green,
Representative Green votes no.
Senator Haskell, Senator Kasser,
Senator Kasser votes yes.
Representative Cabras de Graw,
Representative Cabras de Graw votes yes.
Representative Kennedy,
Representative Kennedy votes yes.
Representative Claudius Detrier, Representative Lenahan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker,
Representative Parker votes yes.
Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon,
Representative Scanlon votes yes.
Representative Terziak,
Representative Terziak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Wong, Senator Summers, Representative D'Amico,
Representative D'Amico votes yes.
Senator Haskell, Representative Caritas Beecher. Thank you, Mr. Chair.
Thank you, Madam Administrator. We'll be keeping the votes open. I believe we are now ready for item 7 on our agenda, Senate Bill 1085, an act concerning suicide prevention. This is a JFS to the floor. Do we have a motion?
So moved.
Do we have a second?
Second.
Thank you. Moved and seconded. As all of you will recall from the testimony we heard in the public hearing, this is a very important bill for us where we're intending to really see what we can do to bend the curve on suicide in the state. However, we also heard loud and clear from the testimony that the language in the bill probably doesn't do what we want it to accomplish, and that our existing advisory working group is a more effective foundation for moving forward with this work rather than replacing it with a new entity. And indeed, that is the chair's commitment to rework this bill to enhance and strengthen the existing working group and not replace it. So that this bill, should it be passed out of committee, would be reworked on that basis. And I'm sure there are other things we could also talk about, but that's the most important aspect of what we are talking about. I'll entertain questions and comments. Senator
Chairman?
Anwar, followed by Representative Terziak.
Thank you, Mr. Chair. Again, I'm glad you started off the conversation with the changes that may be needed. If you remember in the public hearing, I had mentioned about 2 bills that have passed the Children's Committee. I know Representative Linehan is over here in this committee as well. She's been working on this area for the children for the past many years. And the bills that we have from the Children's Committee are some that are very much appreciated by all the advocates, and because the children's part is also in this bill, and there is a strategy to address this, I would suggest that it may be worthy to look at, I understand, Bill 611 and also SB2, which does have the language that would enhance this bill from that perspective, and it's already been accepted and addressed by the advocates. And for the adults, I agree with you about the committee. That's pretty loud and clear, and I think there's truly an area of opportunity. But the most important underlying thing is that this issue needs to be addressed, and I completely agree with you, Mr. Chair and Madam Chair, about the value of addressing this, and then the mechanism. We're getting closer to where we need to be, and I am going to support this for that very reason, because I have your commitment and Senator Abrams' commitment of continuing to enhance and work and protect our adults as well as our children. So thank you for your work, and thank you for addressing this important issue.
Thank you, Senator, and thank you for pointing out the other bills that we should be considering, as well as much of the testimony we heard in the public hearing process. We know that we have a ways to go with this bill. There are various aspects that we would like to consider because of the real critical importance of addressing the scourge of suicide in the state of Connecticut. So we are definitely going to look at all those things, I do assure you. Representative Terziak, followed by Representative McCarty. Raised her hand kind of early this time, but Representative Terziak first.
Thank you very much, Mr. Chairman. And you took care of most of my concerns, maybe all of them, with your opening comments about changes coming in this bill. As you know, Demas is near and dear to my heart. And I just wanted to make sure that at this level, we included them in the conversation. They do a lot of good work around suicide, and I'm sure in your opening remarks and in our speaking last night, that that's a fine example of an agency that was left out unintentionally and will certainly be there. And I appreciate your reassurances, Mr. Chair. Thank you very much.
Thank you, Representative. Yes, you know, perfect example of good intentions. We did not intend to upend the apple cart in quite the fashion that apparently we have, and we will address that in revisions to the bill. Representative McCarty, followed by Representative Linehan.
Yes, thank you very much, Mr. Chairman. And you actually relieved some of my concerns with your opening comments. I'm very pleased to hear that this Connecticut Suicide Advisory Board will not be dissolved, if I heard you correctly. I know in my district, and I've worked very closely with Ann Daigle from the Brian Daigle Foundation. They do tremendous work. She's part of this board, as well as other mental health organizations. I know Representative Linehan will speak and has worked hard on this, and it was really troublesome to me to think that we would dissolve this organization that's nationally recognized and doing such wonderful work. I would say I do understand the concept of interagency work, and I think that's great. You already have 3 organizations, so if you wanted to consider adding other commissioners on, that would be fine. But as long as I have your firm word that the current makeup of the Connecticut Suicide Advisory Board will not be dismantled, I can be in favor of the bill today, but it would be on your word, Representative Steinberg.
Thank you, Representative. You have my word. I won't speak for my co-chair other than the conversations we've had. We are committed to making this bill work for the people of Connecticut to reduce suicides. I don't think there's any way, unless you just weren't paying attention, that you didn't hear that we were heading down the wrong path. And we are absolutely going to rewrite this bill in order to enable the existing working group to do even better work. And thank you for pointing out just one of the many great organizations that are exemplifying the kind of constructive efforts that we hope to emulate and indeed spread across the state, assuming we can afford to do so.
Representative Steinberg, may I just add that you certainly have my word as well. And I want you to know that in the substitute language, it addresses some of that. I will say that writing legislation in this virtual world has been challenging. And I think this is a perfect example of where it went off the mark, totally accidentally, I will say. We do absolutely acknowledge the incredible work the advisory board is doing. And it was really our intention to put it into statute so it would exist, and to build upon that incredible work by adding other agencies like Representative Terziak mentioned, and to expand the age in which they're looking at, because we know that preventing suicide goes beyond just children, and that we need to look at what we're doing for adults as well. So this bill was really intended to be an acknowledgement of their incredible work and to support it. So somehow that got lost in translation. I apologize for that, and apologize to anyone who felt that that was a slight in any way. It absolutely was not. And we actually have a meeting scheduled for tomorrow morning to continue the work on this. So you have our word that we attempted in the substitute language to address some of that, and that we will continue to work until we've got it right.
Thank you, Senator. Hopefully that gives you some faith in our good intentions.
Yeah, yes, it does. And I thank you very much to the leadership of the Public Health Committee. I was paying attention, Representative Steinberg. I just wanted to hear you restate it. So thank you very much.
I'm sure everybody in this committee pays attention all the time. We expect no less. Representative Linehan, followed by Representative Calvaros-DeGraw.
Thank you, Mr. Chairman. First, I want to say thank you to my colleagues who mentioned the work that I've been doing regarding suicide prevention over the years. It is wonderful to be noticed for such important work. So I thank you for that. And I have spoken often with Senator Abrams regarding this subject in its totality. I do trust that she's going to continue to work on this, and I know that her intentions were fantastic. The work of the Suicide Advisory Board is really second to none. Connecticut has a wonderful group of people who work towards the shared goal of ending suicide, not just for children, but also for adults. As chair of the Children's Committee, my purview has really been on children. We've been passing out numerous pieces of legislation in order to share that end goal, including also legislation that was done in 2019, which created the Social Emotional Learning Collaborative, which is actually also working with the Suicide Advisory Board. So there's a lot of work going on. And as chair of the Children's, I want to thank everybody for that. However, I'm also a legislator in other committees like this one. And so therefore, I don't always focus solely on children. And to that point, I want to bring up something to the chairs for consideration, especially during your meeting tomorrow and moving forward. Currently for children, there is something called the Access Mental Health Line. And what this is physicians, pediatricians who are faced with the mental health challenges for their patients, but don't necessarily feel that their expertise allows them to move forward in prescribing medications or even working towards changing medications or looking at side effects or the next steps, whether they be hospitalization or an outpatient program. What they do is they call this number the Access Mental Health Line that is staffed by licensed psychiatrists who then will review the case, call them back and give them information on how to best help their patient. I think this Access Mental Health Line needs to be funded for adults as well. We, all of the comments that I've heard from providers out in the general public and in my district, there has been concern expressed that even when it comes to the mental health of adults, that some physicians may not feel that this is their expertise and they would know exactly what to do next, given the fact that mental health and the problems associated around mental health, they're individualistic, and each instance may need a different pathway. And if a general practitioner doesn't feel comfortable with that, what do? Then they try to refer to a psychiatrist. And I can tell you, and I'll speak on one more bill today, but I will tell you that finding a psychiatrist in this state right now is to see you soon, it's almost impossible. So I think that if you are very concerned about supporting the mental health of adults and their and tackling the suicide problem regarding adults, then we need to fund Access Mental Health as an adult line as well. And it is not a large expenditure. We're really just paying for a couple of doctors on call during regular business hours, but that needs to be addressed. And I think that this is the exact bill where that can be done. I'm willing to offer my time and energy to work towards that. And I appreciate you all considering that and working towards that. Again, it's the Access Mental Health Line for adults. Thank you very much, Mr. Chair.
Thank you, Representative. And I think we'll take you up on that offer. And I hope there are members of the Appropriations Committee listening in on today's conversation, because we're going to need their help. So many things we could accomplish have we the financing to do so. So many good programs that are operating in our state that we could scale up if indeed we had those resources. So that's something we can talk about. Representative Dauphiné. You're on mute, Representative.
Sorry about that. Thank you, Mr. Chair. I just wanted to say I will be a no on this bill today in its current form, but I want to reserve my option to change my vote on the House floor with the promised changes. Thank you.
Thank you, Representative. Flag duly noted. Representative Kennedy.
Thank you, Mr. Chairman. No flag for sure, but I just want to thank you for your reassurances that this bill will go through some changes. I will vote yes today, but reserve that right to change it on the floor should the changes that we're asking for not come to fruition. But I do thank you, Mr. Chairman, for your thoughts and reassurances. Thank you.
Thank you, Representative. Indeed, we will make significant changes to the language in this bill. Representative Dauphiné, I see your hand is still up. Do you have a second time, or is it just a matter of taking it down again?
No, sorry, I'll take it down.
Okay, then I do think that ends this aspect of dialogue. He says dawdling. Oh, actually, I guess we have some no votes. So, Madam Administrator, we're ready for the vote.
Senator Darcy Abrams,
Senator Darty Abrams votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes. Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers,
Pass.
Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts,
Representative Betts votes no.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Cook, I did not see you on screen, please.
Right here.
Thank you. Representative Dauphiné,
Representative Dauphiné votes no.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Rep. Elliott votes yes. Still voting yes. There we go.
Representative Foster,
Rep. Foster votes yes.
Representative Jengo,
Representative Jenga votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell, Senator Kasser,
Senator Castor votes yes.
Representative Cavers DeGraw,
Representative Cavros DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes yes.
Representative Clarice Dietrich, Representative Lenihan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore,
Senator Moore votes yes.
Representative Parker, Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon,
Scanlon. Then is it somebody else than me? Or I'm already unmuted.
Representative Scanlon, Representative Terziak,
Representative Terziak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Wong,
Senator Tony Vaughn votes yes.
Senator Summers,
Senator Summers votes yes.
Senator Haskell, Representative Clarice Deacher, Representative Parker, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. We will be keeping the votes open. We're up to item 8 on today's agenda, Senate Bill 1086, an act concerning mental and behavioral health services. This is a JF to the floor. Do we have a motion?
So moved.
Moved. Do we have a second?
Second.
Moved and seconded. This is a good bill to come right after the previous one. We've talked about suicide prevention. We also need to talk about the broad issues of mental health and behavioral health services, and this will actually lead into the next bill we'll consider about retention and recruitment. This bill makes a variety of changes, and in itself probably is not the end point. It will have further conversation, but it eliminates the requirement that psychiatrists, psychologists, social workers, and marital and family therapists provide outpatient mental health treatment to a minor without parental consent or notification. They should reassess. It eliminates the requirement that they reassess after the 6th session whether continuing the treatment without such consent or notification is still warranted. Let me make sure I made that clear. Eliminates the requirement that these mental and behavioral health workers who provide outpatient mental health treatment to a minor without parental consent reassess after the 6th session whether continuing the treatment is indeed warranted. Okay, hopefully that's clear. Second, requires physicians, PAs, and APRNs starting as of October 1st of this year to perform a mental health exam on a patient during the patient's annual physical exam. Now remember, only during the annual physical exam, which is by definition typically longer than just your routine wellness appointment, but we will talk about that further. Establishes a 10-member task force to study the health benefits of psilocybin and requires the task force to submit its findings and recommendations to the Public Health Committee by January 1st, 2022. That should be very interesting. And prohibits certain healthcare insurers from requiring beneficiaries to use step therapy for drugs prescribed to treat a behavioral health condition. Obviously, that puts the responsibility and the authority back in the hands of the practitioner as opposed to the health insurer or the PBM. And I will entertain questions and comments. Representative Pettit.
Mr. Chairman, I wonder if you would allow me to propose a very minor verbal amendment to this bill.
Well, I certainly can't stop you, so go ahead, Representative.
Thank you, Mr. Chairman. In section 2, the passage about performing the mental health exam, I wonder if we can just insert lines starting at line 57. Shall perform a mental health examination on a patient during the physician's annual physical examination of the patient as the practitioner deems clinically appropriate. As the practitioner deems clinically appropriate. If you'll indulge me for a minute, you're right, during physical examinations, you may have 20 minutes, may have 60 minutes, depending on how it's set up and how your practice works. If it's someone who's been in for a long time, you have a chance to assess their eye contact, body language, speech, mannerisms, et cetera, how they're doing. In essence, you're always doing an assessment of their mental and social nonverbal cues. There certainly were times in my career where someone came in for an examination, they didn't look right, and you found out that there were marital issues, that there were problems with children, that there were problems with drugs, there were problems with alcohol, and the physical exam turned completely into a mental health examination for 30 minutes with a referral outside to a different practitioner, psychologist, psychiatrist, whatever was clinically appropriate. So I think it's very hard for us to micromanage the practice of medicine from afar. I think it's a I like the idea. It's really an educational thing. It's a reminder. But I think a blanket statement sort of saying that shall perform, I think creates an issue where there shouldn't be one. So I think if we would add as the practitioner deems clinically appropriate, I think makes it more palatable, more consistent, sends the message that we're concerned about mental health, and it's an important issue for the APRNs, the PAs, and the MDs, the DOs taking care of patients. Thank you, Mr. Chairman.
Thank you, Representative. Just for the purpose of process, if you could repeat your proposed amendment, and hopefully the LCOs can follow that, and all the members will understand precisely the language change you're entertaining.
Well, the current line, starting in line 57, shall perform a mental health examination on a patient during the physician's annual physical examination of the patient, and I'm saying as the practitioner deems clinically appropriate, because it could be an APRN, it could be a PA, although the previous line states physician's annual, it could be any of the other two providers as well, as the practitioner deems clinically appropriate.
Representative, sorry, this is Eileen Lawler from LCO. Can you make your amendment subject to LCO technical and conforming changes, please?
I will allow that, Madam Lawyer. Thank you.
What she said is, I guess, the answer. If our LCO has effectively absorbed the requested amendment, I will seek a second.
Second.
Seconded. We now have a motion on the floor for an amendment. Do we need to recess for any period of time, Madam LCO, for you to get it in order, or are we ready to go?
I think we're ready for a vote.
Very good. We may have a few comments before then, so that'll afford you a little bit more time. Representative Linehan, followed by Senator Summers.
Thank you, Mr. Chair. And this is solely regarding the proposed amendment. I appreciate the concerns of Representative Pettit, who is himself a clinician. So I understand where you're coming from, and I appreciate that. However, I have to respectfully disagree. And I just want to take a step back and look at how these assessments have been used and how they've been beneficial. The Connecticut Children's Medical Center does an assessment for every patient that comes through their emergency room. They could be there for a broken ankle, they could be there for an asthma attack, or they could be there for some sort of a mental illness issue. Each child is screened age appropriately for mental health issues and concerns. As of November and December of last year, they were at 26% of all people, of all children coming in through their emergency room for any issue, was then referred to the next level of screening for mental health concerns and suicide ideation. This is a huge number. If memory serves, it was somewhere around a 10% jump from that time last year. And so this is because they have ensured that for every person that is coming through, that they are doing this screening. So I think that it has proven to be a beneficial screening and that it may have found issues that would not have been there if we were only talking to a child with a broken leg. And so when I say these numbers regarding CCMC, adults deserve the same consideration. And, you know, I may be going to my primary care physician for a physical, but if someone doesn't ask about my mental well-being, then I am not getting the full line of questions that I should be getting as a patient from a physician who cares. I recognize that physicians such as Representative Pettit may already be able to do so. And we're actually, if you look at the legislation, it's during their yearly visit. So it's not even necessarily every time that a patient goes in, it's really during their yearly physical. I think that this is imperative that we keep this in, and I would urge my colleagues to vote no on this amendment. Thank you.
Thank you, Representative. I see Representative Pettit's hand is up. Is that up in response to Representative Lenahan, or you would like to reserve your comments for later?
I'll wait till I hear the other comments. Thank you, Mr. Chairman.
Thank you. Senator Summers, followed by Representative Cavros DeGraw.
Yes, thank you. I was wondering in section 3 of the bill, where we're establishing a task force.
I'm sorry, Representative. We're on the amendment, Senator. We're on the amendment
Oh,
currently.
sorry. Okay, I'm going to be quiet.
We'll come back to you then. Representative Cavros DeGraw.
I absolutely am thrilled that Dr. Pettit is putting in that amendment. I would like to add a little bit to what Representative Linehan said about this. Not so much in terms of what TCMC does, but what two practices that we frequent, both my pediatric practice and my OBGYN practice actually do. I will say that when I take my children over a certain age to my pediatric practice, there's a very quick, you basically use a grease pen. It's the short, what they call the depression quiz. And I know that it has helped other people, but I just will speak to my own experience that like the suicide bill is very important to me. That this piece of it is, it is important. And I think that it should be at the physician's discretion to the point that it is helpful. Because in our case, my daughter had been undergoing, and I share this with her permission, she'd been undergoing a really difficult situation for a long time that was considered situational depression. And unfortunately, it had gone into clinical depression, except how we figured that out was that little form and that little check-in. And it was literally done with no real additional time or work. It was handed to us with our other paperwork filled out, and off we went into the room. And it was one of those visits that at a certain age, the parents are not always in the room with the pediatrician. It's usually the nurse and the pediatrician. And so before the pediatrician went in, I just said, hey, I know what's on that form. So when we have to have this conversation after the fact, I just want you to be aware that I'm aware of what's on that form. And so that's great for kids, but I do think for adults, and I think about my GYN practice where they do, as part of the intake, they ask me if I feel safe at home. Regarding domestic violence, it's the same kind of wellness check that could easily occur in a almost split second, honestly. It's not I don't think it's a huge barrier, but I do understand the importance to the physicians of having some control over that. And so I understand the amendment. So thank you so much.
Thank you, Representative. Before I hand it off to, I see, well, I'm going to comment now anyway, then I'll hand it off to Senator Anwar. I have to say that I'm a bit conflicted with regard to this proposed amendment. I think part of the problem revolves around the definition of what such an assessment actually is. Is it going to be a significant impediment to completing the rest of the annual physical, which focuses on physical health? My concern is that due to the way medicine is practiced today, where unfortunately we oblige the practitioner to be staring often at a tablet to check off 20 different things as part of that assessment, that they're not actually looking at the patient to the degree they used to in olden days. And that without that kind of assessment, the visceral assessment, they're maybe not able to focus on potential mental health concerns. So that if we don't basically highlight the importance of the mental health assessment, that it will be consigned to the very end or left out altogether. Indeed, the intent of this section is to assure that that mental health assessment happens at least once a year. And if we leave it totally to the discretion of the practitioner, my fear is they'll fall back into the same old habits of never doing the mental health assessment in the first place. So I'm torn. I don't want it to interfere with that critical annual assessment, but I'm afraid that if we leave it totally to the discretion of the practitioner, they will not necessarily change their behaviors and provide even the minimal focus on mental health assessment. So I haven't yet made up my mind. Hopefully the further conversation will clarify it for me. Senator Anwar, followed by Representative Foster.
Thank you, Mr. Chair. In medical school, we learned about something that, and this is old data, that everybody who committed suicide, 70% of those had an interaction with somebody in the healthcare in the recent past. And which means that there were opportunities to have conversations. And maybe there were some opportunities that they may have been seeking help. so that's why it's suggested by my professors that you ask that question whenever you have an interaction, just so that you cover that base. It's just the same concept as was mentioned by Representative Kevros DeGraw mentioned about are you safe at home? It's like a simple, but it covers whole blessing, and it's the same idea. That particular mindset is, I overwhelming majority of the primary care physicians in the United States ask this, or address that in the annual visit. So it does happen, but I do feel that the way the bill is does give us some value, because it's giving opportunity for other conversations and other specialists and other interventions to have a conversation on this. And it's also not defining it in as much depth as maybe needed. So in my mind, in this difficult area, in our passion to prevent some of those things, this is a good idea to do what we are doing. I understand where Representative Pettit is coming, or Dr. Pettit is coming from, and I recognize that, but I think in its current form, the bill should be okay, and I'm not going to be able to support the amendment, and I wanted to apologize to you, Dr. Pettit, but I do understand where you're coming from, and I have deep respect for your perspective as well. Thank you.
Thank you, Senator. Representative Foster, followed by Senator Doherty Abrams.
I hope that this is appropriate to ask a question related to the amendment, but I am curious. This likens in my memory, in my field of research and hunger and food insecurity, there are evidence-based recommendations for every pediatrician to screen and intervene for food insecurity. And it's 2 questions. It takes less than 30 seconds. And the anticipation is that if you ask the question, you could know whether or not a family has inadequate access to food and make an intervention accordingly. I know I have heard that the main resistance to policies like that is that if they're screened and they need intervention, but there aren't an adequate intervention resources, that there's this sort of hesitancy to screen for something that they can't intervene for. Can you talk to, can we better understand what your concerns are with it being required? Do you think that the discretion will be used because there are times when a physician knows it's not necessary to ask and thus wants to save the time? Or are you worried that there might be times where they feel like it's inappropriate to ask the question because they're not prepared to intervene? I think it would help me understand the amendment, if that's all right to ask, Mr.
Through
Chair.
me to Representative Pettit.
Thank you, Mr. Chairman. I think doctors are humans like everybody else, and the people who do this on a regular basis and fairly frequently are going to continue to do it. There's probably some people who rarely do it, and I doubt a change in the law is going to change their behavior. I don't think people don't ask because they don't think they can care for it, because they can make a referral. I think many offices have, as Representative Kevros DeGraw mentioned, have on the sign-in sheets, how you feeling, what are you here for today, any other issues, etc. Some of the mental health point of view if it's an annual exam, but not all have that. I just think this is fairly broad-based. It's nice to say it. I don't disagree with it at any level, other than how are we going to find out that it's occurring? Is there going to be some follow-up to see if there's more mental health? That's a line. Obviously, none of us are going to go look up Connecticut General Statute 370-24 to find 2 lines that says this. If there's no follow-up, what does it mean in general? So I don't know if that answers the question through you, Mr. Chairman, but I think to encourage us and educate is the best approach. And I don't know that, I hate to be cynical, but I don't know if a small change in a statute either way will have a huge impact upon how people approach us. That's really going to be a broad-based public service and now public education kind of approach to the mental health issues we face.
Thank you, Representative. Through me, back to you, Representative Foster. Does that answer your question?
I think it does. I appreciate you weighing in. You've given me something to think about, so thank you.
Thank you. Senator Abrams.
Representative Steinberg. I'm not going to be able to support this amendment because I feel it's my hope that practitioners are already doing it if they think it's clinically appropriate, that they're already making that choice. And so I think that that's been kind of acknowledged from some people who've spoken before me, that this is likely happening when physicians or healthcare providers clinically feel that it should be happening. But sometimes I think this piece of legislation in particular that makes it part of the exam, that makes it more, it gives us at least a little bit, and I understand what you're saying, Representative Pettit, but at least it's an attempt to make it part of a regular conversation that happens at that annual exam. Whether or not they clinically feel that it's necessary, they could be misjudging it. And so I think that a quick check-in really could provide a lot of support to people who need it. So I think that by voting for this amendment, you're basically negating the entire piece. So I will not be able to support that. Thank you.
Thank you, Senator. Representative Pettit, I'm sorry, Representative Dauphiné has a comment or question. Representative?
Yeah, thank you, Mr. Chair. You know, my concern for this bill in general, and maybe it might be specific to the amendment, but what is the liability once this is a law, if a doctor did not pick up the cues and something did happen as a result? I think I'm concerned about what we're putting on the physicians in regard to mental health. And I understand the concern, and I understand that, you know, the gist of the bill is good. I understand we're looking to address these issues, but I just think we're putting a tremendous amount of pressure on the doctors or the practitioners with regard to this. And I don't know if Doc's amendment would take away that liability, but that's what my concern is.
Through me, Representative Pettit, do you choose to comment?
I think the issue of creating liability is an issue. It's probably inherently there. Probably most of the attorneys would tell us. And again, if there's not a way to follow through, if I'm not your preceptor and I can't come through and review your last 20 physicals and see if you've documented there, you know, did it happen? So yeah, I think the framing the liability may be an issue, though I think it's probably there already. Through you, Mr. Chairman.
Thank you. Does that answer your question, Representative?
I think so. I think that's my big concern with putting this, and with in addition to the extra time that it may take. I know doctors are already under tremendous pressure with regard to time. But thank you. I appreciate that. Thank you for the time.
Thank you. I think you make a good point. We fairly continually add more responsibilities on the physician to check off all these different boxes. If it wasn't so important as the subject of mental health, and if it weren't something that sometimes get left behind, perhaps we wouldn't feel so stringent about the need to make this explicit. Representative Pettit, any further comments?
Just in reference to prior comments, I think a little bit apples and oranges. Children are not just little adults, so children certainly are a different clinical situation completely. An emergency room visit for an acute illness or an acute injury is a completely different issue than someone coming in for a yearly exam. So the clinical circumstances are different. When you see somebody for the first time and there's a stress in terms of a significant illness or an injury, you're going to ask many more questions and et cetera. So I'm not sure they're completely comparable. I mean, people's points are well taken, and I guess I still think that the issue in the long run ends up being education of patients and educations of providers to consider the mental health aspects, because without us monitoring every visit, it's hard to know how it's gonna change. So thank you for the time, Mr. Chairman.
Thank you, Representative. Having listened to all the conversation, I'm inclined not to support the amendment at this time, given that it was sort of offered a little bit on the fly, but with all respect to the representative, I'm glad to carry on this conversation should this bill pass out of committee and reconsider it and maybe look at the language, maybe consider some clarity on the definition of such an assessment that might give some comfort, some confidence that it would not be problematic to include in an annual basis. But I will not support the amendment at this time. Thank you. Representative Betts is raising his hand literally. Recognize.
Thank you very much, Mr. Chairman. And as somebody who proposed a bill this session doing exactly this, I've listened to all the sides about it. I think we're all in agreement that mental health is an important component with the physician. But I think the amendment that Representative Pettit put in, I think is probably a good first step to see if there's an improvement and make sure that the physicians are aware of the need to take care of mental health problems without exposing them to the risk of not diagnosing or misdiagnosing. And we all want the same thing. I think that this would be a fair way, as somebody who was a proponent of this, I think this would be a fair way to start it. And if it does not improve or does not meet expectations we're looking for, well, then we can go a step further. But I'm certainly willing and supportive of the amendment that Representative Pettit made. Thank you.
Thank you, Representative Betts. Seeing no further comments or questions, I believe we're ready to vote on the amendment. Just to be explicit, the amendment, if you're in favor of the language change as proposed by Representative Pettit. If you're against, you do not want to make the change to the underlying bill. Could we just have one last time, whether it's the LCO, the administrator, the precise language that we're considering?
Sure, it's in line, let me just see here. In line 59, after patients, the proposed amendment would be to add as the practitioner deems clinically appropriate.
Thank you, Madam LCO. Madam Administrator, we're ready for the vote.
Dr. Abrams,
Senator Darty Abrams votes no.
Representative Steinberg,
Representative Steinberg votes no.
Senator Anwar,
Senator Anwar votes no.
Senator Kushner,
Senator Kushner votes no.
Representative Gilchrist,
Representative Gilchrist votes no.
Senator Wong, Senator Summers,
Senator Summers votes yes.
Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes no.
Representative Berger-Givallo, Representative Betts,
Representative Betts votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes no.
Representative Cook,
Representative Cook votes no.
thank you. Representative Dauphiné,
Representative Dauphiné votes yes.
Representative D'Amico,
Representative D'Amico votes no.
Representative Elliott,
Rep. Elliott votes no.
Representative Foster,
Rep. Foster votes yes.
Representative Foster, I did not see you on screen, please.
Representative Foster votes no. I apologize. I was misstated before.
Representative Django,
Representative Jenga votes no.
Representative Green,
Representative Green votes yes.
Senator Haskell,
Senator Haskell votes no.
Senator Kasser,
Senator Kasser votes no.
Representative Cabras DeGraw,
Representative Cabros DeGraw votes no.
Representative Kennedy,
Representative Kennedy votes yes.
Representative Claritas Dieter,
Representative Claritas Dieter votes yes.
Representative Lenahan,
Representative Linehan votes no.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore, Representative Parker, Representative Ryan,
Senator Ryan votes no.
Representative Scanlon, Representative Tersiak,
Representative Tersiak votes no.
Representative Young,
Representative Young votes no.
Representative Zupkis,
Representative Zupkis votes yes.
Senator Wong, Representative Berger Givallo,
Representative Berger Givallo votes no.
Senator Moore, Representative Parker, Representative Scanlon,
Do we have a tally,
Mr.
Madam
Chair.
Administrator?
Total voting 28, those voting yea 9, those voting nay 19.
Thank you, Madam Administrator. The amendment proposal fails, though I would like to add that this does not mean it's the end of the conversation on this point. Indeed, by having this conversation, it indicates that we would like to talk further about this, and indeed, some accommodation may be made in the final bill. We are now back to the underlying bill. I believe Senator Summers was next up.
Yes, thank you. I believe in section 3 of the bill, it talks about establishing a task force to study the use of a particular compound that is under FDA review right now. It's in, I believe, stage 3 clinical trials. So I'm just wondering what a task force is going to do that's not a medical task force, that has no medical people on it, or designated as clinicians to review a product, with promising results for, severe depression. Why would we be studying something or having a task force on a potential drug that's going through the clearance process of the FDA right now, when, this could be a product that is cleared by the FDA that we wouldn't be in a position to be studying? I don't understand what the task force is supposed to do, because that data would be collected in the clinical trials submitted to the FDA, and upon clearance, a clinician could use it for what it's indicated for. So I feel like we have non-clinical folks studying something that is not even cleared by the FDA, and it just doesn't make sense to me why we're doing that. If you can expand on that, that would
Thank
be
you,
helpful.
Senator. I can start by saying I'm pretty sure that does not mean the committee would be ingesting psilocybin in order to test it on their own. Their objective would not be to do research. But if you're comfortable, I'd like to address the question through me to Representative Elliott, who I believe has a little better insight into this particular clause in the bill. Is that something you'd like to do, Senator?
Sure, but I'm sorry, I couldn't hear you. You said that you weren't expecting people to study it themselves by taking, is that what you're saying?
I'm pretty sure that they would not be ingesting it. That was meant ingest, which is an interesting pun, ingest and I like that. In any case, that was not a
The
serious
language says study.
right.
But so I'm just wondering, what is this non-clinical task force? Because although the appointments could be clinical, if they're not designated as clinical, like what exactly are they supposed to be testing or studying for the use of these, psychedelic compounds? I'm not against this. I'm not against there's some good clinical trials coming out of Johns Hopkins. And, when you look at the FDA review, they're close, they may get approval in the next year or so, but what are we doing studying that? And wouldn't we allow it to go through an FDA clearance process, have it cleared by the FDA with indications for use and side effects, and then just let the clinicians be able to prescribe as required? That's what I'm just confused on what this task force is supposed to be studying.
Well, if that is indeed a question, I will ask you again, with your permission, may I, through me, address it to Representative Elliott?
Absolutely.
Through me to Representative Elliott.
Thank you, Chairman Steinberg, and thank you, Senator Summers, for that question. This is a bill that I introduced this year along with co-sponsors, Representative Linehan, Representative Horn, also working with no longer representative, but McLaughlin, a Republican who resigned his post over this last cycle, and with the intent of looking toward helping folk with PTSD, and not just people who have military background, but also, as Representative Linehan could speak to, also for kids who have had traumatic upbringing as well. And there's a whole host, Senator Summers, as you indicated, of research coming down the pipeline. I would push back against the idea that it is either or, whether or not the state can look at this or the federal government can look at this. I believe we both can look at this issue. I would be more than happy if language were amended on the floor to be more specific in terms of who was on this task force. I don't think that it needs to be anyone other than clinicians. I think it makes sense for it to be clinicians. So I hear what you're saying, and I completely agree that we should have people who are in the field of medicine to be appointed by the various members who have appointing powers on this task force right now. No issue there. And I think that just as looking at what happened with medical marijuana and having a medical marijuana program before the federal government made any big leaps or bounds there, I think we could have something very similar with psilocybin in Connecticut as well. And that is the intent behind this bill.
Through me, Senator Summers, did that answer your question adequately?
It just gives me more questions if I can ask through you to Representative Elliott.
You'll have the floor.
I'm a stickler on this, but are you suggesting that the compounds that are being isolated to help treat depression that are now being reviewed by the FDA for clearance for a treatment for depression in many different indications for use should be something that the state would allow to be used without an FDA clearance? Are you advocating for that? So I'm not really sure what you're saying when this group that is a clinic that would have to be, or you agree should be clinically have a clinical background in this. Like when we start to talk about children and looking at this for approval with marijuana, I see these things as two very different things. If you're going through a clearance process with the FDA as a drug, then that's very different than allowing a state to just, I guess I'm asking, are you looking for this group to approve the use of this without FDA clearance? I'm confused now, sorry.
No.
You, Representative Elliott?
I think those are great questions. I think those are great questions for a task force to be answering.
Back to me, through to you, Senator Summers. You may also want to address any of this to Representative Linehan. She may also have some perspective, but up to you.
So this task force that's going to be clinicians, that's going to be set up, is going to look at this compound. And even though this compound is going through the FDA drug review process right now, and there are clinical studies. I'm confused on that, because if I had a product that was going through for FDA clearance as a drug for indication for use for whatever the indication is, depression, there would not be a parallel path where a state that is not an FDA reviewer would be able to allow a drug to be indicated for use for a particular ailment. It would have to go through the FDA. So that's why I'm a little bit confused. I don't think states have the right to approve the use of drugs without going through an FDA process. And that's why I'm wondering what this particular task force, that's why I'm confused by the task force. And I'm not trying to be a stickler, but it just doesn't make sense to me. You know, you have clinical trials going on with Johns Hopkins and some other very well-respected organizations. And I know that it has been hailed as a potential breakthrough in order to treat depression. And I think we should let it take its course through the FDA. They expect to have approval on it shortly. You know, shortly is within the next year, for the indication for use for treating certain types of depression. Once that compound or drug is cleared for that, any clinician who is a prescribing clinician and has the appropriate licenses has the ability to use that product, quote, off-label, should they choose, with the risks associated with that, for other indications. So I'm just really confused on what exactly this task force is supposed to be doing.
Just to be clear, Senator, you're addressing this as a question or as a comment?
As a question, right?
Elliott or someone else, hopefully not me.
I will happily answer quickly, and then through you, Chairman Steinberg, would happily pass off to Representative Linehan as well. So what I would say is that right now, psilocybin is on the list of drugs. I'm not sure what class it's in. I think it's one of the highest classes in terms of illegality. And states can operate, generally speaking, as they want with that natural state and federal government friction. And so what I would be looking at through this task force is to determine whether or not we could pursue the medical use of psilocybin to treat specific ailments, whether it is PTSD, whether it is depression, or if there are other ailments that a task force could come up with, and answer the questions that you yourself are asking right now. And I think the fact that I can't answer them is why we need a task force. And to me, simply waiting to see what happens with the federal government through that regulatory structure there, it is not something that I'm looking to do. I'm looking to push this forward in Connecticut right now. And if the federal government is able to act before we can convene the task force and have a list of recommendations, that's great. And if not, then it means that we've done good work and we were able to push this topic forward here in Connecticut.
Thank you, Representative. With the Senator's indulgence, would you mind if I also seek the input of Representative Linehan?
Absolutely. I'm really struggling with this because I don't know any other class 1 drugs that can get a state approval, but can't get, that a state can go through this process to allow for the use, but without FDA approval. So I'm just a little confused on what this task force is supposed to be doing. A task force I could see a task force after the drug is actually approved to say, what are the other applications that we could use this on? Let's get the clinicians together that are treating these types of situations that we think may have an application here, but Connecticut is not in a position to be its own FDA. So I'm just, I need clarity on that. And these are, I think, one of the highest level of drugs that were never actually going to even be used in a trial at one point in time. So if somebody can provide clarity on that, that would be helpful.
Thank you, Senator. Perhaps Representative Linehan can illuminate some aspects of this. Representative Linehan.
Absolutely. Thank you very much, Mr. Chairman. And through you to Senator Summers, thank you very much for those questions. And I understand why you have those questions, because this is actually something that's not discussed often. But let me just give you a little bit of background. For those of you who are unaware, psilocybin has been studied, believe it or not, extensively for use of treatment-resistant depression, especially for PTSD, for our veterans, as well as for the intense trauma suffered during childhood that is still being relived into adulthood. There have been many studies that have shown that psilocybin has truly been the only effective treatment, and it has put major depression and suicidal ideation into remission. And so what the FDA is looking at now is actually taking this out of that Schedule I narcotic, which would then open the doors for it to be used medicinally. However, removing it as a Schedule I narcotic does not actually, it does not require the FDA to approve it. In this past, I think it was November, Oregon, through Measure 109, became the first state to legalize psilocybin for mental health therapy. And that psilocybin therapy is also being used is looked at in Oregon during as part of the Aid in Dying initiative, so that they could have a more peaceful transition when they are terminal. So it does not need FDA approval. We can, through this legislation, or rather through this study, look at exactly if we were to determine through the meta-analysis of the data that will be looked at by clinicians and by others, including the Department of Public Health, if then, based on what that information is, does Connecticut want to move forward in legalizing it for medicinal purposes prior to FDA approval? We may not. However, the study does not automatically say that that's what we're going to do. I think it's important, and what Rep. Elliott was getting to, is that it's important for us to get our ducks in a row, because if this treatment is so successful, look at what's been happening with the legalization of marijuana. And I have been on the record hundreds of times stating that I think it's absolutely ridiculous that we have a panel of bureaucrats deciding what illnesses you have to have in order to be approved for medical marijuana. So I think when we're looking at this and we're looking at the real treatment that is available to people with treatment-resistant depression, that if we have our ducks in a row, when the data comes back and other states besides Oregon, maybe Connecticut will decide to legalize before the FDA, or maybe the FDA will decide to lessen its schedule and permit the use for medicinal purposes, then we have our ducks in a row to know exactly how we're going to implement that. So I think that this study is very important in getting us up to speed on the benefits and the implementation. Without it, we're going to once again be years behind and force people in the state of Connecticut to not access the only that could see our residents with treatment-resistant depression, with suicidal ideation, or even our residents with terminal illnesses. So I think that this this study and this task force is extremely important to happen even before FDA approval. And I hope that that answers your questions and lets you know what we believe the end result of this should ultimately be. Thank you so much. And through you, Mr. Chair.
Thank you, Representative. Senator Summers.
You know, I would disagree with the fact that there's a UK-based company that is in the process or almost at the finish line with getting approval. You need to have indications for use for medications. That's a very important thing, because you don't want somebody trying to use a medicine for everything. So you really do need to have it proven and an indication for use on a particular, whether it's PTSD, whether it's, clinical depression that we can't, nothing else is working on, if it's postpartum, if it's, end of life pain relief, if it's end of life depression. So I really do disagree. I think you need to have an indication of use for a particular drug. And if the FDA is going through the process of clearing a a drug that's made from these psychedelic mushrooms, then I would have a really hard time with a state saying, okay, we're just going to let us approve it for this indication, but the Food and Drug Administration is actually going through the process. And, with that comes safety studies and long-term, follow up on the drug, et cetera. And they're very close. So, while on one hand, I can understand that some of these diseases or conditions that people are suffering with, it is being hailed as potentially a breakthrough, but I really think that I would not be able to necessarily support that Connecticut would approve something that is in the approval process of the FDA before they do, because we're not equipped to do that. And it really should have designated clinicians on this review board. And I don't know about this one. This one is a tough one for me, because I really think if it should be cleared by the FDA with clear indications for use. And once that is approved, which looks like it will be shortly, then any clinician who has that DEA license can write for whatever indication that they would particularly want. I see this as a different category than necessarily medicinal marijuana personally, but those are just my thoughts. You've provided a little bit more clarity on the task force and what it potentially could do and or not do. So thank you for your answer.
Thank you, Senator. Your confusion is duly noted, and if this bill should go forward, we'll see if we can address some of the clarity issues that you've raised. Representative McCarty, followed by Representative Zupkis.
Yes, thank you, Mr. Chairman. I'd like to make some comments about the first section of the bill. It's my understanding that the beginning is already in current statute and allows psychiatrists, psychologists, social workers, and family therapists to provide outpatient mental health treatment to minors without parental consent or notification. Is that correct? I have a few more follow-up, but that's the first section, I believe.
Yes, Representative, the language may be a little tortured, but I do believe that's the intent.
Okay, so, and I understand that, and the language in there also specifies that there will not be any prescribing of medications and refers to legend drug. I will go back to that at some point. I'd like a clarification on the legend drug, but what concerns me the most, and I'm a strong advocate for mental health services and helping all of our children, but on the Section C of the bill talks about after the 6th session that has occurred, even if the provider now decides that it would not at all be against the well-being of the minor, they still will not notify the parent. That runs from lines 42 to 44. So I'm a little troubled as to why that section is being eliminated from the bill. I think it makes it clear that you're still protecting the interest of the minor, but now the provider in professional capacity has determined that there should not be a problem. So could someone tell me why that section of the bill has been eliminated?
Thank you, Representative, for the question. I'm not an expert on this. I can give you my conjecture, and perhaps somebody else will choose to weigh in. I believe the intent is to acknowledge that by the 6th session, a rapport and a history has been established between the practitioner and the patient. And at that juncture, there's enough experience and understanding for the practitioner to make that judgment in that context, whereas that might not have necessarily been the case earlier in the relationship, if I've got that right.
I think so, but I'm still confused because there's still, so in other words, could these treatment sessions go on continuously without the parent ever being notified that they're even taking place, even if there's not an adverse impact on the child? I can understand if you're coming from a situation where the professionals believe it would be detrimental, but I'm concerned if there's no cause for that, why the parent couldn't be involved. It might even help the situation at some point if the parent was involved in the mental health treatment. So I have trouble, I honestly have trouble with that section. And then if someone could just tell me what is, it said that in this, I know in current statute, but dispensing any medication, which is a legend drug. Do you recall what a legend drug is?
I confess that I do not know that. I was intrigued as you are. Perhaps our LCO or someone from OLR might choose to weigh in on that subject. I'm not trying to force anybody, but if anybody has an answer, we'll give you a few seconds. Representative, perhaps if you wouldn't mind, perhaps we could come back to that, give them a little bit of time to find the definition or the answer, and then we could entertain some other questions and then come back to you, if that's all right.
That is perfectly fine with me. Thank you for the consideration.
Thank you, Representative. Representative Zupkis, followed by Representative Pettit for the second time.
Thank you, Mr. Chair. And actually, Representative McCarty hit on what I was going to touch base on, and it is the parental consent and not knowing. I know of a family where something like this occurred, and if the family was not involved, it would have been detrimental to the child. So I am really struggling with this part. I think it could be helpful, and the parent needs to know to understand possibly how to better handle the child and the concern. So can you tell me what age does it go down to? When I say a minor, are we talking, what if somebody in school finds a 5th grader or a 7th grader, and somehow this turns into a situation that you have a 7th grader, my daughter's in 7th grade, and she ends up, God forbid, but something happens. What age, when you say minor, are we talking about?
Thank you for the question, Representative. It sounds like another question for our crack LCO or OLR. We have statutory definitions of minors. I can't say I know for certainty, and I'd prefer not to guess. I'm sure that we can get that answer in the very near future. If you're okay, I'm glad to entertain any other questions or comments you have, and then we could come back to that.
Thank you. Yes, one other comment really is to Senator Summers's conversation about the task force. And why would we not just use the information from Johns Hopkins, or I think there was even maybe New York University, I forget what the other university is that's studying this. Why would we not take their information?
Well, thank you for the question, Representative. I don't think that by any means the proponents are suggesting that we should not consider all relevant and reliable information from whatever source. Indeed, that sounds like part of the intent of the study. The fact that they might be going on in parallel, I do not view as an impediment to the study group's work. But I think you raise a good point. They should certainly be considering the input of these experts who are obviously investing a lot of time and energy in trying to get to the bottom of it.
And money, I would say. Time, energy, and money. Thank you. And I'll wait for my reply. Thank you.
Hopefully that will be forthcoming. Representative Pettit for the second time.
Thank you, Mr. Chairman. Just a point of information. Previous reference to the medical marijuana program is actually the Mrs. Siegel is from DCP is the ex officio chairperson. There's 8 physicians on the committee who are all active clinicians. So it's all practicing clinicians who man that committee. And the representative was correct in that, getting back to psilocybin, it remains a Schedule 1 drug with the DEA, meaning it's illegal. And at this point, there's no clear-cut documented medical uses, although they're being investigated, as people have discussed. If it does become available for the use of treatment-resistant depression, PTSD, and other issues, may face the same issues as a Schedule I federally that marijuana does, and that you won't be able to use interstate banking, and purchases may need to be in cash only if it does pass muster in clinical trials and gets approved by the FDA. Thank you, sir.
Thank you. I'm going to afford our LCOs or RLRs. Here we go. Eileen Lawler is prepared to provide at least some insight into the questions of legends and minors.
Yes, so legend drug is defined in section 20-571 of the statutes as a drug required by any applicable federal or state law to be dispensed pursuant only to a prescription, or is restricted to use by prescribing practitioners only, or means a drug that under federal law is required to bear either of the following legends: RX only in accordance with guidelines established in the Federal Food, Drug, and Cosmetic Act, or caution, federal law restricts this drug for use by or in the order of a licensed veterinarian. As far as the question regarding minor is concerned, it's not defined in the section of the statutes that is in the bill. However, more often than not, it's considered to be someone 18 years of age or younger.
Thank you for that, for both those things. I'll start with Representative McCarty. Has your question been adequately answered with regard to legends?
Well, I appreciate, yes, the clarification. I couldn't find 20-571 quick enough. But it does seem to encompass most, if not all of the drugs, but that was my concerns, that the professionals would not be prescribing any drug to a minor child without parental notification. But I think the definition of the legend drug, it seems like that was the intent of the bill. So thank you.
Thank you, Representative. Now turning to Representative Zupkis. Does that explanation of the definition of minor work for you?
Well, I wouldn't say it works for me. I appreciate the definition. It concerns me extremely. You've got a kindergartner. That's extremely concerning. And that's what I thought the definition of a minor was, anybody up to the age of 18. So that, in my opinion, needs to be considered. It needs to be very much thought out on this piece of legislation, because to have a kindergartner, 8-year-old, a 13-year-old in this drug and getting these appointments, these consultations, all of these things without parental consent is very concerning. But thank you for the answer.
Thank you, Representative. And I must say, I do share your concern about the potential ramifications. Perhaps we can look at that, assuming the bill passes out of committee, and make sure we have appropriate safeguards while honoring the intent of this particular section. Seeing no other comments or questions, but hearing some of the comments being a little bit less than positive, I think we're going to have a vote on this one. Madam Administrator, we're ready for the vote.
Senator Darty Abrams.
Senator Darty Abrams votes yes.
Representative Steinberg.
Representative Steinberg votes yes.
Senator Anwar.
Senator Anwar votes yes.
Senator Anwar, I did not see you on screen, please.
Sure. Senator Anwar votes yes.
Thank you. Senator Kushner.
Senator Kushner votes yes.
Representative Gilchrist.
Representative Gilchrist is parked and votes yes.
Senator Wong. Senator Summers. Representative Pettit. Representative Arnone.
Representative Arnone votes yes.
Representative Berger-Givallo.
Representative Berger-Givallo also parked and votes yes.
Representative Betts. Representative Carpino,
Representative Carpino votes yes.
Representative Cook, Representative Dauphiné,
Representative Dauphiné votes no.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott,
Representative Elliott votes yes.
Representative Foster,
Rep. Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Green,
Representative Green votes no.
Senator Haskell, Senator Kasser,
Senator Castor votes yes.
Representative Cavers DeGraw,
Representative Cavros DeGraw is also parked and votes yes. Thank you.
Representative Kennedy,
Representative Kennedy votes no.
Representative Caritas Detrier,
Representative Claritas Detrier votes no.
Representative Lenahan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes no.
Senator Moore, Representative Parker, Representative Ryan,
Representative Ryan votes yes.
Representative Scanlon, Representative Terciak,
Representative Terciak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis votes no.
Senator Wong, Senator Summers, Representative Pettit,
Representative Pettit is a no. Thank you, Madam Administrator.
Representative Betts, Representative Cook, Senator Haskell, Senator Moore, Representative Parker, Representative Scanlon. Thank you, Mr. Chair.
Thank you, Madam Administrator. Again, we will be keeping the votes open for roughly an hour upon conclusion of today's deliberations. We will now move to the next item on our agenda. Item 9, Senate Bill 1087, an act concerning the recruitment and retention of healthcare providers in the state. This is a JFS to the floor. Do we have a motion?
So moved.
Second.
Moved
Seconded by Senator Abram.
and moved and seconded. As we've discussed earlier today, we recognize that the state has some alarming shortages of healthcare practitioners in certain areas, primary care and psychiatry, just to name a couple. And it is our intention to do what we can to improve that circumstance by both attracting practitioners of various sorts to the state and also retaining them once they're here. So this bill requires, rather than allows, DPH to establish a program providing 3-year grants to community-based primary care providers within available appropriations, unfortunately, to expand access to care for the uninsured, and currently this program is not funded. Among other things, this program allows for loan reimbursement. The bill expands the types of eligible providers to include mental health care providers, among others. It also requires DPH to establish a 5-year pilot program to recruit and retain mental health providers at federally qualified health centers, which includes obviously psychiatrists, psychologists, and psychiatric APRNs. The bill also requires the Office of Higher Education, within available appropriations, to administer loan reimbursement grant programs for psychiatrists, psychologists, and psychiatric APRNs who are employed at an FQHC for at least 2 years. Under the program, eligible participants may receive student loan reimbursement grants of up to $25,000 a year for up to 2 years. I'll state that this is a starting point for what I anticipate will be a long-term effort. Unfortunately, as you heard me editorialize on at least one occasion, it's dependent upon available appropriations. And we're hopeful that at least in the short term, with federal funding available, perhaps at least we can get started. But I don't think anybody's laboring under the illusion that we're going to address this in just a year or two. But we feel the need to get started. We're creating access issues in our state for critical areas. And this is a good faith effort, and I'm sure there'll be some other ideas as well to begin to address the problems of shortages in one or more areas of specialization. So we hope we can count on your support for this. Representative Linehan.
Thank you very much, Mr. Chairman, and thank you to both of the chairs for bringing forward this legislation. I wish that I could find the words to adequately express how important this is. And I'll be honest with you, I've never spoken this much in a committee meeting since I've been elected. So thank you for indulging me on this bill as well. But I would like to bring something to everyone's attention. Right now, currently, there are only 64 licensed child and adolescent psychiatrists in the state of Connecticut. 64. And we have been sitting here talking about the need for mental health for our kids and adults since 9 a.m. It has been a recurring theme throughout this committee meeting. I'm going to tell you again, 64 child and adolescent psychiatrists are licensed in the state of Connecticut. And I can tell you from personal experience, finding one of those that can take your child is next to impossible. So of those 64, you need to find someone who takes their insurance. But guess what? A lot of them don't take your insurance. And then if they do take your insurance, then you're on a waiting list. For 3 of the psychiatrists that one of my constituents has been conversing with for their child, they've been on a waiting list for more than 6 months. And then let's talk about if you do find someone, they don't take your insurance and you are private pay. We're talking $3,000 to $5,000 for just 5 to 6 appointments in order to oversee med management, because there aren't many doctors out there who are going to manage medications for mental health. So we are looking at such a severe shortage in the midst of a pandemic where we will have lasting effects outside of the pandemic regarding mental health of both children and adults. So while I absolutely support this bill, my main concern here is that it's within available appropriations. I recognize that federal funding might help us get there in the short term. We need to be very, very serious about what's going to happen in the long term. We have been in a situation for the past few years where in order to pass a bill, it had to be within available appropriations. But I submit to this committee that this is so extremely important that we should be able to put money behind it. And if we don't do it this year, because we believe that we can utilize some of this COVID funding, and I hope that we can, we need to be committed to putting appropriations behind this in the coming years. And so I am very concerned about the phrase within available appropriations for this particular instance. Once again, I'm just going to throw that number out, 64 licensed adolescent and child psychiatrists who can do med management. Think of all the kids. I guarantee if you go to your middle school, you have more than 64 middle schoolers in each of your towns who need to see a licensed psychiatrist. So I just want to put that in the minds of everybody that as we move forward, we need to move forward with money behind this. Of course, I'm going to be supporting this today. I appreciate the good work of the chairs, and I appreciate the support of everybody here, knowing it's within available appropriations. But I do ask you all to consider long-term that this is something that the state should provide funding for. Thank you very much, Mr. Chair.
Thank you, Representative, and for your passion and hard work on this. Yeah, it's all about the money. So anybody who's got any influence with those people on appropriations, stand up for this one. Representative Pettit, followed by Representative Foster.
Thank you, Mr. Chairman. Yeah, it's an issue for kids and adults. The hardest referrals in adult medicine tend to be pain management, psychiatry, and then psychiatry with a dual diagnosis that is someone with, say, depression and a substance abuse issue, very difficult to get people cared for. I just wanted to point out that I think I concur with the previous representative that it'd be nice to have money. Part of that was to try to get this through and start this. When we spoke with the federally qualified health clinics, this started last year in this session that the pandemic closed down. The $25,000 amount was about the differential between what they were able to offer and what people were choosing at other facilities. And so the people cared for at the federally qualified health clinics, those people with less means and people of color and the like had even less access, even at a federally qualified health clinic. And that's why we wanted to start it there with the mental health issues to try to provide as much care as we could. So I agree. I think some of our folks actually have just left for some appropriate meetings. So hopefully we can get some push there and with the pressures that the pandemic has put on. And also it brings us back to SB 238, which is the concerns in terms of the small practices and many people who do mental health are in small practices, and we need to do whatever we can to make it a reasonable place to practice and not put other burdens in their way. So hopefully people consider that this a good bill and we'll pass it forward. Thank you, sir.
Thank you, Representative. Representative Foster.
I'd like to align myself with the remarks of Representative Linehan and Representative Dr. Pettit. I think that in this pandemic, we've seen a shortage of healthcare providers and inadequate access be a challenge for folks in a variety of different fields and inadequately met mental health needs. But I'd like to also draw attention that there are shortages in a variety of fields, including developmental and behavioral specialists for young children. And I know in speaking with constituents in my district, friends and family members, that there are sometimes up to a year wait in those specialties as well. And so when early intervention is key and swift intervention is appropriate in mental health, having shortages of healthcare providers, particularly when your child is in crisis and potentially losing ground in developmental arenas, or when you're worried about their mental health, having to navigate finding a provider and finding one who's covered by your insurance is just an insurmountable barrier that I would love to be a part of the solution and making sure that folks have adequate access to appropriate healthcare providers. So I am in strong support of this bill and concur with sentiments that, of course, we would like to see this funded. So thank you.
Thank you, Representative. I think we'd all like to be part of that solution if we can fashion one. Seeing no other questions or comments.
Can we put this, Representative Steinberg, can we put this on a consent calendar?
Thank you.
We do have one other bill.
Yes, our poor consent calendar has been languishing. Are there any objections to adding this to the consent calendar? If not, we will add it to consent calendar, Madam Administrator. We are now ready for number 10, our last item on the agenda, House Bill 6666, an act concerning the Department of Public Health's recommendations regarding various revisions to the public health statutes. This is a JF to the floor. Do we have a motion?
So moved.
Moved. A second? Do we have a second? DPH is hoping we have a second.
Second.
Thank you. Obviously, there are a lot of sections to this bill, as there are every year from DPH. if you will allow me, I will not enumerate them one by one, but rather entertain your questions as they may apply to it. Are there any questions? Are there any comments? If you just like DPH, you can say that. Seeing none,
Can we add this one as well to the consent calendar?
are you making such a motion,
I
Madam?
am making that motion, yes.
Are there any objections to adding this item to the consent calendar? I see Representative Carpino has raised her hand.
I would like to object, sir.
So we will actually subject it to a vote. And I guess we're ready for that, Madam Administrator.
Senator Darcy Abrams,
Senator Darty Abrams votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers, Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Javallo,
Representative Berger Javallo votes yes.
Representative Betts, Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes no.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster,
Representative Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell, Senator Kasser,
Senator Kasser votes yes.
Representative Cavros DeGraw,
Representative Cavros DeGraw votes yes.
Representative Kennedy,
Representative Kennedy votes yes.
Representative Tardis Detria,
Representative Clarice Detria votes no.
Representative Linehan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore, Representative Parker, Representative Ryan,
Representative Ryan votes yes. After you see my picture. There you go.
thank you. Representative Scanlon,
Representative Scanlon votes yes.
Representative Terciak,
Representative Terciak votes yes.
Representative Young,
Representative Young votes yes.
Representative Zupkis,
Representative Zupkis, yes.
Senator Wong, Senator Summers,
Senator Summers votes yes.
Representative Betts,
Representative Betts votes yes.
Representative Elliott, Senator Haskell, Senator Moore, Representative Parker, thank you, Mr. Chair.
Thank you, Madam Administrator. That concludes the 10 items on our agenda. I think we're now ready for the consent calendar, brief as it may be. When you're ready, Madam Administrator, if you could indicate which bills are in the consent calendar and we will get started.
There are two bills on the consent calendar. Item number 5, Senate Bill 1070, an act allowing advanced practice registered nurses and physician assistants to issue home health orders. And item number 10, House Bill 6666, an act concerning the Department of Public Health's recommendations regarding various revisions to the public health statutes.
Madam Administrator, I believe that that's the one we just voted on.
Yeah, I believe.
Item 10, I believe it's item 9.
Oh, I'm sorry.
Other one on the consent calendar.
I'm sorry.
That's okay. It's been a long day.
And that's Senate Bill 1087, an act concerning recruitment and retention of healthcare providers in the state.
Thank you, Madam Administrator. Just to reiterate, these are items 5 and 9 on our calendar for today.
Would you like to vote? For me to take the vote?
I just wanted you to confirm we're talking about items 5 and 9.
Yes, they are.
Thank you.
Senate Bill 1070 and Senate Bill 1087.
Assuming everyone is clear on this, we may proceed with a vote, Madam Administrator.
Senator Darcy Abrams,
Senator Darty Abrams votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Senator Anwar,
Senator Anwar votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Wong, Senator Summers, Representative Pettit,
Representative Pettit votes yes.
Representative Arnone,
Representative Arnone votes yes.
Representative Berger Givallo,
Representative Berger Givallo votes yes.
Representative Betts,
Representative Betts votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Representative Dauphiné votes yes.
Representative D'Amico,
Representative D'Amico votes yes.
Representative Elliott, Representative Foster,
Representative Foster votes yes.
Representative Django,
Representative Jenga votes yes.
Representative Green,
Representative Green votes yes.
Senator Haskell, Senator Kasser,
Senator Kasser votes yes.
Representative Cabras DeGraw, Representative Kennedy,
Representative Kennedy votes yes.
Representative Claridas Dietrich,
Representative Claridas Dietrich votes yes.
Representative Linehan,
Representative Linehan votes yes.
Representative McCarthy,
Representative McCarty votes yes.
Senator Moore, Representative Parker,
Representative Parker votes yes.
Representative Ryan.
Representative Ryan votes yes.
I did not see you on screen, Representative Ryan.
Representative Ryan votes yes.
Thank you. Representative Scanlon.
Representative Scanlon votes yes.
Representative Terciak.
Representative Terciak
And
votes
second.
yes.
Representative Young.
Representative Young votes yes.
Representative Zupkis.
Representative Zupkis votes yes.
Senator Wong. Senator Summers. Representative Elliott. Senator Haskell. Representative Cavros DeGraw.
Representative Cavros DeGraw votes yes.
Senator Moore. Thank you, Mr. Chair.
One more time, I had to do it. We'll be keeping the votes open for one more hour. That is 3:45 p.m. for all members of the committee to register votes on bills in which they might have missed. Believe it or not, this brings us to the end of this aspect of the committee process. In hindsight, it's hard to believe just how much ground we covered. Even when we disagreed, we had very intelligent, articulate, informed debates on some really, really tough subjects. But we really have honored our responsibility to the people of the state of Connecticut. I don't think there's any time for a victory lap because I think we have to acknowledge so many of our bills need work and we really need to get them ready sooner than later if they're to be entertained on the floor of one or both chambers. And you have the chair's dedication to that. Those of you who have been really, really interested in one or more of those, please don't wait for an invitation to participate and contribute to the improvements of one or more bills that are before us. I will just say that I don't know what I'm going to do without seeing you guys 2-3 times a week. I know I'm not going to go so far. I'm not going to call us family, but we are beginning to rival the amount of time that we spend with our families, at least in recent weeks. So we'll all have to find some other replacement, whether it's Netflix or actually reading a bunch of bills from other committees or picking up a novel once in a while. But we will be creating a hole here that I know many of you are very eager to replace. I do believe my co-chair has some acknowledgements to make.
I do. Thank you, Representative Steinberg. And I will start with saying what a pleasure it's been co-chairing this committee with you. And I think it's no secret the amount of admiration I have for your work. So I thank you so much for that. I want to say first and foremost, though, the person that needs our thanks and gratitude is Beverly Henry, the administrator of this committee, because every one of us knows that none of this happens without Bev. So she is incredible. The way that she's been able to shift to this whole new forum, the amount of work that they've had to do, and they're so incredibly efficient and effective at their jobs that I can't even begin to tell you what they've been through for the past few months. And so every time I think of any good we've accomplished here, I give them the credit because they really deserve it. And along with Bev, we have Alexandra Duristinsky and Dave Ratcliffe, and Cass Furin and Kate Hamilton, all the people who work on with Bev on the team to make things run so smoothly, the wonderful people who we saw letting people know in the very kindest way that their 3 minutes had expired. You know, that's a hard job to do, and they did it with a lot of grace. So I thank them very much. And of course, our OLR staff, Nicole Doobie and James Orlando, you know, they've been at this a long time and their knowledge is incredible. So I don't know how we would function without them, and I thank them for their hard work. And our LCOs, who we have kept incredibly busy and will continue to keep incredibly busy for the next few months. And they never seem to tire. They are so patient with us. And I just thank them so much, both Irene Lawler and Nick Panzarella. You know, they've been incredible. And again, in this very unusual circumstance, incredible amount of patience and understanding and incredibly hardworking. So I just want to say thank you to all of them. I would also like to acknowledge the CTN staff, because we might not realize it, but they've been going in to keep these, these sessions running and get the videos on, and they do such a great job. And without them, being able to keep our constituents and the public informed about our work, wouldn't happen. So I just want to acknowledge their hard work as well. And lastly, I want to acknowledge our vice chairs and ranking members. It's been an incredible group of very smart, dedicated people, and it's just been a pleasure. We agree, we disagree, we throw ideas around, and I just, as I've said all along, I never ever question the intent of my colleagues in terms of wanting to do good work in the name of public health for the state of Connecticut. And I say that to all the committee members as well. I hope that there are things that you're very proud of. I'm proud of many, many, probably all the things that we've accomplished this session. And I thank you so much. It's just such an honor to work with all of you. And for those of you who are new and have only been able to get to know you virtually, I look forward to the chance that we all get to meet in person so that I can thank you in person for all your hard work. And as my incredible colleague, Representative Steinberg said, this is the end of this, but the beginning of us working really hard on many of these bills to make sure that there's something we can all be proud of when they're brought out to the floor. So thank you so much for your work. Really appreciate it.
Thank you, Senator. I must say that it has been a tremendous joy to work with you again this year. We giggle a lot about what we've taken on and we put you all through, but we're incredibly proud of the effort that we hope culminates in some good legislation that becomes law of this state. Before I hand it over to the rankings, I just want to also reiterate your comments. I don't think any of us fully appreciate what it took for the staff to master Zoom in this very specific context. They did it virtually seamlessly. We are so dependent on our OLRs. I just take them almost for granted. They can answer any question I could possibly throw at them. Don't for a moment think that I was that articulate in describing these bills today. I was reading their work in order to summarize. Otherwise, we'd still be here talking. And lastly, the LCOs, above and beyond the call. I mean, it's hard enough taking the absolutely incoherent thoughts of legislators and translating them into language that may become law of the land. And we ask them to do it not only routinely, but real fast on a bunch of different things. And it's just amazing that we are as we are today, and we count on them going forward. So suffice it to say, it's been a ride, and I look forward to continuing it. Representative Pettit, any comments?
Battery may die any second, but I agree, especially Nicole and James. You send the question out about 6 minutes later, the answer comes. Poor Nick and Eileen, questions for the attorney sometimes at 9 o'clock on Sundays, and you get a response right back. Same thing with Mrs. Henry, always there. She made the mistake of giving all of us her cell phone number, so we bother at odd times. So thank you all for your hard work. It's a staggering amount of work, and I assume we've saved a bunch of paper. We not being there, we haven't printed off all the stuff we used to print off, so that's maybe a good thing.
I understand in the interim that we have some late breaking news. First of all, Bev Henry reminded me that we also owe thanks to Cheryl Smith and the ITS staff that taught us and made this all possible. They've also jumped through hoops they probably never imagined that they would go through. And for that, we're very appreciative, because this stuff's beyond me. Lastly, that we have a request that may actually qualify as new business. There's been a request that at this late date, that we incorporate into committee membership on an honorary basis all the cats and dogs that have appeared during our Zoom calls over the session. I know of at least 4 cats and 2 dogs. I probably have lost count at some point. But since they chose to contribute so frequently, if not necessarily any more coherently than us, we should at very least acknowledge the fact that pets play a part of our ability to cope, and we very much have appreciated their input.
I'd like to add to that all the incredible children that I got to see every once in a while come to talk to mom or dad or whoever. And it was always so pleasant to be able to see people's children appear on the screen. So thank you.
Thank you for that. Yes, we always put pets before children, but that's not necessarily appropriate. Without any further comments, we will recess this meeting until 3:45. See you in the funny papers.
Goodbye, all.
Hey, Beverly, can you tell me if I missed any votes? This is Kevin Ryan.
Beverly, I'm here to do my other votes.
Bye, all.
Okay.
See you, Henry.
I was flipping between
Yeah.
2 meetings. I don't know if I missed one in the middle.
You have to raise your hand to
You
get in
missed
line.
Senate
Kevin.
Bill 328, Representative Ryan.
Excuse me?
Senate Bill 328, item
Yeah,
number
that's-
4 on
that's a
the
yes.
agenda.
That's a yes.
How would you like to vote?
Yes.
Thank you.
Thank you.
Are we going in alphabetical order, Bev? Just kidding, just kidding.
You're all set, Representative Ryan. Representative Clara DeStitro, you're next.
Yes, I'd like to change my last vote first before I do my other ones, if that's okay.
The last vote was the.
Not the consent, sorry, number 10, 6666,
Okay,
to a yes.
thank you. You also missed, can we go from the? you wanna
Beginning,
go by
yeah.
the agenda,
Yeah, sure,
568,
no,
item number 1,
no,
6423,
no,
Senate Bill 238,
no,
Senate Bill 328,
yes,
Senate Bill 1083,
yes,
Senate Bill 1085,
no,
Senate Bill 1070. I did get you on that one.
yeah, that was 1070, I think you had, yeah,
Okay,
right? 1070 was, which number was that?
that's number,
1070 was consent.
it was on consent,
1070
yes.
was consent, yeah. Okay, you got me, all of me?
Yes, that's all, thanks.
Thank Beverly.
You're welcome. Who is
Have a good
next?
one.
Yours truly, the Honorable,
The Honorable
Wonderful.
Whit Betts.
the great, oh my God, I look so different. I think, look at me.
Camera angle, Whit, camera angle.
That's right. Ladies are age before beauty. I better go on mute before I get in trouble. Who would you like next, Bev?
I'm gonna take you next. I'm looking to see what you missed.
I think I only missed one vote. It was number 8.
Senate Bill 1086.
What's the title on that? Is that
An act
mental?
concerning mental and behavioral health services. How would
That's
you
a
like to
no.
vote? That's a
That's
no?
a no, thank you. Yep.
Thank you.
And thanks again for all your help. You've been wonderfully patient.
You're welcome.
Please do me a favor and do Representative Cook, because I won't be able to sleep if you don't get her in.
I don't think I missed anything. I just wanted to make sure because I was bouncing back and forth. But thank you for that. I greatly appreciate it.
Okay, have a great weekend.
You too.
Representative Cook, I am checking yours.
I'm sorry, Bev.
That's okay. Representative Cook, Senate Bill 1086, an act concerning mental and behavioral health services.
Representative Cook is a yes. Good thing I waited.
That's it.
All right.
Representative
Thanks,
Cook,
Bev,
yes.
so much for everything, and thank all of the rest of your supportive staff. Greatly appreciate your help.
Thank you. Representative Gilchrist, you're next.
Happy Easter, Bev.
I just wanted to also check to see if I missed anything, Bev.
I'm checking, please.
Thank you.
You're welcome. I don't have you missing anything.
Okay, wonderful. Thank you.
You're welcome. Who is next? Senator Summers, how would you like to vote on Senate Bill 1083, an act concerning various revisions to public health statutes?
Yes.
How would you like to vote on Senate Bill 1086, an act concerning mental and behavioral health services?
No.
How would you like to vote on the consent calendar?
Yes.
And House Bill 6666, an act concerning Department of Public Health recommendations regarding various revisions to public health statutes.
Yes.
Thank you.
Thank you. And thank you. You are a rock star. I don't know how you managed to do it this session. You need a vacation. Thank you.
You're welcome. Representative Foster, you're next.
I don't think that I missed one, but I might have.
I am checking. You're all set.
I thought so. Thank you.
Senator Anwar, are you still here? Representative Parker?
Thanks, Beth.
Representative Parker, Senate Bill 1085, an act concerning suicide prevention.
Yes.
Senate Bill 1086, an act concerning mental and behavioral health services.
Yes.
House Bill 6666, item number 10 on the agenda.
Yes.
Thank you.
Thank you, Bev.
You're welcome. Senator Wong? Senator Wong, are you here? You're all set, Representative Parker.
Senator Anwar here. Just wanted to make sure I did not miss any bill,
Okay, let me check for you, please.
any votes, sorry.
You're all set, Senator Anwar. You're good.
I'm good.
Yes, you are. You're welcome.
Hi, Beverly. Hi, Beverly.
Hi, how are you?
How are you?
I'm good.
I'm not sure how good I'm doing this 3 different meetings at once.
You're doing fine.
Oh, you're doing it. Thank you so much. I didn't get to say the acknowledgement, but I guess an Appleton rum may have to do next time I see you.
Okay, you missed Senate Bill 1083.
Can we just go from the beginning? Obviously, 1 I did vote on.
You want to go through the agenda?
Yes, please.
Item number 1, Senate Bill 568, you voted no.
Okay.
Item number 2, 6423, you voted no.
Yes, ma'am.
Item number 3, Senate Bill 238, you voted no.
Correct.
Item number 4, Senate Bill 328, you voted yes.
Yep.
Item number, 1 moment. Consent.
Well, number 5's on consent, right?
Number 5 is on consent. Do you want to vote on that, or you want to wait to the end?
I can vote on the consent, but just let me know which one's on consent, if I may. Well, yeah, I'll wait. How about that?
Okay. So Senate
Number
Bill
6.
1083, that's item number 6. You need to vote.
Yes.
Senate Bill 1085, item number 7, you voted yes.
Okay. On number 7, I voted yay, right?
Yes. That's Senate Bill 1085, suicide prevention.
Okay.
On number 8, Senate Bill 1086, you need to vote.
1086.
Yes, and that concerning mental and behavioral health services.
Now, were there verbal amendments inserted?
Representative Pettit offered an amendment, and the amendment failed.
Okay. Let me go back to that, all right?
Okay.
So number 9.
Number 9 went on consent.
Okay. Number 10.
House Bill 6666, you need to vote.
All right, I got to think about 10. Let me go back to 6. Can I go to item 6, Senate Bill 1083?
Yes.
Now, I know Dr. Pettit is a yes, but then it's all over the place. But what was Senator Summers' vote?
Senator Summers voted yes.
Okay. So I am a yay.
On 1083?
1083, yes.
You had already voted.
What did I vote?
Yes.
Okay. See, there you go. See, I knew it. Okay, so then we'll go back to number 6, which is the complicated one.
You voted yes on number 6, which is the various revisions to public health statute.
Yes, okay. And so number 8, I am a no.
And number 8, that's 1086.
Yes. 1086, my vote is a no.
Okay, it's recorded.
Okay, and number 10, 6666
Yep.
is a yes.
And the 2 bills in consent are number 5 and number 9.
Yep. Yes, ma'am.
Thank you.
Thanks.
Thank
Do you see
you.
us going back to the building anytime soon, ma'am?
I have no idea.
I don't know if anybody's ever said this, but your backdrop is beautiful.
Thank you. Just to let you know, it's not real.
No. Is that right?
You're joking, right?
No.
Yes, it's not real.
Oh, Beverly, I gotta tell you, I bet you if you take an unofficial quiz, most people would say that looked incredibly real. Look, people know that dome isn't real behind me. They called me the giant, you know, kind of over the building, but your backdrop looks great.
Thank you.
You should just tell me it's just beautiful.
Thank you.
Hi, Beverly.
Okay, bye. Have a great day.
Hi, Beverly with a Beverly L-E-Y.
Thank you.
Bye, thank you. Am I the last one?
No, Senator Moore is waiting on me. And I
Bye,
have to
see you later. Bye.
Bye.
Can you hear
Senator
me?
Moore?
Yeah, I'm
Hello.
running at the same time, so.
I know. Let me find what you need first.
In design right now, so Eric is working.
You missed Senate Bill 1086, an act concerning mental and behavioral health.
I'm a yes.
You missed House Bill 6666.
Thank you, Representative. I see Senator Henry Martin, ranking member. You have questions? Okay, I'm back. Can you hear me?
Okay, House Bill 6666, that's the DPH revisions bill.
That's what?
That's number 10 on the agenda, the Department of Public Health's recommendation bill.
Oh, I'm a yes.
And then we have the consent calendar.
I voted on that, didn't I?
Nope.
Or no? Oh, okay. I'm a yes. I know what's in it.
Okay, great. Thank you. You're
And
all
so I
set.
heard that's a backdrop and you would have never known it. I was gonna compliment you on your organization.
Every
Okay.
time we have a meeting, I'm like, folks are texting me, I love your study, I love your bookcase. And I'm like, it's not real.
Wow, I wouldn't tell. I just take the compliment.
Okay,
Oh,
thank you.
Take care.
Thanks. Have a good evening.
What time did the meeting end?
It's not ended yet. We have to
No,
wait an hour.
What time did you recess? Do
I
you know what?
wasn't paying attention.
Okay, I was just wondering how much I missed. All right, I'm sorry. I had another meeting I had to chair.
That's okay.
2:45.
2:45? Okay,
Yes.
thank you.
You're
Bye-bye.
welcome. Have a good evening.
You there.
Representative Scanlon?
Hi, Bev.
Hi. Senate Bill 1086, an act concerning mental and behavioral health services.
Yes.
I think that's the only thing you missed.
Okay. Thank you. Have a good day.
Bye. Let me check. Oh, he left.
I think that was it. I think that was it.
Okay, you don't have to whisper. Yes, it was it. I just got this stuff. Thanks.
Yeah, what good is whispering gonna do me when it's being recorded?
Okay, we are going to. We are not going to send the bills upstairs. I have to confirm before I make that decision until Monday.
Hello. Is anybody there?
She'll be right back.
Okay.
Hi, Representative Elliott. How are you?
Hi.
Senate Bill 238.
The chair was a yes on the 3 bills I'm voting on, correct?
Huh?
Chairman Steinberg was a yes on the 3 bills I will be voting on that I missed.
He voted yes on everything.
I'm a yes on everything.
Okay, but that's one. So House Bill 6666, you're a yes?
Yes.
And on the consent calendar, you're a yes.
Yes.
Thank you.
That it?
That's it.
That was easy. Thank you so much.
Thank you.
Hey, Bev.
Hi, give me a moment, please.
Take your time, no problem.
Hi, Senator. Senate Bill
How are you?
238.
Senator Haskell votes yes.
Senate Bill 328. An act
Senator
concerning
Haskell
provision.
votes yes.
Senate Bill 1083. Various revisions to public health
I'd like to vote
statutes.
yes.
Senate Bill 1085. An act concerning suicide prevention.
Yes.
Senate Bill 86, an act concerning mental and behavioral health services.
Yes. Yes. Sorry. The video had to catch up, I think.
I know. And House Bill 6666, item number 10 on the agenda. An act concerning various revisions, Department of Public Health recommendations regarding various revisions to public health statutes.
Yes.
And how would you like to vote on the consent calendar?
I would like to vote yes on the
Thank you.
consent calendar.
Thank you.
Thank you so much, Bev. Have a great day.
Same to you.